너 또 다른 세상을 만들어주는
कहाँ रह रहे हैं? फैमिली रमजान में आएंगे तो कोई जाते हैं तो ईद यहाँ करेंगे
morning, my early risers. How are we doing this morning? Yay, great. Oh, we're having photo opportunities already. I love it, I love it. So, not the greatest turnout for this morning's first panel, but you know what? We have to respect everyone's time, and we are going to start with our first panel discussion very shortly. I would like to take this opportunity to introduce myself to you if you have no idea who I am. My name is Maxine, and so many of you come up to me and ask me, where are you from? I cannot figure it out, blah, blah, blah. I'm from South Africa, Johannesburg. Yeah, the not so great part. The not so great part. If you've ever been to South Africa, you know that Cape Town is where it's at. It's beautiful, yes. See, I love it, I've been there. Yeah, Johannesburg, not so much, not so much. All right, it's an absolute pleasure to welcome you to the third and final day here at the Health 2.0 conference. I'd like to give a special, put this down because I'm not that tall. See, I try to add some height today. It's all right, that's just between you and I. So I also want to take a moment to express our sincere gratitude to our valued bronze sponsor, Lifespin GmbH, for the support and partnership, which have been crucial to making this event a success. Now, our first panel is going to be discussing the intersection of medicine and innovation that involve the role of physician innovators. I'd like to welcome the moderator of the session, Dr. Nikos Chatzibalasis. I got that right? Yeah. Dr. Arun Castro, Dr. Hitendra Singh Tanwar, Wissam Yassi, MD, Dr. Alexander Filipovic, and Yvonne Schimmel. I'll go find him. All right, so your mics are live. Just pick them up and start talking. And the stage is yours. I'm going to go find Arun. Maybe he ran off to the bathroom.
Good morning, everyone. It's a pleasure and a privilege to be here among you. And it's a better privilege being among these people. And we have Dr. Arun is missing. We're waiting for one more in our panel. So we are speaking about innovation in medicine and how we can make things better for practitioners and mainly for the patients. So let me start by presenting our beautiful panel. And I will start with this dear friend from the Netherlands, and I would like him to present himself and talk about the nice things that he was researching and he is innovating with in cardiology.
Thank you very much, Nikos. I hope this is on. Good morning, everybody. Selected public. So we love you already. My name is Wissam Yassi. I'm an imaging cardiologist based in the Netherlands. So my daily bread and butter is advanced cardiovascular imaging with CT, MRI, and echo. And I caught a virus during the COVID, which wasn't COVID, but it was innovation. And it started because of the need in the clinic. And that's why actually that ignited my endeavor to innovate and by creating an app in which we can monitor the patients from a distance, a telemonitoring app. So this is in short my story.
Yes, it's a lovely story. And you know, something always inspires you and you can create miracles. So if we can please ask the next doctor to present himself, I will be delighted.
Thank you, Nikos. So I'm Dr. Tanwar. I'm an emergency medicine physician, and currently I'm working in Southeast London Trust as a clinical director for urgent and emergency care. I think so innovation is, something which is very crucial at the moment because it's a very complex healthcare. Post-pandemic, we have seen, the surge in the walking in emergency as well as the ambulances. In spite of our reallocation of sources, a brand new ED, we could not cope. And then we thought we need to work differently. and then we use technology as a catalyst. So we develop a new software. We were using the past, but it's like, you go to the radiology section first, then you go to the clinical section, then you go to the vital pact, to see, and nothing is connecting. I call it data silos, yeah. So basically, I'm not getting any alert. So what we did is that we speak to the GP networking, we speak to our CEO and CO that can we have a 3 interface, which is like a data from the GP, so we know the background, and then data from the hospital, everything on a one page, and then we connect it to the ambulance services, which is independent. So we know that how much burden we are having, what is our priority, and we could do the electronic triage rather than doing triage in the emergency. And that's how we launched the new SPOA, so that's a single point of access. And I think that brought a brilliant change in the healthcare, especially for the front door. That's my story.
That's very nice. That's very nice. We want to have more information about that. So I would like also to present Dr. Alexandra, who I'm a great fan of her. And please, Alexandra, tell us something about your side and your innovation.
Thank you, Nico. Good morning, everyone. Thank you for being here with us this morning. My name is Alexandra Filipovic. I'm a medical oncologist at Imperial College London, and I'm the head of oncology at a Boston-based clinical stage biopharma company called PureTech Health. The innovation for me also penetrated fully during COVID, at the onset of COVID. And the way it manifested for me is an awareness that struck me one day in clinic, just before I called my first patient in. After nearly 2 decades of doing this work, I walked into the clinic that morning, and all of a sudden, something was different. And the feeling that I had was that it was no longer enough to just give patients a prescription, a blood test, and a scan result. I felt that I needed to start offering something more. And what that looked like was my desire to start training in holistic care, and the innovation that is now embodied and is in practice is the integration of medical care as we know it and whole body intelligence.
That's lovely. And in fact, I'm very happy to see that in this conference, both days, we were speaking about holistic approaches. So seeing someone like you with this background speaking about holistic medicine makes me feel great scissors. So I will have to tell you about my background, and I would be delighted to speak with you about what really holistic medicine stands for. But now, I would rather introduce my other colleague and a good friend, Yvonne Schimmel. Yvonne, can you please introduce yourself to the audience?
Yes, good morning, everyone. My name is Yvonne Schimmel, and I'm from the Netherlands. I'm a holistic practitioner, so indeed holistic. And that is so important that we treat the patient as a whole. It's not only physical, it's not only mental. You have to look at the whole picture. And I'm also a nutritionist, so it's so important to look at the nutritional part of health. And I kind of miss that here in this conference because it's so important to look at the nutritional side of it. I'm also an intuitive coach, and then you come back to the holistic approach. It's not only that you have to look at the facts, but only see what's going on with someone, what's their trauma in life, what's emotional blocking them. And with being an emotional or an intuitive coach, I can look at that. Next to that, I am an author of a #1 bestseller, co-author with the famous Marie Diamond. And I just published my own book about nutrition, Eat Well and Uncover True Health. It's a book about the facts about nutrition, the do's and the don'ts, and the myth about nutrition, what they all told us, what is not true. So a lot of lies about nutrition, and that's very important that we get aware of it. Next to that, I work with a Dutch company who does DNA research, and I think that's also one of the tools that will help us to a better and quicker diagnostic. And of course, I'm working together with Nikos. And we use a body scan, a medical device, and I'm already working with that for the last 10 years. And it can be so easy to diagnostic someone with a medical device. Often it happens that the people go to the regular doctor and they give you a medicine, and then that doesn't work. They send you to the hospital. They have no clue. And then that patient comes to me. And then often with a nutritional help to change their diet, or give them supplements, or even just listen to them. What's going on in their life? What is it that they're feeling? And that is something that we have to educate the doctors, that they have to listen better to their patients.
That's very nice, Yvonne, and maybe that's the philosophy. And speaking about oncology, we have in the past we have a very nice talk with Alexandra. And although this is a danger zone, there is a big gap in oncology. And I listened to the panel yesterday speaking about oncology and holistic medicine. The fact is that doctors in oncology leave the patient after they finish the whole protocol with nothing. The root cause of cancer is usually based in toxins, in toxicity, and genetics. But when we finish with treating the doctor, even if he's operated, or even if he's going through a chemotherapy or any other treatments, nobody ever cared about his mental status, his depressions, the toxicity in his body. He is even worse because he's gone through a shock. So if we want to have a good prediction for this patient, it's a must that we can do something holistic, removing the toxicity, improving his mental health, his emotion, and his energy field. And that's something I'm going to talk about later. So finally, I will introduce my friend, Dr. Arun. He is a doctor that you would like to live with him, work with him, because when he will tell you what he's doing, you will be impressed. Please, Dr. Arun, if you can present.
Morning, everyone. My name is Dr. Arun Castro. I am a tour doctor. I work in performing arts medicine. So I work with agents, artists, and production companies looking at optimizing the health of their teams. So it's about a holistic approach, looking at those that are on stage and those in the back supporting the show, and optimizing their health before performance, during performance, and then after. So a big shout out to our production team. You guys have been here all week, working, unsung heroes, working 12-hour days at least to put this show on. And really, my company, Rody Medic, borrows from sports medicine. It borrows from principles of prevention in terms of physiotherapy. We look after musicians with their guitarists and their musculoskeletal repetitive strain injuries. We help vocalists with vocal health coaching beforehand. And then we also have a proposition where on tour they can use our telemed app to get access to a doctor, because one of the problems in the field is lack of continuity, lack of access, and lack of bespoke care from people that understand the nature of the music industry. So essentially that's the journey that, starting out as a doctor working at various festivals in the UK, 26 over the last 6 years now, I could just see there was an unmet need amongst that group. And the more and more I thought about it, and I just love being around music, and I love being part of the scene, I just thought I have to do something. And for me, I guess that's where my innovation story comes from, is just seeing how do we meet that unmet need. And we'll get into the problem a bit later maybe, but yes. Back to Nikos, so that's me.
That's amazing. You see, everyone here has its own story of his innovative pathway. And I would like to present also myself. I'm Nikos Hadjibalassis. I'm a naturopathic doctor. I have trained in different modalities for many years. I have a PhD from Switzerland based on my research on the human biofield and the interaction in complementary medicine. And I have some studies in homeopathy and a postgraduate degree in homeopathy. But The thing is that through my experience with thousands of hours of assessments, I realized that holistic medicine is the only approach. And the thing is that we are talking about a revolution of technology and artificial intelligence. And this is very important, the digitalization, AI. But if we do not come to a point to realize that the biggest revolution of this time is the revolution of awareness. The last decade, people are becoming more and more aware that something bigger than their physical body is here. And the thing is that this awareness is projected to the need for holistic medicine. If you can see the statistics, in the United States, I have a presentation, but I wasn't able to present it. Only in the United States, the turnover of holistic medicine was something about 150 billion in 22, and they expect it to triple in the next 5 years. So you see, the market is demanding for holistic medicine. So the institutes, medical institutes and medical doctors must target in holistic medicine. And if you want to be targeted in holistic medicine, you have to be trained properly. So there are different levels to approach this subject. The first is who is going to train holistic doctors and what is his background. And the second thing is we have to make some structure, because when we ask what is holistic medicine, a doctor will reply it's something like we treat body, mind and soul, we treat the emotions, the mental, but they do not really know what's the soul about. And because I want to put science in everything, I connected what we call soul with a human biofield. So the human biofield is the energy field that it's similar to your physical body, it's connected with everybody. This is part of a big research for many doctors all around the world, which I have the privilege to connect with our academy. And the research of the biofield is so vital because that's where the disease is primarily manifested. So if we can see the texture of the biofield and we can understand that all the emotions, all the mindset, the thoughts, all the database, all your trauma is allocated first primarily there and not in your brains, then you will start researching about very old therapeutic system from Hippocrates, from Aristotle, from Chinese traditional medicine, from Ayurveda, and you can see the wisdom. So what we are doing is we have created an academy that would like to become a hub to connect all the doctors that are doing the research all around the world, a hub that will train doctors. On the first level, we created a protocol to support a doctor make a better diagnosis so he will find the root cause behind its disease. And this protocol connects different therapeutic modalities where we provide the essence, not the training, because a few training for homeopathy will take 5 years. But we will provide the essence of homeopathy, the essence of traditional Chinese medicine, the essence of herbal medicine, the essence of psychology, because we want doctors to have a better emotional intelligence and know how to approach their clients. So we have a core training for doctors providing different courses, the essence of different courses, and we will guide them how to take information from homeopathy and see what's the indication of the personality of their client, of their patient, how they can get some connections, energy connections from traditional Chinese medicine. And this is the core training. And after that, we have doctors presenting their research and providing their own trainings. We have a doctor from Germany providing a research and a training about autism with frequency medicine. We have the privilege to have Dr. Alexandra with us, and who is providing a course about oncology. We have a doctor working from Greece, and he's done a great research providing a course about quantum medicine, and he connects this information with ancient philosophy from Aristotle, Plato, and Hippocrates. We have a doctor doing a great research in frequency medicine from Russia. They have a very big tradition, and many, many other people that we connect. So you are welcome to communicate with me. Maybe you can be one that will provide the course in the future in the academy. And after that, the second part is that the academy has a humanitarian and philanthropic philosophy. We want to be able to fund our non-profit organization, which will create communities. We will support communities. So it's a two-level company. The first is train doctors in a really humanitarian project, connect doctors, and finally offer back to the humanity. Sorry, maybe I took too long of the time from my speakers, and I'm very sorry about that. So I want to go back to my dear Wisdom. So my dear Wisdom, please let me know what you are offering. How do you think it's going to improve the job of practitioners? How you can improve the medical environment?
Nikos, thank you for that question, because what are we doing as a physician? Physicians in general should participate and improve our patients' health if we're going to innovate. So the innovation, what happened during COVID, what started ignited by the need of the clinic. We developed, together with my actually best friends, they are top-notch technicians and developers, an app called Medcore for You, which is, we needed to devise a name, Medcore for You. So from being a cardiologist, I thought, well, a medical doctor, a cardiologist for you, to be a vendor-independent app in which we give the patients with certified devices, and we can monitor patients at home or maybe even on vacation, on a distance. We can monitor the blood pressure, heart rate, weight, and recently we introduced even the whole flow spirometry for patients with severe asthma or COPD, and we integrated also a modality, a new technology to detect atrial fibrillation or rhythm disturbances, all in one app. So the idea behind it, we give it to a different group of patients. They do not need to use different apps for a different disease. We connected the app, we can connect the app to their health professionals. So an EHR of the hospital, I don't know if you know Epic, it's also used in the UAE and many parts of the world. So the app is directly connected to Epic, in which the doctors and the specialized nurses directly can see the progression of the blood pressure, heart rate, weight, and their vitals. And this way, we tested also in the Netherlands. We reduced from a very simple test only by the idea of telemedicine. We reduced the time of contact per contact 30%, and we reduced also the time or the numbers of physical visits about 25 to 30%. I'm happy to tell you we tested that in advanced heart failure into hospitals in the Netherlands, and the feedback from the patients, it was really overwhelming, 8.8 of 10. And one of the things, the quotes we got from the patient, we got a bit emotional. Some of the patients said, I got my life back. I can do that on vacation. I don't need to go and visit the hospital that frequently. This is from the patient experience part, but from the medical part, I don't know if you know about heart failure. It's 1% of the adult population worldwide. So it's in the millions. And we need to prescribe certain medication, which we call them the Fantastic Four, just like the movie. But there are 4 different groups of medication, and we need to titrate them in a very short period of time. The current practice, it would take us about more than 90 days to do that, and maybe 6 months or a year. With using telemedicine in the right way, we do that right now within almost 12 weeks. So this is one example. And today, I think yesterday, one of the biggest non-academic hospitals in the Netherlands, All VG, they are using our technique to monitor patients with advanced asthma. They are using young patients, using biologicals, which means they should come to the hospital quite frequently just to do the spirometry, to assess the treatment. And right now, we've provided the technology in which these patients, they can do that at home as many times as they want, in very simple details, but at the back end, the doctors or the specialized nurses, they're going to get the whole data set with the whole curve. So these are only two examples. And the third one is the integration with the atrial fibrillation detection. If we are talking about the pandemic, we had the COVID, but one of the new pandemics is atrial fibrillation. We should be very keen on treating that with the all risk factor package. So weight reduction, blood pressure monitoring, and early detection and treatment for atrial fibrillation. Because if you don't treat it, you're going to get like stroke and comorbidities in which the quality of life is going to be reduced. So this is why, you know, we introduced the idea actually was born, and I'm happy to say it's implemented in 4 hospitals, the Medcore for You app.
That's very nice, Wissam. I believe conducted with Wissam will be a great opportunity because, you know, he's a fighter and all his life, and he's a dreamer. So he puts a target, he's focused on that, and then he succeeds. And that's why I believe he has a very humanitarian aspect, and he will be very successful.
Thank you very much, Nikos.
Let's go to Dr. Singh. Now I will not forget your name. Please, Dr. Singh, what are your expectations, and what do you have to offer to the medical community that will make people's life better?
Yeah, no, absolutely. I was listening very carefully because wearable devices has made a great change in atrial fibrillation. So similarly, you know, on the front door, before this interfacing of 3 application and 3, it's not application actually, it's a interface of 3 network, primary network, hospital network, and the network from the diagnostic. It brought a big change. So we constantly fight with the number of ambulances. It's a daily firefighting for us. We cannot generate enough resources to tackle the aging population. We know that Western world is fighting the aging population. And as you say, for simple test or monitoring, they just, you know, they don't know where to call, and they come, and then we have a crowding in the ED. So the impact is worst for the patient who is really sick, okay? And don't forget the hospital-acquired infection, especially in the aging population. Imagine a clean cardiology patient coming and waiting in the emergency with the sepsis, you know, around, and they get the hospital-acquired infection. It could be C. diff to the anything which is probably not good for any intervention. So considering these things, that how to triage before they reach the hospital, and this was our idea to leverage the data available on the, you know, platform, like we were using the operational AI applications, and we thought, oh, it's never gonna change crowding in the ED. Corridor care started after the pandemic. But after this technique, what happened is that we can treat at home, and I think this is the concept new for long-term plan, that treat patient at home if it is possible. By the presence, there are already enough skilled physicians, advanced care practitioner, GPs, take help from them, treat them. Nobody wants to come to the hospital and wait for 17 hours for small things. If it is a blood test, hospital at home. We incorporate a hospital at home. We spoke to the community frailty team. We made a lead. It's a $4 million investment there. We created community same-day emergency care, routine blood tests, even including the troponin CRP, which can detect. It's just a simple pneumonia or it's a sepsis. Do you really need to come to the hospital? And it's going through the telemedicine. We have a camera, body cam on the ambulance crew. We can do the POCT, point of care test there. We can do the ECG. We can detect the arrhythmia if it is like something serious to come back. And then impact is huge. 45 to 50 ambulances every week. We can stop, we can treat them there. And this is not only the treating at the site, you know, where they, like, it could be nursing home, it could be residential home. They're really very difficult to bring to the hospital. So that's not the only thing. We have a 5 days follow-up or monitoring. That's a better care. Even if you come to the hospital, we can guarantee you a bed, that's it. And then you go to the different specialty, and then you get maybe fall for a dementia patient. So I'm just giving you some examples of how we brought change to this aging population with the comorbidities, treating respectfully, dignity, and everyone wants to be treated at home in this age. Second thing, for our team, burnout is very common in urgent and emergency care. We cannot create a lot of emergency consultant, emergency doctors. I can't create even nurses, because this takes a lot of time to train, educate them, and make them, apt for the UEC. It's a different way of working. So for them, I think we did a data analysis. After launching this project, we could save trolley times and 32% times more spending on the real patient. Like patient with a myocardial infarction, they are going to the cath lab, patient dying with a sepsis, pulmonary embolism, aortic dissection. So our mortality suddenly start going down in a favorable. So that's the impact of technology, and that's the impact of any idea you conceive, and then you just get the unmet need turning into a viable solution.
That's very nice, Dr. Singh. And that's the point where I would like to also speak about prevention. Because for me, primary care is prevention. And as I told you, the disease is first manifested in your biofield. And because in your biofield we have all the trauma, the experience, your mindsets, we have to find a way to discover where is the blockage. And there are many researches from my colleagues, professors, where they see that the disease is manifested to a certain point of your body, depending on the quality of the energy field. So we have technology, and we also are willing to make more research to find a way to prevent the disease before being manifested to the physical body. So this will take a lot of load from the health system, but it also will not make people going to the condition to become sick. It's just a click in their mind, but they have to discover where is the click is. So I would love to ask Dr. Alexandra to tell us about her philosophy, her innovation, because what she does, I'm a great admirer, and I will be delighted to hear more.
Thank you, Nico. Yes, well, as I mentioned in the introduction, really the innovation that wanted to come through was a remembering that mind-body is one word. And then training to embody that and to practice that in the oncology clinics. But I wouldn't mind for a second zooming out a little and really looking at the topic at hand, which is medical care and physicians as innovators. And if you take a moment to just sit with these two words, physician, innovator. Often, at least I'll speak for myself, when I was in medical school and when I started practicing, these two words didn't go together. I didn't know how to be an innovator. I didn't know what innovation meant for me. I also didn't know that I had permission to innovate. And my journey ultimately to bring forth the innovation that decided that it wants to come through me really was a journey of getting to know myself and giving myself permission to know that I am an innovator, but also to hopefully carry this message forward and give others that same voice, that each and every one of us are innovators in our own ways. And innovation can be small steps. Innovation can be Tesla and Elon Musk. And they're both equally important. And something that I had to sit with personally as all of this was unfolding was I had an identity attached to being an oncologist and a drug developer. And all of a sudden, here I am on what it looked like the other side, bringing holistic care. And it took me about 3 years to come to a place where the two are one. And at a place where 1 + 1 = 1,000,000 and doesn't equal 2, because it amplifies. And how do you know that that innovation is right? How do you trust that voice? Because it lights you up inside and it serves. And so really that's the zoom out that I wanted to just offer for a moment and give that perspective of, yes, physicians are innovators, physicians can be innovators. There's examples here, and it just so happens the 6 of us are here today on the stage, but it could be any one of you. And the innovation comes in various different ways. It can come simply by choosing to ask a different question in your clinic, and it can come through developing a novel method to streamline your services, developing an app, and caring for performance groups.
Unmet groups.
Unmet
meeting the need of
groups,
unmet
exactly.
groups.
So it can look every one way. So removing that stigma around what innovation is and what it needs to look like, I feel for physicians is really important.
Yes, totally agree. I believe you have to think outside of the box. Otherwise, you will be doing the same things for all of your life. And that stands for humanity also. So people that question and want to see, can I do it better? This can be an everyday challenge. The way from your home to your job can be a challenge to change it and find a better way. So that's what the innovation stands for me. But I will ask Dr. Arun here to speak about his part and his innovation, and I will finish with.
Yeah, I suppose for me, the innovation came about because of need, and it was commissioned by bands and agents themselves. I happened to be a doctor working in their space, and they said, well, we really could do with some physios. We're 45 dates into this run of 90 festival dates or 90 stadia shows, and we're all aching. We've all been traveling in economy, we've not been sleeping, we've got jet lag, we've got muscle tension in our necks, our backs, some of us have sciatica. Can you put on a physio clinic for us? So I said, when do you need it by? And I think it's taking those kind of risks or stepping out of your lane a little bit. That's where the innovation came, I think. So the more time is spent in that, and I think, well, what do these people need? They need continuity. They need someone they can trust. They need access. They need someone who's relatable, who understands their work-life balance, someone that understands the friction of leaving family to then go on a 90-day tour, the entry friction, the exit friction. So it's not just physical health alone, it's psychology and their social well-being as well. And then the more I got to think about it, it's like, well, how can we provide a one-stop shop, with Roadie Medic, this service for the touring community? And it's like, well, they have problems with noise-related hearing loss. So go and reach out to some audiology companies. So Oscilla in Denmark, they've given us a bunch of portable audiology screening devices. So we can do some preventative work and say, well, look, this is, you're losing your high end here. And with the right hearing protection, that can be optimized, and you won't get tinnitus, and you won't get depressed, and you won't have insomnia when you're in your 50s and 60s if you start early now, to the 25-year-old drummer that's on tour. We had, the physio thing we looked at, but then we also looked at the vocal health aspect. What can we do? So Ravox, shout out to Ravox, they've been kind enough to support us with some vocal health tools. So there's things, something called straw phonation. So this is something that if you went to a conservatoire, wonderful, your classical training will teach you loads of vocal health coaching and techniques, to produce a great sound reliably. But if you have started out like the K-pop band that I looked after, who started out busking in Seoul and are self-trained musicians, and you go from busking every couple of weeks, playing bars, to then doing 45 dates in 90, where are you getting that support? So then it's to help emerging artists and also those that are more established, and giving them an easy port of call, a one-stop shop for all those solutions. So it's just thinking laterally about the needs of the population you want to serve. And it's, to really care to get to understand them and talk to them. And for me, it started out as reverse commissioning. They asked me to do it rather than top-down, I decide as a clinician, this is what you should have. So it's always listening to them, the patients, and your clients.
For me, that's caring. And from this point, I remember that we were speaking about immigration. And, the modern immigrants are not immigrants because they are in a war zone. They are immigrants because they are people that have ambitions, they want to work, they want to connect and move to other cities. So one of our doctors that will be presenting in the academy is Dr. Joseba Acotequi, that he is a psychiatrist, doctor, professor in Barcelona, and he developed the Ulysses syndrome, and we are trained doctors how to deal with patients, with the modern immigrants, with the Ulysses syndrome protocol. So groups that are moving are not only rock bands, there are also people that are moving because they want to become better, to have a better life. And medicine has to support these people also. So a few minutes to Yvonne to present her vision for the future.
Well, my vision for the future is educate the doctors better, sorry. But I think they already, in 2018, the medical faculties realized that they have to, are failing actually the system, and that they have to educate the doctors better. And I'm a holistic practitioner, so I'm not a doctor, but my patients, when they come in, they ask me, are you a doctor? And I said, unfortunately not, because I'm an out-of-the-box thinker. And to be honest, the doctors, and of course not every doctor, is more narrow-minded because of their education. And in October last year, I followed a three-day conference from India, and the doctors were talking about, every doctor all around the world, from Australia, USA, South Africa, India, Pakistan, and they all apologized because they are realizing now that they were lack of information to help their patients the best way. And that's why it's so important that we start to educate the doctors better.
I think, you know, to sort of put the elbow in there, I think my generation, definitely biopsychosocial model is what we're brought up on. So I, you know, started in 2004, I graduated in 2010, and biopsychosocial model, holistic care, is the norm for most UK trained graduates now. So I think, you know, it's catching on to more other traditional areas of medicine. So there is hope.
Yes, there is hope, and we have to put science in this hope and make it practical. Yesterday, a fellow doctor from Athens sent me a video, and this video shows the time the ovum conceives the sperm. And there is a blast of energy and of photons at that moment. And you know, photonic energy is a communication system of the cells of the body. And the collagen network is like a network of photons making a coherence in your body to communicate. So these are things we have to discover, to research. And because, you know, photons are multidimensional particles, we can understand that there is something in other dimensions connected with our physical body. And this is a point that we are going to connect researchers in our academy. We are willing to make a collaboration with medical institutes that want to have a holistic department, and my team of educators will be delighted to create something together. So we are all visionaries. We want to change the world to become a better place. And technology is a challenge itself, because technology can create miracles, but it can create distraction. So we have to be aware, to be educated, so that we can make good use of technology. With nuclear power, we can destroy civilizations, but we can create power for people to live, to have free energy. So the same stands for AI, and the same stands for the ability of our mind. So we have to use it in a proper way, transmitting the right frequencies. We are transmitters. The thoughts are outside our brain. So what you transmit, what you breathe, what we exhale is very important. And we have to see about the collective energy. We are a collective energy unit. And when we're speaking about breathing, when you breathe deeply in a hospital, you breathe some low energy. You can feel that. But when you breathe in the forest, you breathe some high vibration, harmonic energy. There are technologies that stimulate these environments. My colleague Donna has communicated with the EES system. So there are so many things we can discuss. We are open to make collaborations, but also I would like some final words for each one of the panels. What are your expectations, Wisdom? What are you expecting from this conference?
Well, this conference is and has been a great opportunity to show that physicians and innovators working together, and there could be, as Alexander said, one person. And innovation in medicine right now, or in health, it's not a luxury item anymore. It's a necessity, because we are facing a huge problem worldwide with double aging, aging population and also aging medical professionals. The gap between the two is increasing. We can't close the gap by throwing more money. We can't buy emergency hospital physicians or nurses. We can create them within 2 days. I think with innovation on multiple fields, and one of them is the technology, we can close the gap and at the same time keep the quality of health services at a certain high level, which we all want and aspire.
No, that's nice. So a few words from you, Dr. Singh, to conclude, a conclusion, a few words to close.
Yeah, I think I agree. They say the necessity is the mother of invention, and then this is necessary at the moment. From this conference, see, doctors are trained, like in my time, as a heroic lone healer. If they need to work 15 hours, they think this is part of their job, which is changing. And I'm glad that I came here and I see a lot of innovation, a lot of ideas. So when I go home back, and because I'm faculty for my medical college, I will speak to the educational directors that could we have some kind of a entrepreneurship skill embedded in their curriculum to bring that innovation. It could be an idea, okay? It could be simply struggling with the chopstick, how to pick the noodles, okay? But it has to be, listen properly, and how could we, convert into, with the help of technology, to something very helpful for the medics, patient, and overall for the community. That's my message.
Just a few words, Dr. Alessandra, for conclusion.
I'm actually going to pass it over to my two colleagues here, and I'm going to close us with a process at the end. So, Yvonne.
Well, again, despite all the innovation technique that is already here and will come, to be honest, I still think we are forgetting about nutrition. And I'm coming back to that time after time after time, because it's so important. With good nutrition, we can work more preventive, and then we need less innovation in telemedicine and all these kinds of things. So start where actually the start of your health is, and that is with good nutrition.
Absolutely. I think in the touring world, we were talking about, we want to make the easiest decisions also the healthiest decisions. And so it starts with nutrition, it starts with your conditioning beforehand. I think, to kind of sum up on innovation in general in healthcare, I think it's for the clinicians of us that have never stepped outside the box, is to kind of think of that one question or that one issue that's nagging at you, and maybe just take that step forwards and think, how might you address it, and really take that risk. Because a lot of us really want, we're highly trained, very intelligent, very capable people, and you can be an innovator. And I think to take that step, think laterally, borrow from the other rooms in the conference, from CXO, I was there yesterday, some really great insights there. Borrow from other fields and solve those needs of the current population and that of the future.
Thank you very much. Now we want to close our panel. And I would like to ask the organizers to put this lovely song that my colleague Alexandra would love to, if it is possible.
So as we wrap up, we're going to have some music playing for us, and I'm going to suggest something radical for the next 2-3 minutes, and that's if I could ask everyone to put their phones down. Are you willing to do that for us? Innovation is an experience. And innovation cannot exist without intuition. You all have it. So what I'm going to ask you to do, for those of you who feel comfortable with that, you may want to close your eyes for this. Relax in your chairs. My fellow panelists, if you would like to do the same, uncross your feet. Put your hands in your lap, palms facing up. And breathe. And breathe. Notice how the chair that you're on is holding you. Notice that your feet are touching the ground below. Notice that you're held. Take the next breath through your nose. I'm breathing with you. And on the exhale, tell yourself internally, I am present with my breath. And on the next inhale through the nose and exhale through your mouth, tell yourself, I am safe. On the next inhale, touch your right hand with your left hand and tell yourself internally, I am present to this touch. On the next inhale, notice that you're hearing my voice. And tell yourself internally, I am present to what I hear. On the next inhale, through your nose and exhale through your mouth, tell yourself, I am here. On the next inhale and exhale, give yourself a little nod internally, maybe even a high five, acknowledging your journey thus far. Acknowledging how far you have come. You each know your own story. And let the words I'm about to say land, and let the parts of you hear this. You are an innovator simply because of who you uniquely are. And on the next inhale, ask yourself, what is the innovation that wants to come through me now? And just wait to hear what your body has to tell you. What is that message? You may get it as an idea, as a thought, as a body sensation. Or it may be nothing at all right now, and that's okay. There's no right or wrong here. You're doing great. Pay attention in the hours, days, and weeks to come about the synchronicities, the messages, the doors that open. What is the innovation that is ready to come through me now? There's no such thing as small or big. There is only you and the light that you bring. Stay with that for another moment, for another breath. On the next breath, put one hand on your heart and one hand on your belly. That is what we call the nurturance canal. Acknowledge yourself for being willing to show up for this process. And when you're ready with the messages that you may have received and that you will receive, open your eyes to the room. I'm going to invite you to turn around and give a little smile to the people who are sitting at the table next to you. Don't be shy, turn around, smile at your colleagues, smile at your friends. Feel the connection. Innovation starts with intuition. It starts with connection to self and with attuning to others. Thank you for choosing to be here with us.
Thank you, Dr. Alexandra. Thank you. Thank you, everybody, for this privilege. It was our pleasure.
Thank you so much to our panel. And while I'll give the room a moment to come back, yes, you can just relax for a second. I'm going to ask our panel to stand up, take a step to the front of the stage so we can get a lovely group photograph for all our innovators and amazing ideas that have actually come to life through your dedication. For the room, are we back here? Yes, we've connected back down. So on the first day, we were told about $1 million idea. Can anyone tell me what those 3 little words were? I love you. Yes, it is I love you. Instant smiles across the room, instant dopamine hit, and that is just for you. So I would like to continue. Thank you so much, panelists. Thank you, doctors. Thank you, innovators. Thank you very much. Thank you, thank you. All right, so for our next topic, we are going to be discussing universal health coverage. Leave no hepatitis behind. So I'd like to invite Zainab Senesi, the CEO and project manager and midwife practitioner. We give all to combat hepatitis and liver cancer. Please give a round of applause for Zainab. Do you want a hand here? Yes.
Good morning. Morning. Everybody, welcome to the 3rd day. And as she said, my name is Zainab. I am a midwife practitioner in London, project manager, and I move around to bring mobile health to communities, especially in Africa. Today I want to start with a short play, just the caseload of what we normally do when we go out to the clinics. Fenia is one of the members. She's from the Netherlands, but we work together, so we move around a lot. Hello, Fenia.
Hi.
Do you want to take a seat? Thank you for coming. You had your blood test this morning? Yes?
Yeah, I did.
And I just want to discuss the results with you.
Okay.
And we prepared you for this. We talked about hepatitis, infection that you can develop through. We gave you the transmission modes, how you could get that. And we found out that you have hepatitis infection.
What? What kind of sickness is that? How did I get it?
Hepatitis, like my colleague discussed with you before she did the test, is an infection that can affect your liver.
Does this mean that I won't be able to eat liver again?
No, you can eat liver. The human liver here on your right side is what's infected by the hepatitis infection. And like we said, some people don't have any symptoms when they have hepatitis.
Because I don't feel sick. I'm very well.
I know. That's why we go around to educate you that come for this screening whenever you see us around the villages, come around so we can test you. Now you need to bring your friends. If you have a partner, you go and pass the word round. Bring them so we can educate them and we can screen them too.
Doc, this thing you are saying, I don't know where to start because my partner is not one. They are many, so I don't know who I'm going to ask to bring. But I'm so surprised right now with this sickness. This sickness is so big.
If you're able to encourage, I know, no, it doesn't kill you, not immediately. That's why we're here. We try to prevent so you don't get to that stage. And if you're able to talk to, did you say many partners?
There's so many of that. I'm so ashamed right now, Seth.
I'm sorry, but you try and convince them, try to bring them, because that's why we're here, to educate you. And we're going to be in the room. Nobody knows what they come in for, and we'll take it in turns. Okay.
I'm too worried right now, Doc.
We'll come back and talk to you.
I'm just going to get them because I want to make sure who gave this to me.
We'll talk to you after the clinic, okay? Thank you, Fenia, for coming. Like we said, that's just a little case that, like the case studies that we come across. It's like 3 we've put together in this one because of time and make it really short. But when we go out there, we usually meet young girls that are just having fun. They have lots of partners, and you come and tell them about hepatitis. Some of them don't even know how to pronounce hepatitis. And now you're there to educate them through how the infection is transmitted. There was another lady, when we said to her, this is an infection that you get in your liver, she was worried that she may not be able to eat liver again. We said, no, you don't get it by eating liver. It's an infection that sits here. So we talk about the anatomy, we talk about the physiology. You cannot talk about hepatitis without telling them what the organ it affects. So that's why we had that little scenario, just telling her where her liver is situated. Like we said, universal health coverage. I really love what the panel that just finished, what they talked about, because that's really what we thrive for, bringing the care to the most needy. So we travel around to educate, to make sure the health coverage is actually universal. And we really do not want to leave hepatitis behind. We've touched on anatomy and the physiology of the liver, like functions of the liver. We know how important the organ liver is in metabolizing the medication and getting rid of toxics from the body. So it's really important that we look after our liver. We touched on that already, location of the liver, the anatomy. And what the liver does for your body. Again, because of time, I'm not going to read through all those, and we'll just share links afterwards. Most of this information we get from the World Health Organization website. We get from the World Hepatitis Alliance website. So it's about spreading the word. If somebody asks you about hepatitis, if you cannot remember what to tell them what it is, you could always please just refer them to those websites. It's just more information on the liver function. What really we want to get into is what our organization does. That's just a picture of the liver, a healthy liver. When you're infected with hepatitis, the scar tissue there we call fibrosis. How that can develop to cirrhosis if you don't get the right treatment. and eventually liver cancer. That's what I try to explain to my colleague. And when we out there, it's really difficult how to break these terminologies into a language that they understand. And when people talk about hepatitis in the communities, really they think of HIV. The stigma is huge because most of the medication, almost all the antiretrovirals they use, are the ones used for HIV. So as soon as you mention hepatitis and you say you could contract it through sexual health, they kind of disappear like Fenia did. And most times, we're not able to get hold of these patients that we meet out there to further educate them. Some of them is because we don't have contacts for them. Some of them because of costs. They can't travel back and forth to the clinic to seek help. So you tell them they are positive. You cannot follow them up 6 months later. We just lose them. Hepatitis is a huge topic. We've got 5 main types of them, and we focus on hepatitis B because that's the most common one we see when we go to Africa, but fortunately that's the one that's preventable by vaccination. 99% effective vaccine for Hep B. So that's the one we focus on mainly when we go out there. And the other reason why I focus on hepatitis B is not just because there is a vaccination for it. It's also because my father, he died of liver cancer from Hep B. That was not diagnosed on time. We only found out that it was hepatitis B when he already had cancer. So he came to the UK. We were just desperate, like, this is my hero. No, no, no. This is the one that motivates me. This is the one that says, you can do it. Every morning I wake up, I feel so down, like going to work. You just think, oh, today I don't feel really well. I may not want to go to work. I'll call my dad just to say hello, and he lifts me up. So we just suddenly hear that, like, our dad is dying. He's got like 3 months. I said, no, no, no. He can come here. I was desperate. I'm going to give him my liver. And he's going to have surgery. He's going to be fine. He's going to have a liver transplant. We were just desperate. So he came in 2015, and he was admitted to the King's College Hospital in London. Like I said, he only lasted 3 months. He came in September, and sadly, he passed in December. And then I built more interest. I'm just going to move all this that I said because of time, we could just read from the website, because I really want to go into what our organization, We Give All, does or thrives to do. Fenia did mention that she feels really well, which I was saying to her, most of the patients, hepatitis patients, do not feel ill at all. They don't have symptoms. The very few that have symptoms, we kind of touched on that, and she was asking, oh, what happens next? She was upset when I said, oh, it could be through maybe sexual intercourse. It could be through blood transfusion. But in her case, because she's never heard of hepatitis before, she's worried about what's going to happen next. All she focused on was the boyfriends. She said, oh, my partners, I have lots of partners. Who am I going to bring for screening? Who gave this infection to me? How did I get it? So it's just about that education and reassuring them. And somebody mentioned about trust, about continuity. If we're able to go back, keep going back to these people, we should be able to follow them up. Because like I said, when we travel back to the UK, it's usually very difficult to get hold of them because some of them don't have phone numbers. Some of them cannot even afford to travel back to the clinic. Some of them because of the stigma, like she was telling me she's shy. She said, oh, what am I going to do? I feel so ashamed because I think it's because I have lots of partners. So for many reasons, we lose these people when we go out and do mobile clinics. They usually do not come back for the above reasons. Just a picture showing what the normal color compared to jaundice. We mentioned the treatments that some of them cannot afford in Africa. There are all the options for treatments. Some people, full-blown infection, they feel really unwell, they cannot afford medicines. Instead, they will just be taking painkillers. We mentioned vaccination. And I touched on why I am doing this. Our organization, like I said, we go out, we educate, we raise awareness, we encourage people to get tested. But when we go out to, especially in Africa, to the clinics, when we screen them and we're not able to get hold of them, they're not able to come back, for example, 6 months later to come and repeat the test, it becomes really, really difficult for us, and it's heartbreaking because those that are negative, we educate them about vaccination, but they cannot afford it. And we cannot afford to go back and vaccinate all these ones that we've said. The best way to prevent it is through vaccination because it's quite expensive. It's because of costs that we cannot reach everyone. And we're hoping what we're doing is to complement the World Health Organization's work in trying to raise awareness about testing for hepatitis, about vaccination, and those that are positive, how they can access treatment. The previous panel, they used lots of words that normally is what we thrive for, all this collaboration that we are hoping for. We want to team up with such innovators, they call themselves, visionaries. I love that. I think we can refer, like you said, to us, the job that we do as innovators. We bring all these ideas to them, but because of costs, it's like we're really restricted into what we do. So what they said there about trying to provide the universal health coverage is what we are hoping for, to find people to come back there to actually come and tackle it, this hepatitis from the grassroots. Because for example, my father, he wouldn't have come to London for treatment. He loves his country. We are from Sierra Leone. In fact, I had to convince him. It's because I said to him, Baba, you're going to have transplant. If it's a match, I'm going to donate my liver. Because he has respect for the medical professionals there. The problem is equipment, the medicine do not reach. Most of them, they train like from Europe, from America, and they go back home to provide care. Most of us, we go there, we've trained in the UK, we go back to Africa to provide care, but we don't have enough resources, the facilities don't have equipment, you go there without the vaccination. Even if you go with vaccines, because of electricity, sometimes you don't have refrigerators that work properly to store your medication, so the challenges are many. So the previous panel, those are the people that will say, can you encourage more people that can come and team up, that can bring the care to Africa, especially on the area of hepatitis, infectious diseases, and try and tackle it from the root cause. That's what we try to do. That's just part of our aims, to educate, premier hygiene. We go out to the schools. When we're there, we go to the workplaces, and we do a lot of work in the UK as well. What we are campaigning for now is to encourage the GPs, if we could come around and maybe educate their patients and ask them to include the Hep B screening. I know they're doing A&Es now. I'm not too sure what the GPs do, but that's the current thing that we are working on, to encourage the GPs to include the hepatitis B screening when they do the new immigrants in the country, because they do HIV, and you can just have the vial and add Hep B on that. When we say catch-up vaccines, we're looking at families like those that have children born before 2017, because in the UK, they only started vaccinating from babies born from 2017 to all parents. Before that, as midwives, when we screen women and they are positive, we kind of focus more on that positive woman, and we don't have enough time to educate those that are negative, if you understand what I mean. And when the babies are born before 2017, we vaccinate babies that are born to mothers that are Hep B positive. So it's like those that are negative, you're not doing the prevention, you're not vaccinating them. We just let them go, we're not educating them because, first of all, time. As midwives, you're in the clinic, you have like 20 minutes to see a woman, talk to her about her pregnancy, talk to her about the next stage, talk about plans and all that. Talk about diet, nutrition, hot on the topic. We do that a lot, detoxifying the liver. So it's a lot of very useful information I've gathered from here and lots of good networking opportunity. So by the time you do your 20 minutes, like hepatitis is so neglected, very important topic. This woman will have, for example, 3 more children at home that were born before this baby. This baby is going to be vaccinated. What about the older siblings? For example, you take them to Africa, let's just have a scenario, and one of them contracted Hep B. They'll come back and say, oh, Mom, why was I not vaccinated? So that's kind of heartbreaking. We go around and educate them that let's try and make sure we catch up with these vaccines, get the older children vaccinated before you travel. Because it's heartbreaking that you have only one child the government has funded, they vaccinated her, she's fully, or he is fully protected, but the older ones are not. Some of these parents can afford the vaccine, but it's the knowledge, the awareness is not there. So we go around and just make sure everyone is aware. I think we touched on that before. I actually brought the slide up, trying to work with like-minded people like the ones we've met here. Okay, so how we do it, again, I've touched on that, going around, talking to medical professionals, talking to other healthcare professionals in clinics, in hospitals, mobile clinics, like I mentioned earlier, schools, workplaces. Even in your office, you could just talk to somebody there about hepatitis. I'm not sure how the topic will come up, but if it does come up, you could refer them to any of the websites, like I mentioned above, the World Health Organization, the World Health Alliance, and they can educate themselves. They just need to be aware where to find the information. When we do our events, Africans, they are really like playful, we are very chatty. We don't like to do events without food, which is where the diet nutrition comes again. We don't like to do events without music. So we will usually hire like big halls and just have fun. We bring the DJs, we bring entertainment into the room. People learn that way. We do drama, we do a lot of drama. Because of time, we couldn't do much. And if you visit maybe our YouTube channel, the link that we'll show later, you see some of the plays that we put up because people learn in different ways. Some people get really bored with just reading. So when we go out, we usually will do like scenarios, short plays. We touched on the barriers, the challenges that we have when we go out into the community. All these outreach clinics we do, the reason why sometimes we are not able to go back is because of funding, the lack of funding, because of costs. All the work we've done, we've captured, we've got some photos. I'm not gonna say much, even though most of them have stories behind them, but because of time, I'm just gonna scroll through those photos and tell you the year or where that took place. It was launched, again, like I said, in memory of my father in 2017. 28th of July, usually World Hepatitis Day, when we commemorate the day, and lots of countries worldwide, in fact, come together to raise awareness in hepatitis. And those are my siblings, and that's my dad. This was just the day that we launched it, prayers, and then few other pictures, colleagues at St. Thomas's. That's the FGM specialist, because we link FGM in Africa. with hepatitis. We think some of them contracted hepatitis from female genital mutilation with non-sterilized instruments. And the lady in the yellow top is a colleague at St. Thomas's Hospital, FGM specialist. So they all came to promote. This one is A&E doctor, now with the Imperial Hospital. Dr. Eugene is a consultant at St. Thomas's. They all came to support us to launch it. Our group is a group of midwives, doctors, colleagues, public members. Anybody that's interested are welcome to join. And that's just the day that we launched it. Like I said, we don't do things without food, without music, without play. We play, we educate through play. And then the first placement after we launched it was a district called Koinadugu in Sierra Leone. It was funded by a Japanese government through the International Organization for Migration, and they invited me to work there as a diasporan expert in midwifery, just to pass on the education. And obviously, we included the hepatitis education in that. And that's just the field area in Koinadugu in 2017 with the IOM. And one of the doctors mentioned forest after all this lovely talk about all these big terminologies of innovation, visionary, and then they mentioned forest, and that made me really smile. I love that because we really do go out, far, far out to reach the people that really do need the care. The only challenge there too is bringing around the people that can translate. It's really a huge challenge too. Lots of multiple births. I had to capture one of the deliveries that I facilitated. Antenatal education, multiple births, again, the same place. And in 2018, World Hepatitis Day, again in the UK, lots of photos, what we did, educating people and doing screenings. And that's one of the Hep B Foundation members, Paul Desmond. Colleagues just at the event in 2018. Games, that's our General Secretary there, Margaret, very passionate about education. We do competition, again, just to engage the public because people love games. People love winning, so we give a scenario and we encourage them to take part. After the one in the UK, we went to Sierra Leone. A few days later, again in 2018, in July, to repeat exactly what we did in the UK. That's one of the consultants in the UK. And when we push to have this on the agenda, we usually will obviously invite, for example, members of the parliament. I think the reason why this guy was there, because they too have experience. Because they can get really busy and they'll say, oh, we'll send a representative. To have a member of the parliament come and talk, I think it really did touch them. Because when you hear in Africa that somebody is unwell, they've got swollen legs, their stomach is swollen, it's actually usually related to like witchcraft. They don't have the education that because of hepatitis, your organs are failing. You are building all this ascites in your stomach. They don't know that. So these people are desperate to educate the community, and so they join us. Again, in Freetown with some of the lab technicians. This is the doctor that we work with a lot, Dr. Ramesh. I refer patients to them. That's a colleague, a midwife as well, that when I did the screening in Sierra Leone, I handed over some of the patients that she can follow because she's still continuing a contract in Sierra Leone through the Partners in Health, PIH, a big NGO in Sierra Leone. So between Aisata and Dr. Ramesh, we can refer from UK. We can call them and say, somebody has called us from Freetown. They need you to explain the results to them. They want to find out about vaccinations for the family. So we really work very well with these two. Just the admin team when we go around. I think 2018 was the longest we stayed there. We covered a few clinics and just photos from the field out there. I mentioned Kono district where my colleague Aisata is based. After we left, Aisata gave us an update that now the PIH, they are vaccinating all their staff, which is really, really good. And we think that's a huge achievement for us, whether it's directly from what we brought to them, the education, whether it's indirectly, it just happened, it's a coincidence. We're not sure, but they are vaccinating all their staff now, and they are educating the women, they are screening all the antenatal women that come through their doors. We're not sure how much they follow them up, again, for the reasons that I gave earlier. These women come, they don't have phone numbers, they don't speak the language, they are worried about stigma, they don't want the community to know that they have hepatitis, which they just think is so related to HIV, the stigma is huge. This was in Geneva. Dr. Silla is a consultant surgeon in Birmingham. We've worked together out there, but he does a lot of voluntary work in Ghana now. But this was when we met together in Geneva in 2018, again, to just share our experience and what we do to bring the health talks out in the community. He is luckily coming to work with us again in Sierra Leone in 2 weeks' time, because the West African Council of Surgeons, they're going to have the presentation this year in Sierra Leone. So in March, after that, we're going to work together again with the consultant, Dr. Silla. These are all colleagues midwives from St. Thomas's Hospital in London, my colleagues that we work together. That is when I took my kids just to show them where we come around to do this. That's why I say charity begins at home. Just to show them this is what we do. You can do it. When mom is not around, can you continue this legacy? Because what I do is what I've gained from my dad, that you need to bring the care to where it's needed. So you need to continue that legacy. That's just them at the airport. That's my mom. Oh, I didn't know this slide was there. I'm so sorry. No, I just lost my brother last week. I'm really, really sorry. That one, that's my brother. That's my mom. He died last week, and I'm sorry. So I captured him in one of the slides. Those are my kids again. This is where I was actually born, this hospital. So I was blessed to go to there, to Kamakwe, to provide care, to educate, to do vaccination. I need to just have a moment of silence for my brother. I'm really sorry. Sorry. Thank you so much. This is us coming back. And in 2019, again, we went to Sierra Leone, another district we call Moyamba, to repeat the same thing. We go like district to district. We come back, we work, we raise funds, and go back to another clinic. Like every year, we try to do that. Just in the theaters with the IOM and the labor ward. Education in the UK. That lady in the green top is one of the GPs in the UK. So we tap into all these people through networking to encourage her to help us spread the word, to meet with GPs, to encourage GPs to screen patients for Hep B, the newly arrived immigrants. So she is helping us with Margaret, who is our general secretary, there next to her. Those are members of We Give All. I think I have like hundreds of slides of just photos of what we do. Like I said, I won't be able to go into all the details of those scenarios, so I'm just going to flip through. That was 2019 in Geneva. Because of COVID, we were not able to go out there, so we just did lots of like virtual education, just so we don't miss out the day in 2020. We had a campaign, again, just for fun. Those are my kids, and just encouraging people to wear yellow. Yellow signifies hope for us. It signifies, it's also the color for jaundice, the hope that one day we will eradicate hepatitis. Again, in 2021, we did another virtual meeting just to commemorate the day. all this is just what we do virtually. And then we went, after the COVID, we went to Masuri is in the northern part. It's near Kamakwe, the previous one. We went there, we educated people, we screened them, and the challenge again, were we able to follow all of them up? No. In 2022, just the services that we do in Sierra Leone, we're able to secure an office there so that people can come into somewhere that is quiet and private. You heard Fenia was talking about stigma, how are they all gonna come here, my boyfriends, to have the screening done. Yes, they will all come, but nobody will know what they've come for. They will be coming into a quiet room, somewhere private, and they will come out, nobody knows what their results are, so don't worry about that. So we've got an office now in Sierra Leone as well. That was the last trip of 2022 in May, in Bonth district in Sierra Leone. We talked about diet, nutrition. We don't joke about food. I cook myself when I'm there, and we bring the food to the staff. We make sure we feed them, not just buy any snack out there because they are not in your comfort zone. We provide them with good meal. And it was just, again, for joke, the lady, the caterer that's coming to serve them, just took a photo, just teasing her. We eat anywhere, on top of the vehicles, in your clinic, wherever you can eat, just quickly to continue. We work harder in Africa, even more than in Europe, because of the time. You're there for like 2 weeks, and you want to do like 20 villages of maybe 200 people. It's really difficult. So as you go, you just munch in the car, on top of the bonnet, wherever. Just some of the labs that we visit. And I call the hotels the place of reflection, the haven. In the evening, you just sit there, we discuss cases that we've had during the day, and it's just relaxing, music, good food. And you forget a little bit about what you've had during the day. But look forward to the challenges of the following day. That's through the sea, labor ward. When I go to educate, I go to work in the labs. I don't know, just I get drawn to the midwifery so much. If I hear somebody cry in the labor room, I will come there. I'll come there and just support. So sometimes I get a delivery that's not planned. Sorry, like I said, there's so much on there. Okay, so the most recent event in 2023, we were not able to upload any of those photos or videos, but they are on our Facebook pages, they are on our YouTube pages. We give all, and it will be on the Health 2.0 LinkedIn page as well. We would like to thank you all for listening to this, for watching the presentation, and we would like for people like the previous panel that really want to collaborate with people like us that want to bring the care where it's most needed. So please work with us. Thank you very much.
Thank you very much, Zainab, and deepest condolences to the loss of your family. That's okay. We'll give you a moment for that. Very informative, and thank you so much for educating us on this very pressing issue. I'd like to move on to our next panel that's going to be combating industry collaboration and self-regulation, advancing safety standards in consumer-facing mobile health. I'd like to welcome to the stage Dr. Aslam Mohammed El-Nabrisi, also Professor Yasuhiro Suzuki, Brian Manyao, as well as Talia Adika. Make your way to the stage. And you can give them all a round of applause. Yes, welcome to the stage. Hello, hello. Oops. That was my mistake. Sorry, tech. All right, there's one for you. Can we get 2 more mics? Thank you. Mike? And the stage is yours. Thank you.
Thank you. Hi, everyone. My name is Talia Adika, and I'm a partner of an international health insurance agency located in New Jersey and New York. I'm here today to talk about telehealth medicine and the impact it has on the U.S. healthcare system. Right now, the USA is going through a lot of troubles when it comes to healthcare and the quality of care that Americans are receiving. And they're trying to fill that gap through telehealth applications and technology. And we find that if we try to make an appointment for an in-person visit with the doctor, sometimes the wait times can be up to 2 to 3 months, which in the past was unheard of in the US. And because of the new regulation, the Affordable Care Act, it has taken a negative impact on the US system. So telehealth has been bridging the gap. Within 15 minutes, you can actually be seen by a practitioner, a GP, a specialist, and then receive the care that you need. If you need a prescription, if you need antibiotics, and they're trying to promote it. A lot of the health insurance carriers are trying to promote more of telehealth and staying away from an actual doctor's office. Now, I look at it as a positive note, but there are negative aspects to this type of healthcare and healthcare services. So I will let you proceed.
So Talia, thank you for this, and let me continue from the same, I'll go with the same flow. Being from a medical background, I'm an associate professor of pharmacology as well as a researcher in the field, being an academic professor in a medical university, Dubai Medical College for Girls, as well as having a quality perspective. I'll go with the same flow, as I said earlier. With the speed that we are living in everywhere, I like the diversity that we have today, but the point that we are all sharing is that we are living in a very fast pace. So telemedicine, or what we call it here in UAE, teleconsultation, is very much wanted. We don't have time to reach hospital. We don't have time to visit the doctor. We don't even have time to wait for our consultation outside the clinic, right? So we do prefer to have it over the phone and just prescribe whatever complaints that I have to my doctor, and then the doctor will refer back to me or answer me back, as you said earlier, in 15 minutes, and let me know whatever I have to do. Medicine will reach on the doorstep of my house. So we do like it that much. But this have emerged, have pushed us and pushed the whole world to another thing, which is, we call it nowadays mobile health. We do have a plenty of unlimited numbers of mobile applications that are health discipline or discussing the health issues. And guess what? What are the main category that we are dealing with? Ladies, weight loss, health concerns, how to lose weight in I don't know what, how to get fit, how to build muscles for male, yeah? So that's great, actually, and being, as I said, an academic, so students, as well as my kids, will come, Mama, dear doctor, I found this. Is that true? If they have even 2 minutes time to think about double checking or relying, if they will not rely on the source of the information and will come and check with a second person whom they do trust. But the profound number of mobile applications that we do have it on Android App Store or iOS or whatsoever app stores are numerous and it's of different purposes that we do have it. We are all having, if I will ask any of us here in the hall to check your mobiles, and we are all at high end of education, we do have some of them in our phones. So I do consider it as just a continuation of telemedicine, teleconsultation, and telehealth. I'm not sure if my colleagues, Bran, would agree with me, or what's your perspective about this?
Yes, sure. My name is Brian Manyao. I'm a chartered certified accountant. You must be wondering what I'm doing here. But through working in finance and obviously the COVID pandemic was pushed into the pharmaceutical business, essentially to try and bridge the gap between affordable access to medicines. So this topic comes handy because we are part of the chain. Because once somebody accesses a diagnosis on the telehealth portals, they will need delivery of the medicines. And you will find that most states or most countries didn't have provisions for the delivery of these medicines without you going with a physical prescription to a pharmacy. So the importance of this telehealth brings speed, like what my colleagues have highlighted. It brings speed to the process because the demands are high, and we are seeing that there's a lot of development in terms of access to these portals and channels. But I would like to present a challenge in this sphere. The challenge being that I'm coming from Africa, Zimbabwe, in the southern part of Africa. Connectivity is an issue. Telehealth requires connectivity. It requires broadband for it to be effective. So I'm calling on all parties that are involved in the process that we need collaboration. We need to work together so that we can actually develop this sphere of science and make it more useful and accessible to the general population. Because the problems will always come back, the problems will always burden the globe, and many lives will be lost in the process. So we need to come together, collaborate, and put resources in order to combat or to make sure that telehealth is accessible to everyone. My colleague Suzuki is going to show us some of the gadgets that are being used to facilitate this process and ensure that there is access to health.
Thank you. My name is Michael is on. My name is Suzuki from Nagoya University. I'm a computer scientist, yeah, and I working on mainly totally different computational framework, not using any languages or data, only use tactile sense, because my dream is to connect the human and nature by a tactile sense, because in nature, common language is, one of the common language is tactile sense. Yeah. Molecular on cell touching each other through touching each other and feel the tactile, kind of. So communicate with each other. Only human cannot directly connect to the nature. So my dream is to bridge in human and nature by a tactile sense. And recently, I applied this technique with companies, large companies and healthcare professionals to apply to the healthcare. And this device is created for device for healthcare application. User can receive designed tactile vibration message from internet. So, and all users take a photo or picture of yourself. And our system recognizes your mental state, emotion, or something. And putting together users' biological data, our artificial intelligence system combine all the information that create massage, kind of. In fact, very low frequency of sound, it vibrates this equipment. So user can accept most optimized massage from tactile AI systems. And we also confirm the effectiveness with working with an Akita University Hospital for dementia treatment. We did a medical treatment last year, and we confirmed that this device and relating these devices can kind of cure, can improve a patient's cognitive functions. And also, we can confirm that only this device can cure hypertension and type 2 diabetes. So, and now we are talking about that. So, but this is definitely needs safe standards. This is used for medical treatment, so definitely it needs. Thank you.
So I would like to bring back the discussion of mobile health. And in the United States, we have two major phlebotomy centers. One is called LabCorp and the other one is called Quest. And what they're doing now is they're eliminating their centers and they're providing mobile on-site phlebotomy services. So the last time I obtained my blood work, a phlebotomist actually came to my home, took my blood work on site, took it back, sent it to the lab. A few days later, I received my blood work via email. So mobile health is evolving and changing, not just through applications as technology, but also where we're retrieving our blood work, and it's changing on the back end within healthcare facilities. Because for them, it's just not worth it to hold an actual center, pay the rent, the employees to hold it. It actually saves them money by sending the phlebotomist directly to your work, to your home, wherever you are at that time. So if you want to elaborate on that.
Talia, I consider this as an excellent point of view, and where it's very much connected actually to the medical practice everywhere. And this is, again, what we here is to connect the experience and the practice across the world and across the globe. So this is exactly what's happening here. Most of the hospitals, they do the same, while the services or the medical services might vary from one hospital to another according to your health insurance services and the budget and the coverage. The point that I would like to raise from this is, can we connect the other mobile health apps to hospitals so that it might have an overview over it? Because mobile health services that it's very well regulated by the hospitals or the medical practitioners whom they are licensed, and they are very well informed about their own perspective. I will keep talking about medicine because I'm from a medical background. So they know what they are doing. They know what to prescribe. They know what to, how to put a treatment plan. But what about the other mobile health services or apps that we are discussing? This is the conflict, right? And this is where the issue and or the self-regularities that we are missing, or the gap that Brian talked about, and also Suzuki have touched by the end. So can we have those hospitals or those local health authorities maybe having an overview or a regularity, consider themselves as a regularity affairs on at least the local mobile health services that it's offered in a country or something? I'm not sure. While it's progressing very well, especially with the evolution that it's the very speed up evolution that is happening with the smartphone and with the technology, which is just in the next hall, right? So how can we have an eye over it? I'm not sure about it. I'm not aware if we have something like, because we like the model of FDA, right? We are all aware of the FDA. The regulatory affair of the FDA. Do we have a model like this for the mobile health? I'm not sure about it.
No, we don't have. Remember, this is new frontiers. So there's a lot of self-regulation that is happening here. And I think the biggest challenge with self-regulation is that there has to be codes that are developed so that the industry can operate by. And a lot of ethical dilemmas come into play, and we need to be conscious of these issues because they will affect us down the road. Medical records are private. What are the issues that we're looking at in terms of data protection, the privacy of my diagnosis? What are we doing in as far as that is concerned? So as practitioners or as members that are involved in this sphere of medicine and practice, we need to come together, come up with codes to regulate this section of health. While it's helping in speeding up the process and access, we also need to make sure that it's safe and we protect people's interests and their records through our own regulatory approaches. Suzuki?
Yeah, that's a very important point. Yeah, now you pointed out that. I feel strongly same things. So I founded an association for certificate fairness or self-standards. Not only healthcare professionals, including the IT, CEO of IT companies funded by SoftBank Corporation and the University of Tokyo funded. The CEO of the company joining our association. And also, we strongly feel about what you think, what you're talking about ethics. Yeah? Ethics is very important because this is a very new technique. So we need very safe and comfort ethics, how to use. So our association, including former president of Japanese Philosophy Society, and also we also think about sociological things. So physical sociology is also important. So and so former president of Japanese sociology president also joining us. So we try to create a new standards, including this device, including this tactile technology. We feel that tactile technology is probably effective, but I feel kind of dangerous it is, yeah? Because if it's do harm, yeah, if we don't use and safely use it, probably do harm the human body or mental. So different need safe standards on self-use. Yeah. So now we're talking about things is very, very important.
So back to the topic of regulation. I've been in the healthcare field now for over 10 plus years. And based on my knowledge and experience, the FDA is trying to regulate mobile health. Part of the changes that we have seen in the United States is limiting the care that we can receive through mobile health. So if you have a basic need where you need antibiotics, they will prescribe it. But there are certain medication where mobile health is not allowed. And as a patient, you do have to wait to be seen by a doctor in person. depending on the diagnosis. So I believe the FDA is working hard to, yes, advance mobile health and make sure that they are trying to fill that gap between the lack of doctors and the waiting times. But unfortunately, depending on what your needs are, you may still have to wait. And if we can find a solution to that, it would be great. But a lot of patients sometimes they will suffer until they can actually be seen by that specific specialist or doctor. And I don't know if you want to elaborate on that.
That is a great initiative, definitely, from FDA, but it's still definitely, we understand that it's not popularized and it did not reach everywhere yet, right? So our role, everyone here, is to spread awareness that it's mobile health is to be used, but with much of care and with much of knowledge is about how to use, what to use, and to purify and to select, highly purify and select your selections. Means that usually when you go to the app store, how do you select your health or your health app? Is either by a recommendation from a friend or someone who's trustworthy, or by referring back to the App Store rating system, right? So is that enough? No, definitely not. So we might also educate people around us, especially because we have now classification for generations, especially the Gen Z and other generations, maybe some of the millennials, maybe some of them are here, or still we are having our respectful traditionalists, right? So to read the prescriptions and to read and to look into the credibility of the developers. I'm still insisting is to have, do we need a regularity affairs for that or not? I mean, a regularity bodies. Keeping in mind that not to lose the good or the actual, let me call it the good practice of mobile health. By putting much, because sometimes when you put much restriction, you lose the good practice or some of the best practice because you have restricted it much or you have kept a tunnel vision. You do have a tunnel vision so that people with good practice have just lost interest. So we don't want to have this, right? So keeping the balance is something that to keep in mind. Definitely, it's not something easy. This is for sure. But this is something to create awareness about and to spread good information about it. What do you say, Brian?
I totally agree. There is need that we keep a balance. And the other conflict that comes, obviously, in this spectrum is the conflict of profit and doing good. Like you are highlighting, are the developers credible? What knowledge, what is their experience in this sphere, in health? Well, what do they know? Who is behind it? How are we generating the algorithms? What are the patterns? What's the data behind those algorithms that are running the applications that are then providing a diagnosis to a patient and eventually prescribing a particular drug? Those are key facets that we really need to be conscious of. Being in distribution myself, we have limitations in what we can send online. If somebody goes, we cannot sell certain products online because obviously in the past we have seen young people getting addicted to the codeine-based drugs because they are overdosing or they are now mixing them to create recreational drugs. So it's a fine line. We really need to think around how are we going to take the steps to regulate the process. Access is beautiful. It saves time. There are so many advantages to telehealth and telemedicine. But are we then also taking care to provide the necessary safeguards to make sure that our children or the disabled have access, and they have access in a safer way. Are we doing that? I think those are some of the questions that we then need to pose to ourselves as industry players, as well as governments and lawmakers also need to come together to create a framework for us to be able to proceed. Those are my thoughts.
Thank you. Probably very, very similar situation now we got. First of all, I think if security standard only make in the industry, it is not so good. So I definitely need academia. So I organized the association of, I said before. So now we're doing basic researches, scientific researches, and to assure and making self-guidance, self-standards. And we plan to open all the details to the world, so everyone can use it. So, and what all we doing, basically transparent, not secure things, security things. Everything is open. Everyone can check. Everyone say no or something, so we can adjust. So I feel we should open up everything. We discussed with each other and create much more new, much more secure, much more good standard. So I try to create security standard independently from industry. Thank you.
So I would just like to bring up a few keynotes here for this panel. While we are discussing access to mobile health, there are a few issues that are still arising. One is having access to the internet. So you may have a phone, but not everyone has access to download an app. So we have to start bridging that gap. So everyone in every country will have, in all demographic and financial health, will have access to mobile health. That is one of the problems that we're seeing. The second problem that we're facing is having all of the care through mobile health, not choosing, especially in the US, choosing certain type of care over others, because that can pose a problem later on, and delaying time, delaying someone's care can also hurt them in the long run, because you're not catching a diagnosis in time, and sometimes that can lead to life or death, unfortunately. And once we can bridge those gaps, we can definitely see a change worldwide. But it will take time and a lot of dedication and devotion to make that happen.
For me, as a take-home message, I would say that we need to sustain this service because it carries a high potential, but keeping into consideration that we need to ensure the safety, effectivity, as well as the reliability of the mobile health. Also, the second take-home message is that we need to make sure or ensure diversity, inclusion, and equity of the mobile health, and I think Talia have also touched on that, because this triangle is one of the main core functions of the mobile health. Thank you.
Thank you. Yes, and I think the key issues that I think we really need to go away with here, obviously what my colleagues have said, safety, access. And for me, coming from an African background, I think there is also key need for collaboration to ensure that this technology is then accessible in some of these places. We are very happy with the current trajectory that obviously Elon Musk is taking in terms of providing internet through satellites. It's a very welcome project, which will also allow the rural, untapped areas. I think the lady who was here earlier on was talking about accessibility and the lack of it and the difficulties that they are facing in carrying out their programs in the rural areas in Africa. But this will also allow us to be able to give that access to those remote areas and allow people to have access to this technology that will lead to better and healthier communities, healthier children, and lower the mortality rates in Africa. So I will emphasize on collaboration. Let's share the skills, let's share the knowledge. Let us come together so that we can have impact that matters. I think that's the key phrase. We have impact that matters in all that we are doing and make sure that we create a brighter future.
Thank you. This is basically a smart device, but we faced with, and we get to know, elder people cannot use internet things, smart things. So now we developed them, not connecting the internet, just this device only. Do not have to connect to internet, but can use this device. So we can send tactile information from the server to the kind of small sub-servers, something like. So sub-server connecting each, not connecting directly everyday devices. So we can send very new information, very new things to the server. So sub-server can get it, and each not usually connecting internet device can accept it. In case if the device into Wi-Fi area automatically detect a Wi-Fi and download the data. So the patient users cannot use internet. Just bring them to a Wi-Fi environment, automatically download newest things. So now we are creating things. So if using these devices, or the person do not have to use a smartphone, it's very complicated. And also, if the place do not connect in the internet connections, can use it. And this is very kind of cheap. This is very simple and very cheap things. So we can deliver, very economically deliver this device to people who cannot access the internet. And on the diversity things, I also aging. I'm changing day by day. So my suitable tactile massage should be changed. So I use artificial intelligence. Artificial intelligence know I might change of aging or body conditions. So my partner, like AI, can detect me. So you are getting older, so we change in the massaging or something. So everyone can use this system. And every countries, every place can use it. So we can adjust every person's differences. So I think AI technique is kind of answer to create an equal situation in all over the world. Thank you.
Thank you, everyone, for listening to our panel. And we appreciate everyone for being here. Did you want to answer? Oh, you have. Does anyone have any questions? Yes.
So I'm Mary Lou. I'm from the U.S.
Yes.
And I own several mobile clinics, specifically in Texas. I have Houston, Dallas, Fort Worth, and we are expanding in Michigan, Arizona, and Seattle, and California end of this year. And I'm really interested in what you said about, you mentioned about the telemedicine, and we've been doing that. And the telemonitoring where we give the
And we get to know, in Japan at least, many elderly persons having depressions. And we can check the time, duration time of usage of each user. So, so we monitored the time of using. So if the time of using is decreasing, we care about. Probably these users getting bit depressed, something like that. So we can access directory, or expert can connect to call or send email or visit or something like that. So we can monitor the usage, so we can know what's going on. And it is effective. This is effective for depression, so I strongly recommend to use this device. Yeah, but I didn't say you are kind of depression or something. We never said that. But just I said, please use this more time, or something like that.
I feel the issue in the US is, let's say if we have this wonderful device, there are some patients that can't afford it. So the ones that can afford it will receive better care, better monitoring, and then again we have the divide where the others that are not as fortunate will not have access to the appropriate mobile care that's lacking. Yeah.
Hello? I don't believe that this is working. Hello? Okay. This is Marcelino. I'm very happy to hear much of innovation from our dear panelists today about the revolution that we have, and sharing part of the story that I live in every day. We are running through the facility services where the patients meet with their psychiatrist online, so they get the service online, they meet up on a video, so it has been accessible for the patient, easier for them, so it has been revolutionary. However, my concern, which is something I need your ideas about, is moving on with such a development is creating a challenge where we lose with the patient in our digital world the personal touch. And that is the thing that I need to hear some ideas about. So like when the patient comes to the office, we used to have this kind of personal connection, like, how is your day? Have you slept well? Please, if you felt anything, come back to me. I'll be there for you. So this personal touch we're losing when we are moving on with the digital world. So what are the strategies that maybe you can share with us that you have back in our mind so we don't lose this? And because I don't wish for my patient or for myself to just switch it from a human being into just an account where I'm just giving some clicks to give you the prescription without actually having a care.
Okay. I'll give just a brief comment. What we teach to our medical students, undergrad medical students, don't ever treat your patient, your future patient, as a future doctors. Don't ever treat your patient as a number or as a record or as a medical record number. So what we recommend, and we have touched on that during our discussion, we have different generations now, classification of generations. Even if it's speeding up, never do that. The first visit should not be a telecommunication or a telemedicine or a teleconsultation. It might be just a follow-up just for a prescription, but never ever do that. This is from doctor perspective or a physician or treatment physician or a general practitioner or whether it's a traditional medicine or alternative or complementary medicine, whatever classification we do have for a practitioner or a treatment physician whom you are seeking his help or advice. So never ever do the first, or at least the first visits, let's call it, as because we need this humanization factor. You need to see a face. You need to put a face for a name or a name for a face, whatever. We need this interaction. I need to see you. You need to see me. We need to talk. I need to hear how do you look today? How is this voice tone looks like? It cannot be over the phone. But yet we are in need, and this is what we have concluded by the end. we cannot just ignore the need for this technology that it's speeding up and it's emerging, and we cannot just ignore it, but we need just to regulate it. What do you say, Talia?
So what I can say is that in the United States, we do have telehealth for therapy and psychiatric services, and it is not allowed over the phone. So there has to be maybe a voice chat with video attached to it. If the video is not working, they will not conduct a session. They do that because they want to see how the patient's doing. And they want to see that patient, they want to hear that patient. Even though they're not physically in the room, because of the technology, they can see them and they can hear them. They can have a coherent conversation. And based on that conversation, they can see how their patient is doing mentally, if they're progressing, if they need a change in medication. So those are some of the ways that they're monitoring that type of care and service. They are not allowing, oh, let's just have a phone conversation. No, they want to see physically, not physically, but through that mobile app or the application or online, and actually see their patient. The psychologist or the psychiatrist, if they feel comfortable, and let's say there is an emergency, they will speak to their patient, but then they have to reschedule with an actual, I guess, like a FaceTime chat. So I don't know how you run your practice if you abide by the same rules.
Well, thank you for sharing this, because this is actually what we're doing with the patient. So the patient's meeting online as a video call with the provider. So a visual evaluation is being done over the session. But the thing that, from your experience, I believe that you will be able to sense the same as my experience, that the patient, when it comes to a video appointment, doesn't come prepared to the session the same way that he's doing over the video. So like if the patient is coming through a therapy session in the office, and you compare it to the same way the patient is attending to a video session, it's coming like a little bit of a video thing or TikTok thing. It's like he's not that prepared for getting the care, and also for the provider, it's kind of challenging for him to have the same setup that he used to have in the office. So it's kind of a bit challenging at that point. That's what I'm trying to raise, and if you have some ideas regarding that.
So just to, I think it's the opposite. So sometimes when you have a virtual consultation, you're in your home or you're in your office, and you may feel more comfortable in that setting versus walking into an office, and it's kind of very territorial, right? So when you're walking into that therapist's office, it's their office, it's their location, you're the patient, you may feel threatened, you may feel nervous, but through virtual consultation and treatment, I feel the patient is more relaxed, and it's the opposite, they're more themselves, but you have to have the video, you have to have some type of video connection to see the patient, to hear the patient. But I would say it's quite the contrary.
Okay, thank you.
Hi. I have a question about this device. It's very nicely done. This question is about cognitive function, and how it will improve the cognitive function. It will fire up the more neurons, or how it's going to heal the cognitive function? This is my question first. Then the timing of the device, is there any particular timing you have to use, morning, afternoon, the best timing? Third question is about this device's age. Any age or any particular age? So these are the three questions. And of course, definitely I want to ask about depression and anxiety. You know, in that case, a lot of youth is suffering. That is why we are here in this conference on the first hand. So please explain me. Thank you so much.
Can I? I couldn't remember every question,
Okay,
sorry.
the first question is cognitive function. How is going to improve the cognitive function, this device?
Yeah. We don't know exactly. Yeah,
Okay.
but researchers at MIT, Massachusetts Institute of Technology, are doing almost same things. They using the visual stimulation and vibration.
Okay.
In our case, only use vibration, tactile stimulation, but the result is the same. And MIT's team and we now investigating the why. I just guessed, probably we use a very low frequency of sound. It must vibrate cells,
Okay.
brain cells.
All right.
So probably the vibration kind of massaging the brain cells. I think so.
All right. Second question is the timing of the device. Any particular timing?
Anybody? Yeah.
Timing of the device.
Time.
Yes.
It depends on. If the dementia patient, it needs long and strong. But the depression, less than 30 minutes or 20 minutes, because they feel fear using this device at first. So it depends on the symptom of the patients. Yeah. So it depends on the patients and age. And this device can use an abdomen, yeah,
Okay.
not only face. Yeah, by the abdomen, we confirmed that it is effective for diabetes and hypertension.
So it can control hypertension. That's what you're saying.
High blood pressure patients can regulate pressure down. Yeah.
And it can affect the gut bacteria also, your gut health.
Yeah.
Through stomach.
Yep. We also don't know. We just have many kind of symptoms examples.
This device is a prototype, or you are in the practice of this device?
Yeah.
Regular.
First of all, using face massages. Yeah, by you only using this, you only face.
I would love to use this device because it is very useful. It sounds like very, and I really like your explanation on virtual patients, any kind of patient. Even I'm in a fitness training program sessions I take all over the world online, so they are more comfortable actually online. You rightly said.
Yes, exactly. And
because they are in their own comfort, in their own home, and I'm in my place, so the interaction is very easy.
Yes, and then you also mentioned depression and anxiety. I believe as a society, as a whole, around the world, we're all feeling the same way because of social media, and it's not real. Whatever you see on social media, you always see everyone so happy with family and friends, but then that's just a picture, or that's a short video. It's just a scene, like a movie. It's not real life.
Exactly.
So as a society, now we feel we have more pressure. Oh, I have to look a certain way. That's why weight loss, you mentioned that, is becoming so popular. Everyone wants to be skinny and look like a certain way, but it's not real. It is not real. That's not the way life works. So I am all about social media detox. Try not looking at your phone for 1 hour.
Exactly.
People start like shaking. They don't know what to do. And it's becoming scary to think because everyone is addicted to the phone. But as a society, it's not good because we're very much always looking at what others are doing instead of focusing on ourselves. Exactly.
Thank you so much. Thank you.
Thank you.
All right, I'm going to have to end it there. We are running very, very late. Thank you so much. Please give a round of applause to our panel. If I can ask you all just to step to the front of the stage to take a quick photograph. A very engaging panel indeed. I'm sure the conversations will carry on into the lobby. Thank you so much, panelists. Thank you for all your insights. I'd like to jump straight on to our next panel, we are going to be discussing breaking free from the gender stereotypes, embracing authenticity for improved mental health. I'd like to welcome to the stage Reham Abukatwa, Urmi Kotari, my apologies, Heather Stokes, Dr. Maria Rodriguez, and Dr. Nita Nagra. Please put your hands together for our next panel. Yes, we're all hungry. We need energy. Great, the stage is yours.
All right, sorry, we were just waiting for one more panelist, but I guess she's not here, so we'll get started. Hi, everyone, I'm Nita Nagra. Oh, she's coming, so I'm just gonna hold off 1 second. All right, so sorry, as I was saying, I'm Nita Nagra. I'm a mental health nurse. I've been working in healthcare for over 17 years. In addition to that, I have a Doctor of Education and Leadership, and I've worked in various leadership positions in healthcare for over a decade now. And I am the founder of Fit to Be Strong Leader. And so we're gonna start off, I'm gonna be the moderator, and I'm gonna be starting off by just explaining why gender stereotypes are important to me, an example of I've encountered, and one way I think we need to address this, and then I will open it to the rest of the panel. So starting off, as I mentioned, I'm a nurse, and a gender stereotype that I've actually encountered is nursing is predominantly a female field, which is actually not true. I find it, there's a lot of males that are actually nurses. However, I feel that they encounter quite a bit of stereotypes being nurses. Often the stereotype is, why are you a nurse? Why are you not a doctor? And especially particularly men who do want to be nurses, it becomes quite difficult. So I think something that is really important, and I actually speak about this in my upcoming book, is that as individuals, we need to be self-aware of what our self-limiting beliefs are, and essentially the beliefs that we were surrounded by growing up, because only once we're aware of our belief system, and especially those self-limiting beliefs, we won't be projecting them onto others or projecting them onto ourselves. So I'll pass it on to Maria.
Hi, everyone. I'm Dr. Maria Rodriguez. I'm honored to be here today. So I own 3 counseling agencies in New Jersey, and I wanted to talk to you today about gender roles and motherhood, because one of the issues that I have actually in my career and my experiences has been being a mom and being a CEO, being a leader in the community, and how challenging that is. I grew up in a very strict environment as a Latina, very rigid roles that motherhood is first and foremost, and your children are first. So motherhood to me, as I grew up, meant that you had to self-sacrifice and give up yourself and your dreams in order to be a good mother. And that's actually what I wanted to discuss as we go through our conversations.
Hello, my name is Heather Ogburn-Stokes. I am the founder and CEO of Serenity Light Recovery. And I would say my experience, because I was going to share being a CEO and a mother, it can be challenging, but not impossible, and it's quite beautiful. So I'm eager to hear your thoughts too. So I'll go ahead and share from a client's perspective and an example they have, transgender-wise, right? They come in seeking assistance and wanting to be heard, but there's a lot of stereotypes with transgender individuals as well, and so trying to meet them where they're at. And I'll go in more in depth, but it's an issue, you know, and it affects mental health.
Hi everyone, my name is Urmi Kotari and I'm really pleased to be here. I'm a certified fitness coach and an energy coach where we combine fitness with a lot of self-awareness to help people improve their relationship with their bodies and at the same time really taking ownership and making decisions for fitness, for nutrition, but also for their emotional relationship with their body. And that really aligns them with their authentic goals when it comes to making better food choices or choosing the right kind of workouts or after that going into being the true person that they are. And I'm the founder of Kinetic Living. It's also a book now which is just published last year. And it is an original training method to do exactly this, where we are combining inner child healing with hardcore workouts, athletic-based workouts, in order to achieve this. And I'm also a Nike certified coach, and I'm really happy to be here. I'm going to speak about the gender stereotypes in fitness, not just for women, but also men, and how it prevents them from really going after authentic fitness as well as wellness practices that are inherently essential for our well-being. Thank you.
Thank you, Urmi. So hello everyone, I am Riham Abu Khatwa. I'm a regional supply chain director. I've been working in the Middle East for the last 20 years. Diverse industries that I've been serving, where half of my experience is in pharmaceutical. And today for the gender stereotype, it's an interesting panel. All of us are women here. So I'm gonna recall when I started my career back in Egypt, where I'm originally raised and born. I started my career graduating from civil engineer. So I worked in construction. And in my early career, I worked in a field with 1,500 men. And I was a consultant. So it was a very interesting start of my career, being an Arab Muslim and in a culture that welcomes women in a stereotype different than what their capability can do. So this was one of the challenges or maybe the first challenge I faced in my career. After this, in several industries I worked with, in supply chain, we have in manufacturing sites, we have distribution centers, we come with distributors, we come with procurement, with suppliers, and in pharma, we come with patients. And all those aspects also put us in a situation where we have to adapt, we have to understand the culture. I've been in the UAE for 20 years, and I think it's a land where we have cosmopolitan culture, and it opens up all our mindset, how we should learn other culture, how we should understand it, and unlearn myths and wrong perception. So I think it's experience that is very valuable, that adds to everyone's growth. Thank you. Bye.
Thank you. All right, so I'm gonna ask, Urmi, you had mentioned authenticity. So I'd like to ask all of you, what is your definition of authenticity and how does it impact mental health?
Okay, so authenticity. So let me give you an example of my experience. Coming here for me was a challenge because I've grown up, as I mentioned earlier, I grew up with very specific rigid roles that motherhood is motherhood and everything else is secondary. So I have two children, a 14-year-old who actually came with me, and then I have a 4-year-old who, she's absolutely adorable, but I thought I should not bring her because it would be more challenging for me. So now, when I presented this idea to my family, they were outraged. How could you leave her? How could you go to Dubai and leave your child behind? And it was to the point that I thought maybe a week or two before, I thought, you know what, maybe I shouldn't go. So authenticity it's a balance as opposed to being self-sacrificial. Finding that balance between what you expect of yourself, what others expect for you, and what you can offer to your family as opposed to, well, I'm just gonna give up everything and be what they want me to be, because when you become what they want you to be or the culture wants you to be, you become depressed, you isolate yourself, and you get lost in life.
Yes, that's beautiful, and I'm glad you made it here. I too have a similar experience. I have two really little babies, 4 years old and 2 years old. And when I told them why I was going, my husband stepped up and said, okay, I'm going to take off when I need to, and we'll rearrange schools, and you go and live your dream and your mission and do what you need to do. And he's big military, you know, and for him to be able to step up in his role as a father and being able to say, in his role of a husband, to say, I support you, right? It empowered me and encouraged me to stay true to myself, because it's, to be authentic, it's a journey of self-discovery, right? And to learn, if you don't even know who you are, how are you going to be truly authentic? And so giving yourself that truth, that the time that you can be mindful and say, what do I like, what am I okay with, what am I not, right? And what is your purpose in life, and staying true to it, that at least encourages me and empowers me to be very authentic and outspoken, because otherwise I'm miserable and not living my best life.
So for me, authenticity is being real, is being genuine. And for the purpose of this discussion, I'm going to limit that to fitness and wellness from my side. And we, like a lot of panel discussions, have spoken about the necessity to be real on social media. And fitness is, I think, one of the topmost fields that has been impacted because of this, where we are promoting unrealistic standards of physical body types. And that is taking people away from really first embracing where they currently are. And yesterday also, some amazing points came out about really first accepting, and that was true body positivity, but also then looking at health. And instead of having standards of measurements or having a certain six-pack or a certain booty type, having to actually measure biomarkers such as resting heart rate, body fat, which is important for even human cognition. Body fat is not just an aesthetic thing, it actually affects human cognition and memory. So really highlighting those important aspects, and how it starts affecting is, let's say I'm a woman and I love doing weights, but if I'm constantly told that I look like a man, or a man is told don't do Pilates because that's a girl's sport, they are not going to explore different avenues. And I've met so many students who come to me and say, you know what, I thought that this was such a girl thing. And I'm like, no, but this is going to really help your spine, it's going to help your posture. And they don't go and explore. And in fitness and wellness, enjoyment is so important. But if we don't know who we authentically are, how will we enjoy something? And that directly affects consistency levels. And we all have spoken about how exercise is important for mental health. So if you see, it comes back a full circle, but at such a fundamental level, we then are not emotionally connected to what we are doing. And that's when people say, I'm not disciplined, I'm not consistent. And as an energy coach, I tell them that it's not because that you're not consistent, it's because you don't know your why. Why are you pursuing this workout? Why are you pursuing this, why are you eating this food? And people tell me, oh, are you on a diet? Because they see my plate, and I'm like, no, because I know what this does to my body. So I think that's how the lack of authenticity and gender stereotyping is affecting in fitness and wellness, and how directly that impacts mental health. And the last thing is about having unrealistic goals. And in Nike, we used to say this thing, which is like, we turned around the campaign, but it was run like a girl is a really stereotypical phrase, which is used a lot, especially in schools, right? Don't run like a girl, or, oh, you run like a girl, and that's so insulting. But at the same time, we change and we say like, yeah, hell, I run like a girl and I sprint. So I think we need these kind of stereotypical statements are making it harder for people to embrace enjoyment and true empowerment. Yeah, thank you.
Thank you, Urmi. So authenticity for me is how we create this harmony between our thoughts, our feelings, and our actions. In leadership, we always want to create an impact. We want to empower others. So how I link authenticity to well-being, it is empowering. It is empowering us when we create this harmony, managing ourselves. How are we gonna reduce stress, reduce anxiety, increase self-esteem, increase self-confidence, to open the door and reach people in front of you, to start the communication, the conversation, the impact, whatever message you want to deliver to these people. So being authentic is one strong element of being a leader, to drive yourself for growth. And when I look into all those aspects, I feel that authenticity is driving our well-being to be better human, deliver better messages, and being adaptive. I'm hearing a lot about AI, I'm hearing a lot about e-commerce, I'm hearing a lot about new concepts of social media. We shouldn't be blind to this. This is the future. This is the new generation that we have to work with, and we have to coach to give them the torch to start the era of whatever we started. So for me, I'm learning a lot from the new generation, how I'm adapting my mind, how am I adapting the business practice as a transformation leader who should be a visionary for the future, how we should open up ourselves to be authentic, well-being, and in the same time, adopt the future, the new wave that is coming to us. The new generation is very quick, very fast, and they don't have the patience to read papers, to read and focus on everything. They want everything quickly, at a glance, and they need us. They need our coaching, they need our wisdom, and we need to learn how to speak their language. I've been seeing a great example Zainab just demonstrated for us, where Zainab adopted all her mission to reach her culture through speaking their language, through the communication aspect of having forums where she celebrates in the music, food, or whatsoever. But in the middle, she has a purpose and a cause she wants to deliver to these people. And she found the medium. And I think what we are missing in pharmaceutical and in health business or life-size business is how we should transition from the rigidity of science to make it a life science.
Thank you. I mean, you guys made some really great points. And for me, my takeaway, and actually I speak about this in my book as well, is that authenticity isn't actually something static. It's actually dynamic, because the person who I thought I was, when I was 21 years old and I entered nursing, I didn't think I could be a leader. Because growing up in my culture, women aren't leaders. I mean, at least the women that I was around, they weren't leaders. And then here I am now, I have my own leadership consultancy. So I think as we're exposed to new information, we're challenging our beliefs, we're challenging those the phrases that society is imposing on us. We learn more about ourselves and we become more of our authentic selves. All right, so I'm gonna be moving on to our last question. So can you please, all of you, tell me about what modalities can individuals engage in to enhance their mental health so that they can break free from stereotypes?
And I wanted to add gender roles not only affect women. In parenting, for example, it affects men as well. I've given you my personal example of coming here and how my mom kept insisting that I shouldn't come and the other women in my family. So, but then what does that say about the dad in the picture? Does that mean that he's not skilled enough or doesn't have the parenting skills to provide a healthy environment for his child, right? So moving forward in your question, right? I recently published a book with Jack Canfield. He's the author of Chicken Soup for the Soul. And in this book, Success Redefined, we talk about how can we redefine what success means to each and every one of us. So in my practice, I've taught the clinicians that work with me that to look specifically at that family and look at the skill set that they have and how they can manage life moving forward, as opposed to constantly comparing themselves to what culture has taught us or to what we see in social media, because there are so much pressure that's put out there to live this perfect life. So what are your goals in your particular family? What does success mean to you, and how can you balance what you need to be happy and authentic?
For me, it's providing a safe space for an individual to learn self-love, so then they can empower themselves to be authentic. And the space that we create in our, inpatient service, I mean, it's essentially a wellness retreat. Come and find yourself again, right? This safe space where there's no judgment, where you are cherished and loved for who you are, and we are going to help you on that journey so you're not alone. You feel accepted, right? And then we teach different modalities like acupuncture, breath work. There's meditation, yoga therapy, exercise, life coaching, recovery coaching. You need that mentor to be able to lean on when life gets tough, whether it be a coach or someone which is typically someone that is very skilled in the same experiences that you've led, right, that can guide you. But giving them that opportunity to feel safe, to be truly who they are, and to be able to express it. And for me, it's meditation, yoga, getting in touch, having that quiet space. I don't like to be quiet, right? I like to talk. My mind is going a million miles a minute. And the moment that I'm silent, it's like, whoa, I'm just with me, right? And how do I feel, instead of kind of reading the room. And I just want to share just a quick story on that client that I mentioned and his struggles with transgender. He came to us, and he came with a name and a story, and about 2 weeks in, he made comments of he's just tired and doesn't want to live anymore, right? So then we had to come in, comfort, what are your needs, how can we help you? We transferred to a higher level of care so they can stabilize. And then we welcomed him back, no judgment, met him where he was at. We had to identify, okay, what room would you be in? Because it's co-ed, right? We have men and women, and we have a transgender. Where are you gonna feel safe at? And are you willing to open about, nobody knew that he was a transgender. He didn't want to share that, and he didn't have to. But what are we going to do about rooming, right? And so we gave him a place of his own, a room on his own, and just kept giving him that safe space, right? Then having conversations as to his why and that journey of self-discovery. And then he opened up and said, I'm actually wanting to transition back. I don't want to be female to male, stopped taking the hormones, but now just riddled with, a beard and other things. And he had stopped, now I can say she, right? That she stopped taking hormones and wanted to be herself, but she was terrified of admitting that she was homosexual. So she would rather become a man, because there was no acceptance. There was no awareness, no just unconditional love in her experience. And so having that conversation, she's like, what am I going to do? I have a beard. I don't know what to do. Well, can you shave? I have a 5 o'clock shadow. Okay, let's help you through this. The next day, she picked a roommate, right? Now she's open about her transition back, and she was greeted with love and kindness. She shaved, she put makeup on, and she could outwardly admit that she was homosexual, right? And we can give her tools to help navigate those feelings and empower herself to be true to herself. And she's smiling, right?
Thank you, Heather. Thank you for sharing that story. That's amazing.
So regarding regarding the modalities, first I'll just start with the creating the safe space, and I think it starts with our own home, that is our body. Before our rooms, before our houses, we live in our own bodies. And that's why I really focus on, along with fitness, the somatic practices such as even body tapping, shaking, dancing, which are unstructured forms of movement to really shake off that stagnant old energy or restless energy, and a lot of nervous system regulation, even aligning fitness workouts to align with their nervous system health. Nowadays, like we've spoken about, screen addiction, lack of sleep, all of that is changing and elevating everyone's heart rates. People's HRV, which is heart rate variability, that's going into the wrong direction. And that's creating so much of the physical restlessness as well. So the first thing we need to address is our, like I said, the physical body, because that's our tool of experiencing life on earth. And combining that with shadow work and inner child healing can really help to accept the body and also overcome the traumas or the limiting beliefs, like you said, about I'm not good enough. And no matter, I have seen so many women and men like who have come as students to us, or I'm quite popular on social media, but at the same time, I try to promote as much of it's not what you weigh. And they've come and told me I've lost XYZ kilos, but I still feel fat. And that's because the limiting belief, the inner child is still not feeling enough. And that's, of course, all parents do their best, but because of cultural conditioning, we are forced to believe that, oh, if you don't lose weight, you won't get married. And that's a very Indian thing for an Indian parent to say to their, especially their girl, where, oh, you better lose weight because you will not find anyone. And women are really going through a very disturbing relationship with their bodies with this. So I think no matter how much ever they do action-wise, if they still don't feel enough, so I think, I don't want to repeat myself, but yeah, inner child work and creating a lot of awareness about instead of measuring, like I said, weight or BMI, looking at biomarkers, looking at body fat, looking at VO2 max, or doing stress tests, that can really help. And stop commenting on people's weights the first time you see them after a really long time. And this is again, oh, you've lost so much weight, oh, you've gained so much weight. Like, can you just be your own body, right? You don't know what that person has gone through. So I think a lot of compassion is needed. And at an individual level, I have this term which we use, BYOB, which is bring your own best shape. Because if we take care of our bodies, put the right thoughts and moderate amount of exercise, your body's naturally going to have its own intelligence to come back to its natural weight. So we don't need too many things in order to, but we are just made to believe that we need a lot. And lastly, to do what you enjoy first, and community, like even Heather mentioned about retreats. I think the whole community aspect of coming together, moving our bodies together, that can create a lot of enjoyment. And yeah, I'll just pause at that.
All right, so in order not to repeat what all the great ladies here said, I think I would like to build on what they said, that it's a journey. Transforming and changing something that we inherited from tradition and that's in cultures is not easy. and it will never be easy for anyone to change. But we have to start. And having said that, it's an ecosystem that we have to build. It has to start from parents have to have their tools to educate their kids. Then these kids, when they go to school, the school have to have a good quality of education that will give them example and role models of what is a stereotype and that things can change. So education, and after this, it goes into the community, where we need our community elements to be open for change and embrace change. Then going further, we have to create our networks where we have purpose and we spread the word together on hand in hand. We have to drive this change. I recall the Ikigai and the blue zones. Everybody now in pharma is talking about longevity and how, what can we take? Is the NDA IV working? Will it give me the push? Will it change my cells? Actually, they found out it's not what you will put in your body only. It's very important to watch out to what you feed your body, the physical exercise, the creative exercise, but also your feeling of belonging. You belong to someone. You belong to a community that has a purpose, that want to do something that will give you longevity. This is very important, that we create a cause and a purpose and we drive it with others. We are not alone in this world, and majority of the situation we are living in is because of feeling disconnected. We should not feel disconnected. We should not let social media put our kids in silos. Actually, they should step outside and connect with people to do something bigger, even on social media maybe, but let them connect open. Don't oppose new things, but use it as a medium where they can build on connecting to create this ecosystem to have a bigger change. And I think we are almost up.
Yes, that's right. We are at time now, so thank you for your great insights. And I know everyone's probably hungry and waiting for the recognition session, so thank you for listening to us.
Thank you, ladies. Thank you, thank you, thank you. Such a beautiful panel that we have here. Can we all just take a step forward to the stage so we can have a group picture? We need to capture these moments that'll stay with us forever. Great. Thank you so much. A round of applause for our panel. And how is everyone doing in the room? Lift one hand up. Take a nice deep breath. And out. Lift the other hand up. Nice deep breath. And out. Both hands up. And shake. And now we're all happy. Yes? Yes, we are. All right, so this is the moment that we've all been waiting for. It is our recognition session. So I know you all know who you are, and I hope you've got all your speeches ready and people and family here to take photos of you. Yes. I would like to bring on Mr. Ahmed Khan. He is the head of marketing and strategy advisor at Next Generation Corporate Services. He will be presenting the awards to you. Mr. Ahmed, where are you? We've lost him. I think he got nervous. I think he had to run off to the bathroom. But Kunal, do you want to say something? No? Aww. I was hoping you would jump up and say something. When I did the hand thing, you got really excited for a second. I know. Stop it. I hope the rest of the room didn't hear that. All right. So, is Ahmed back? Still not? All right, I'm going to ask Kunal to come to the stage anyway. All right, don't worry, we've made up some time, and don't worry, I'm still going to give you your full hour lunch. We're just going to be pushing the afternoon sessions a little bit later. All right, how are you? Yes? Here's a mic. You're nice and tall. I can't stand behind this thing. All right.
Yes, what can I do?
Introduce yourself to the people, for those of you who don't know you.
I'm Kunal Sharma, and I'm from Bombay. I'm into wellness and fitness from the last 32 years, and I'm very excited to be here with you guys from different nationalities. And it's a really amazing platform which I never experienced in my life, because all of you are so friendly and so good. I can't explain in words. Thank you.
All right. Yes, give him a round of applause.
Thank you.
All right, now, if you've seen Mr. Kunal these last 2 days, you always see that he's very extravagant in his clothing, and he stands out in a crowd. The very first day, I spotted him because he was wearing a lovely pink suit. It was amazing. And now, I want to know, does the shirt mean anything?
This is Benetton.
What does it mean?
Just a simple Benetton brand in India. It's actually not India, it's just an international brand. It's actually France.
A French brand.
French brand,
Lovely,
right.
lovely. I was hoping there was a more exciting story, but that's okay as well.
Thank you. Yeah,
right.
there is an exciting story which I actually didn't want to tell you, but she mentioned my dressing from the first day, because I'm in modeling and acting as well as in wellness and fitness business. But my main passion is wellness and fitness. Modeling and acting and ramp shows go side by side. It's just like, hobby. So that can be one of the reasons.
It's okay. I can get that energy from you, that you're in that field of entertainment.
But thank you so much.
All right, well, thank you for sharing the stage with me. We have Mr. Ahmed Khan with us now. Like I said, the head of marketing and strategy advisor for Next Gen Corporate Services. How are you, sir? Everything good? Very nice. Yes, I am well, thank you. So you're just going to be standing on the other side of the stage. They'll be handing the awards, and I would like to bring on our very first award winner for the Health 2.0 Conference Outstanding Leadership Award, Amer Patel. Amer Patel. He is a partner and healthcare sector lead for deals and transaction advisory business of PwC Middle East. He brings more than 16 years of global sector experience as an advisor and as an investor. Having worked in the US, Asia, and most recently in the Middle East, his sector ethos revolves around value-based care, embracing ESG principles, and adopting technology and Gen AI capabilities. Great, congratulations. Up next for our Outstanding Leadership Award, I'd like to welcome back to the stage Brian Manu. Brian is an accomplished finance professional and entrepreneur who has made significant contributions in the field of pharmaceuticals and financial technology in Zimbabwe. As a co-founder and director of MediConnect Pharmaceuticals, Brian's strategic leadership and operational oversight have propelled the company to become a trusted provider of high-quality pharmaceuticals in Zimbabwe. All right, Mr. Ahmed, I'm just going to ask you to take a step forward when doing the yes.
Thank you very much. I really appreciate the honor. I would like to appreciate the staff at MediConnect Pharmaceuticals back in Zimbabwe, the staff at Wiremeet Money Transfers who are working so hard so that we can support this pharma business. My partner, Dexter Blackstock, he couldn't be with us as he's traveling. I'm grateful for my family as well, my wife and kids, and my parents, and everyone else who's supporting us and rooting for us. And thank you all to the professionals here. It was good sharing your wonderful experiences and all the knowledge that I've gathered here. Thank you. Those that are in pharma, manufacturing, please, let's get in touch, let's connect, and let's do business. Thank you.
Congratulations. Health 2.0 Conference Outstanding Leadership Award. Would like to present this to Davian B. Potts. Davian, are you in the room? I don't think so. Moving on for, again, the Outstanding Leadership Award, Dipanjan Chadhuri, Vice President of the Global Commercials and Strategy Division at 4C Pharma Solutions. Dipanjan has been part of the drug safety industry for more than 15 years and was associated with some of the leading CROs in his previous roles, leading to multiple accounts ranging from smaller biotech to large pharma accounts.
Thank you, Health, for this award. Humbled and honored. As they say, a leader is as good as his or her team. So this award is dedicated to all the teams I've led across Cognizant, LabCorp, Bioclinica, 4C Pharma Solutions. So thank you.
Thank you. For the Health 2.0 Conference Outstanding Leadership Award, I'd like to welcome back to the stage Dr. Aslam El Nabrisi. She is the Associate Director for Quality Assurance at Dubai Medical University. Her primary areas of expertise include quality assurance, risk management, teamwork, and problem solving. In addition to being quality professional, Dr. Aslam is an Associate Professor at Dubai Medical University, specializing in pharmacology.
Thank you, everyone, and thanks. The big thanks goes to Health 2.0 Conference for bringing everyone together. Health actually brings everyone together. Also, I would like to extend my thanks and gratitude to Dubai Medical College for Girls, soon to become Dubai Medical University. Wish us luck, and thank you very much.
Best of luck indeed. That is very exciting. Up next, for an Outstanding Organization Award, I'd like to invite Jason Corning to the stage. Jason, are you in the room? Yes, all right. Founded by Mr. Jason Corning, Mizaru Corporation is an inclusive online platform matching people with disabilities with freelance support providers based on qualifications and personalized needs. It believes that together we can create an inclusive world where accessibility and equality are not just slogans but actions.
I just wanted to say thank you to the health conference, everyone that's come here. I've noticed probably about 40% of all of the clinics and everybody who've provided different individuals with disabilities and setting up support. So I would like to be able to provide any consultation for any of that accessibility needs that you may have to be able to enhance your healthcare provider support that you have, to provide that to any of your patients or your businesses. So thank you.
Thank you and congratulations, Jason. Up next for our Outstanding Leadership Award, I'd like to invite Kanwar Birsing to the stage. Kanwar, are you in? Yes? Very good. Kanvar is the co-founder and director of Vestige Marketing PVT Ltd, India's most trusted homegrown direct selling company dealing in world-class wellness products. With over 2 decades of experience, Mr. Singh has been instrumental in mapping Vestige's digital growth ever since he joined back in 2004.
Thank you for the honor, and it's a really pride moment for me to be here representing my company. It's a journey we started 2 decades ago, and the mission was to eradicate malnutrition from the children in our country, and we've got about 40 million people who are our subscribers now, and really happy to take this journey forward. It still feels like we've just started, and there's a long way to go. Thank you so much.
40 million is no small number. The next award, they could not be here, but I'd still like to recognize them for Health 2.0 Conference Outstanding Leadership Award. Please put your hands together for Dennis Barbieri. Thank you. Health 2.0 Conference Outstanding Leadership Award. This goes to Mark Hatch. I'd like to welcome him back to the stage. He is a physical therapist of strength and conditioning coach at Core Lab, who has forged a remarkable path in the world of fitness and well-being. His practical experience includes interning with Fulham Football Club women's first team and collegiate athletes at Stanford University.
Thank you. In 2017, I was a 24-year-old boy with a vision and dream to help people achieve the best, become the best version of themselves. And a lot of people stood in my way and said, you know, you can't, no, you won't. Lebanon does not help. It's a bad country to invest, whatever. 7 years later, just a month ago, so yeah, I forgot to mention 2017, it was this, so I just went and did my, what I thought I wanted to do. And I started off in my small garage. 7 years later, like literally a month ago, I opened up a big facility that has physical therapy, strength and conditioning, and performance center for athletes and non-athletes. And I have now a team of 5 extraordinary trainers, and I call them leaders as well. So I want to, and I'm here at Health 2.0 Conference, like being award Leadership Award. This is amazing. And so I want to extend my thankful, like my gratitude to everyone supporting me, my friends, my family, mom, dad, and my little brother. And for my outstanding team, my Core Lab team, thanks for each and every person there, because if it weren't for them, we wouldn't be standing here. Thank you so much.
Good job, Mark. Up next for Health 2.0 Conference Outstanding Leadership Award, I'd like to invite Michael Nygard to the stage. Michael is the founder. Yes, give him a round of applause. Founder and CEO of STOPAS, and is driven by a mission to address and alleviate challenging behaviors within health and social sectors. With a deep-rooted belief in a holistic and person-centered approach, they extend their expertise across various areas including dementia, children and youth, disability, and social psychiatry sectors.
Thank you for the award. I have to thank you, my team back home in Denmark, because without them this wasn't possible. And I'd like to thank you, my family sitting right down there, also for supporting me, which is necessary to do this work. And I'm very nervous, of course. So, and thank you all for being here. Have a nice day.
Thank you and congratulations. Up next for the Health 2.0 Conference Visionaries Award, I'd like to welcome Mohammed Solwa. Mohammed Solwa. As the Director of Internal Audit at Sidra Medicine in Qatar, Mohammed undertakes the pivotal responsibility of developing and implementing a robust internal audit function. Mohammed's expertise lies not only with his impressive academic background, but also in his diverse set of certifications, including being qualified chartered accountant from the South African Institute of Chartered Accountants, a certified fraud examiner and governance, a risk and compliance professional, and certified strategic director.
Firstly, I'd like to thank Health 2.0 for arranging this conference and allowing us to meet with all you lovely people out there networking. I think that's a fantastic opportunity, and thank you for that. Obviously, this, we have to thank Sidra Medicine, a state-of-the-art hospital in Qatar, established in 2017, for the remarkable work that they have done, and my colleagues over there in supporting us in driving the audit and clinical audit functions in terms of improving patient safety. Finally, I'd like to thank my family, my wife, my mom, my late dad, who've been a pillar of strength for me in my journey so far. And hopefully we can, together with their support and with your support, achieve more things in the healthcare sector. Thank you.
Thank you. Up next for Outstanding Leadership Award, I'd like to welcome to the stage Olena Edwards. Olena Edwards, psychotherapist and director at Dr. Olena Skadowska, Harley Therapy London, has over 20 years of clinical experience, having worked in private practices, a refugee center, and a women's clinic, the NHS, and in the student counseling, in addition to working for Harley Therapy. Olena's areas of expertise lie in working with depression and anxiety, loss and bereavement, relationships, trauma, work and careers, cancer, as well as addiction and abuse.
I'm both delighted and excited to be the recipient of this wonderful award. Thank you, organizers. It's been a great event. I work in mental health, and I would like to use this opportunity, this wonderful platform, to remind us all that mental health is health. Now we have better awareness and acceptance that neglect of our mental well-being can have dangerous and long-lasting impact, not just on us, but on all people that we are constellation to and have a relationship with. And these are our colleagues, our families, our friends. As a therapist, I would also like to remind you that leadership has a shadow side to it. And if I ask you to think for a moment, what could that be? As a clinician, I can say that the shadow side of leadership is burnout, depression, anxiety, and another word starting with L is loneliness. The shadow side of leadership is lack of empathy for ourselves and people that we work with and manage. In order to be creative, curious, compassionate, playful, which is very important, and truly inspirational, we do need to invest in creating a balanced lifestyle, not just for ourselves, but for people that we work with and for people that we manage. Look after yourselves to be able to look after the others. Thank you.
Thank you, Olena. Health 2.0 Conference Outstanding Leadership Award would like to invite Dr. Pedro Luis Gonzalez Sanz to the stage. Dr. Pedro Gonzalez Sanz is the CEO and doctor, is a certified physician specializing in preventative medicine who practices personalized lifestyle medicine. He has created a unique revitalization and recovery program that relies on changing epigenetic expression through natural bioregulation. He detects alterations in the metabolic pathways years before they occur. You sound like a future reader.
Thank you very much to you all for this award that is given among such outstanding people, no? And especially now that I'm in a quest to trying to show people how the body, mind, and spirit work interconnected, and to show them also that they can create their biological reality. But after overall, I want to thank you this to my adorable husband and children. Without them, I couldn't be here doing this. Thank you very much.
Thank you, Doctor. Our next award winner is not here, but I would like to acknowledge them. So if you could just give a round of applause to the Outstanding Leadership Award that is to Priya Govindasamy. Just to acknowledge her achievements. Up next for Health Conference 2.0 Outstanding Leadership Award, I'd like to invite back to the stage Raham Abukatwa. Following her passionate journey, Raham, regional head of supply chain at Sanofi, entered the pharmaceutical business, growing professionally and contributing to important supply chain choices as the board member of Sanofi's regional leadership team.
Thank you everyone for this recognition. First, I'd like to thank Health 2.0 for the organization of this conference. I enjoyed those 3 days with all of you. Second, I would like to thank all of you. You gave me the confidence that the health of the world is in good hands. And thank you for your purposeful journeys that you shared with all of us that made us feel that there is hope for the next generation. I would like next to thank all organizations I worked with for their trust in me to transform the practice of business, to make it a better service for all around us. I would like to thank my family for raising me as resilient, as curious, and as a person who never gives up. I would like to thank my husband, who has been a great support for me, who is always pushing me to explore the best in me. And at last, I would like to thank my son, who believes in his mom's superpower to make this world a better place. Thank you.
Thank you. Health 2.0 Outstanding Leadership Award. I'd like to present this award to Roland France. Roland France, the founder of The Fit Co., is a renowned figure in the realm of fitness, coaching, and wellness health management. With a scientific and holistic approach, Roland goes behind mere physical fitness. He understands the profound connection between the body and the mind, helping his clients achieve an equilibrium that radiates vitality.
Hello, everyone. I'd like to thank HealthCon 2.0 for this recognition and acknowledgement, and also for organizing such a wonderful connect. And I do hope, and I'm sure most of us have made beautiful connections over here. So I wish you all to be and stay connected as well in the future. Yes, and I'd also like to thank my family, who have been a wonderful support, my mom, dad, my sister, and my lovely wife, who has tolerated me, supported me through my quacks and quirks. and especially my team and my colleagues. Without them, I don't think so the fitco.in would be possible. Okay? And yes, that's it. Thank you all.
Well done. Another participant who is not here, but I'd like to acknowledge for Outstanding Leadership Award, please put your hands together for Dr. Saad Al-Rashidi. Outstanding Leadership Award would be given to Shaker Natarajan. Shaker is currently Vice President of Regulatory Affairs at Dyne Therapeutics, and that is in the USA, in Massachusetts. Shaker has over 2 decades of pharmaceutical industry experience working for various multinational pharmaceutical companies, including Merck, Serono, Johnson & Johnson, JSK, UCB, and Biocon, where he provided regulatory strategy support.
First of all, thank you to Health 2.0 for this award and for this organizing this fantastic event, and to Maxim for being a wonderful host, actually. This certainly gives me a great sense of pride and achievement. My sincere thanks to my family, particularly my mum, who is 82, and she suffers from Parkinson's disease. She's been battling this for the last 12 years. My lovely wife, she's been there with me, supported me throughout my journey. My 3 beautiful daughters, so thank you. I won't be here without them. But also to my colleagues, my peers who guided me and supported me throughout my journey. So I look forward to continuing my efforts in finding therapies for rare disease and orphan indications. I've been in this space for over a decade now, so I hope to continue my efforts in that space and help the patient community. Thank you so much and have a good day.
Thank you. Congratulations. Up next for the Health 2.0 Conference Outstanding Leadership Award, I'd like to welcome back to the stage Dr. Arun Castro. Ooh. I know he's here, so I'm going to come back to him. Yeah, let's do that. Let's come back to Arun. Maybe he's just run out to get some coffee. Up next for the Health 2.0 Conference Outstanding Leadership Award, I'd like to present this to Tony Sorensen. Tony is the founder and impact ambassador of 75 Pharma, has revolutionized the pharmaceutical industry with the pioneering profit with purpose business model, underpinned by an ethos of unselfishness. His innovative and forward-thinking initiatives have dramatically reshaped the sector, setting new standards for both impact and innovation.
Hi, everybody. I'd like to say, first of all, that what an amazing event. I mean, the level of academical skill combined with, you know, the considerate, mindful people that has been here has been, like, breathtaking. I'm taking so much from this conference with me, and it's been amazing. I would like to extend a thank you to my wonderful daughters, Ariel, who is 13 soon, and Bianca, who's 8, which is the reason why I'm living, breathing, and making an effort to change this world. I don't want to leave them in this world as it is when I depart from this world. So on the basis of children, I would like to ask you all to join me in one thing: a silent minute for the dead and dying children of Gaza. And I would like everybody to stand up and share 1 minute of silence with me. Please. Starting now. Thank you.
Thank you, Tony. We all call for ceasefire. There's no other word for it, just ceasefire. Thank you. All right, backtracking. Health Leadership Outstanding Award. Please welcome back to the stage Dr. Arun Castro. Dr. Castro is a medical director at roadymedic.com, which is an innovative clinic for touring artists and production professionals. Arun has had a career working as a freelance doctor at some of the UK's largest festivals. Arun, in addition, provides a clinic for the British Association for Performing Arts Medicine charity, which has so far provided care for over 250 creatives working in live music, dance, and theatre. Oh, he's got a slide too.
I'd like to just thank my family, an amazing Dr. Tracy Aaron Castro, an amazing pediatrician back in the UK, and also great support in my life. I'd like to thank Rafi and Ramon, the two that helped me design the logo, and I've got to thank the clinical team at Rody Medic, who put on the great service that means that we can help people on tour with their creative process. I'd like to also thank the artists and agents that trust us to support them. I think the vision's simple. We want the music industry to have careers that are sustainable, that have creativity and longevity, and we're part of that backline support for it. So thank you.
Rock and roll it's not what it used to be, right? All right, up next for the Health 2.0 Conference Outstanding Leadership Award, I'd like to invite Dr. Jai Ganesh. Dr. Jai Ganesh is the current chairman of the Emergency Department of Tawam Hospital and leads the Emergency Medicine Council for Abu Dhabi Health Services Company. Under his leadership, Tawam AD is now the busiest emergency department in the entire United Arab Emirates.
Good afternoon, ladies and gentlemen. At the outset, thank you, Health 2.0, for this honor. I'm ever grateful to my CEO, Mr. Saeed Jabbar Al-Kuwaiti, for empowering me to try and do more for the people of UAE. And I have to thank my family and team for supporting it. Otherwise, emergency medicine is just a not one-man sport. It's a team sport. And during this networking, what I found out is, important is, hardships seem to make ordinary people like us into receiving extraordinary destiny by coming up on stage. So that's an important thing. And as an emergency physician and a doctor, the secret to life is finding joy in doing ordinary things, so don't forget that. On that note, thank you very much.
Thank you, Doctor. Love your work. Health 2.0 Conference Outstanding Leadership Award. I'd like to present this to Urmi Kotari. She is the creator and founder of Kinetic Living, a boutique fitness experience that combines movement and awareness to develop the body-mind connect. Over her 25-year journey, she has studied multiple disciplines such as functional training, kettlebells, animal flow, Pilates, yoga to integrate them into her philosophy. A fun fact, she was Mumbai's very first Nike certified trainer and is also an Apple Fitness Plus trainer.
Thank you so much, Health 2.0, for this award, and it was a pleasure connecting with so many professionals and doctors from different modalities. Especially for me, I'm taking particular interest in understanding brain function a lot more because that's where all the decisions are made. And I would just love to appeal to you one thing is if you wouldn't put kerosene in your Lamborghini or if you wouldn't treat your child improperly, I would appeal you to treat your body like your best friend, because our body is the first step to becoming a better leader, better mother, better sister, father, everything. And kinetic living is a vision that I have, that everyone in this world will find their own version of a kinetic life. And yeah, I'm on stage, a kinetic living being, and hoping that everyone finds their own version as well. Thank you. Sorry, I just forgot to mention, in case you're more curious about this philosophy and training method, I have also written a book, and it's available worldwide by Bloomsbury. So yes, the book is called Kinetic Living. Thank you.
Thank you. Up next for the Health 2.0 Conference Outstanding Leadership Award, I'd like to invite Dr. Vakat Raju. Dr. Vakat is a consultant in the emergency medicine, CESR, program director and teaching lead at Royal Derby Hospital in the United Kingdom. The doctor is a fellow of the Royal College of Emergency Medicine in the UK and a fellow of the European Board of Emergency Medicine. His special interests are emergency toxicology, medical education, faculty development, emergency medicine leadership, major trauma, human factors, and patient safety and quality improvements.
I have a dream, said Martin Luther King. Sometimes dreams come true. And let me challenge you, ladies and gentlemen, never give up on your dreams. Leadership is a journey, and it begins with 3 C's: connection, collaboration, and compassion. Thank you, Health 2.0. Let's all connect and collaborate with compassion to advance the healthcare industry, to help the downtrodden, and to make this world a better place to live. Thank you very much.
Profound words indeed. Thank you, Doctor. I'd like to welcome for our next award, it's a Visionaries Award. I'd like to welcome Wissam Yassi, MD. Wissam is one of the founders and the CEO and Chief Medical Officer of the med company BV. He is also a cardiologist at St. Jansdal Hospital in the Netherlands since March 2019. He's had a clear vision to address current and future challenges in a practical and innovative way, using the best of 2 worlds of medicine and technology. Can we invite the family up on stage?
Yeah, give it to, because they are the real winners. So thank you so much. Thank you so much. There are a few moments in time in which you are speechless and totally speechless, which is this moment. It comes definitely handy. But I really want to thank Dubai and the whole organization of Health 2.0 to create such a gathering of outstanding people in health, that we can work together to improve one thing which we love the most, the well-being of our patients. So thank you so much. And I really want to thank my best friends, Zaid and Bashar. They are also my business partners. Without them, I couldn't be here. But Number one, I would like to thank my big family, especially my parents, my mother and father. And I would like to thank my wife, my colleague, and my best friend for putting up with me, and my two boys, Thomas and David, for all their support and believing in me. Thank you very much.
Oh, yes. Picture. Yes, take a picture, please. Yes. Congratulations. You're very welcome. All right, moving on for the Health 2.0 Conference Visionaries Award, Hadi Mirza. Hadi. Director at My Dent, he began his career as a general practitioner dentist, where his passion for the profession and dedication to personal development propelled him to excel. Hardy's focus lies in self-development, aiming to become a dental guru in the Netherlands. He envisions creating a platform where individuals can think innovatively and contribute to a brighter future.
It is Hardy Mirza. But thank you. Yeah, that's an R there. No problem. Yeah, what should I say? I've heard so many nice speeches, and I've built up the tensions for myself to hear you all. First of all, I will thank you all to be here, to have the flight from wherever you are, to be here with us and with me, and to have the ability to connect. I have met a lot of interesting people. Bow down to you guys. Secondly, I will thank you, Health 2.0, to organize this. Third, don't forget, I'm here from a really big organization in Holland, Maiden, which is actually the alternative for the private equities dental clinics in the Netherlands, which is built up just for the dentist, from the vision of the dentist. I want to thank Nora and Nahagi, Shoram Baloksaal from there. They are my CEOs and the secretary, who are actually at this moment looking out for the company when I'm here with you guys. I want to thank you also, my family, who were from Iraq, actually, originally, flew to the Netherlands, and me coming back to Dubai. Thank you all. Thank you too.
Thank you, Dr. Hardy Mirza. Up next for the Young Leadership Award, I'd like to invite Dr. Melissa Turki-Zadeh. She is a medical doctor practicing at the world-renowned Guy's and St. Thomas NHS Foundation Trust in London, UK. Melissa has held numerous leadership positions and is currently acting as a welfare officer of her hospital's junior doctors group. Most notably, her leadership skills have been particularly demonstrated in her role as president of King's College London's Plastic Reconstruction and Aesthetic Surgery Society. Up next for the Health 2.0 Visionaries Award, I'd like to invite Yuki Kamiya. Yuki Kamiya is the CEO of Myrodia Therapeutics. Yuki, are you here? No? All right, maybe we can come back to that one a little bit later. Up next for the Health 2.0 Conference Outstanding Leadership Award, Dr. Hitoshi Naraoka. This is a video, so if we could please play the video as he accepts his award.
First of all, I'm deeply humbled and honored to have been recognized as one of the recipients of the Outstanding Leadership Award from this conference. I'm grateful for the everyday work and support my team, mentors, collaborators, friends, and my family. This award highlights the collective achievement of our whole team. Encouraged by this award, I'd like to continue contributing the healthcare field through the drug discovery and the translation science. Thank you so much.
Up next for the Health 2.0 Outstanding Organization Awards, I'd like to welcome Josh Forst to come and accept this award on behalf of TY Health Insurance. And they position itself as a comprehensive one-stop shop for all insurance needs, catering through a wide range of clients, including large and small businesses, business owners, and individuals seeking benefit administration, enrollment, COBRA, Medicare, and retirement solutions. Joshua, who is a partner and a broker for TY Insurance, to accept the award.
Thank you. I want to shout out my business partner, Talia Dico over here. We came a long ways from New Jersey. I want to shout out our carrier relationships that we have back in the U.S. to make it possible to serve all our clients nationwide and internationally.
Thank you so much, Joshua. Up next for the Health 2.0 Conference Visionaries Award, I would like to welcome back to the stage Dr. Maria Rodriguez. She is the CEO and president of Care Counseling Center, is an accomplished mental health professional dedicated to a compassion-first approach to helping immigrant individuals, children, and families adapt to thrive in the United States. Her innate sense of hope and her community led her to establish the Care Counseling Center, a safe place to providing support for emotional trauma, legal complexities, and practical issues that immigrants may face, in addition to helping families and individuals from various backgrounds.
Good evening, no, afternoon, good afternoon. I guess it's evening back in New Jersey, so I'm all confused still. So I want to give thank you to Health 2.0 for this prestigious award. For me, it's actually a big deal to be here, growing up in the Dominican Republic in a country that has limited resources, and now to make it here to Dubai today means a lot to me. So to all the little girls out there with big dreams, continue to have those big dreams and pursue them. And to the moms out there, do not give up on your dreams. Thank you.
Wise words. Thank you, Dr. Rodriguez. Our next award for the Health 2.0 Outstanding Leadership, I'd love to present this award to Kazuhisa Matsui. They are not here, but they have accepted the award on video.
Hello everyone, I am Kazuhisa Matsui from Nagoya Women's University. First of all, I thank to select me for this award. It is a great honor for me to have received this award, and at the same time, I have renewed my determination to work even more seriously on clinical practice and research. After obtaining my physiotherapist license, I have specialized in musculoskeletal disorders and sports injuries and work the field. Even now, with over 20 years of clinical experience, there are still many things I can learn from patients and athletes. I'd like to share the knowledge I have gained through my clinical experience and research with my students. Hopefully, it can be helpful for their clinical decision making to assess and treat patients. I'd like to express my sincere gratitude to my supervisors and mentors who have guided me in my professional growth, and to my colleagues who have supported me. Thank you. Have a wonderful conference.
Up next for the Health 2.0 Conference for Outstanding Leadership, I would like to present this to Saeed Alam. Once again, he could not make it, but he will be accepting the prize on video.
Hello everybody, good afternoon. My name is Saeed Junaid Alam. I'm very pleased, honored and humbled to accept and receive this award and join the list of those who have received in the past. I would like to thank the event organizers for selecting me for this award. I'm an occupational health consultant by profession, and I've been working in the field for the last 20 years or so. My aim has always been to improve the health and well-being of workers and manage their health issues holistically, especially in context of their work and in employment. And I have always believed and worked towards effective collaboration internally within my own team members and externally with our stakeholders. I also believe in empowering and fostering stewardship within my own team members, and most importantly, taking ownership of my own decision and actions. The future of occupational medicine, like any other health discipline, lies in adopting newer technological advancements and making our specialty relevant and efficient for all stakeholders, especially our clients and patients. I take my achievement and contribution within my field as just simple my effort to strive for the best in whatever I do, whether individually when I see my patients and clients, and collectively when I lead a team for a particular project. Alhamdulillah, these efforts have been recognized worldwide in various forums, including this one. At this moment, I must not forget those who helped me in achieving my targets and goals, especially my wife, my children, and other family members for their tireless support and encouragement. I would like to thank my co-workers and colleagues for their unwavering support. And last but not least, I would like to extend my gratitude to my patients and clients who have been source as well as the target of my efforts. I wish all the participants in this conference a very fruitful and informative discussion ahead of them. And I thank you again and have a nice day. Thank you.
Our very last recognition award is for Outstanding Leadership, and I would like to present this to Kentaro Makino. Once again, not here physically to accept the award, but through video.
Hi everyone, I'm Kentaro Makino from Japan. It's a shame I can't come to Dubai, but I appreciate and proud to get this amazing award, same as you. I quickly would like to share my aspiration using this portrait. I always try to create outstanding team by inclusive and diversity members. I believe this kind of VUCA era, no one knows the correct answer on business. It's important to work not individual, but team or organization. So to create that kind of team, I set two priorities. One is get out of comfort zone. As you know, that try and error agile is crucial for this era. So I use Scrum way, Agile way, and Lean Six Sigma way, etc. And also, mid-term perspective to create, co-create something new or something innovate is important. So for the basis, psychological safety and visual practice are useful to create that kind of atmosphere. If you are interested in my aspiration, please send a request via LinkedIn or Facebook, etc. Thank you.
And that concludes our recognition session. I'd like to ask one more round of applause for Mr. Ahmed Khan, as well as my colleague Swarnim. All right, so last request. I'm going to ask all the award winners to come back onto the stage so we can take a lovely group photograph all together. So as you make your way to the stage, you can just listen to me talk. I'm just going to be giving you some extra information. So make your way to the stage. Don't worry about me. I speak loud enough. I'm sure you can all hear me. So, as we know, the conferences are gearing up already for the next edition. So, if you are ready to make a contribution and maybe have a booth or maybe have a panel session, please do make your way to the booth that is in the lobby. You can have a chat to Jatin. And then, because we ran a little bit over time, I'm going to ask you to be back after lunch at 2 p.m. so we can start with our very first panel discussion. I want you to enjoy your lunch here at the InterContinental and the Health 2.0 conference. All right, can I ask everyone on stage to take a step forward? That's it. That's it. Lovely, lovely, lovely. And squish. Squish together. We're all friends here. What a beautiful bunch of people on the stage. And in this room, actually. I've met most of you. You are all so lovely, so beautiful. Look at everyone smiling from their heart. It's going to be a great picture. So, like I said, if everyone can be back here at 2 p.m. sharp, this would be very, very appreciated. Congratulations to all our award winners. Enjoy your lunch break, and I'll see you back here at 2 p.m. Hello, 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 and welcome back to the Health 2.0 conference. Yes, we have made it to our final afternoon session, and what a special 3-day event this is turning out to be. I have met so many lovely people here, and I'm very, very honored to have met most of you in this room. I hope we can continue our relationships on social media and get linked in and all that kind of good stuff. If you are posting on social media, please remember to use the hashtag health2conf, as in health, the number 2 and CONF, because at the end of it, we're going to be taking all of the photos, we're going to put them all together, and there's going to be a lovely video presentation from the Conference 2.0 homepage. So, I would love to start our afternoon session now that our bellies are full and we have refueled. I'd love to start. I'm very excited for this panel discussion. It is going to be the topic of AI, artificial intelligence, and how it is going to help you age smarter with biomarkers and mobility health. So, I would love to introduce our moderator for this session, Amar Patel, alongside with panelists Ash Roy, Dr. Anita Stalin, as well as Professor Roland France. A round of applause as they make their way up to the stage. Welcome, welcome. Hello. Very excited for this AI panel, so please, ladies and gentlemen, the stage is yours.
This is live. Good afternoon, everyone. My name is Amar Patel. I am a partner at PricewaterhouseCoopers. For folks who don't know, it's a professional services company. I've spent the entirety of my career in the healthcare sector. Started as a technologist, as an advisor, and an investor. It's an honor to be moderating this panel today. Before we get into the panel discussion, perhaps I'll invite the panel speakers to say a little bit about themselves, starting with Dr. Anita.
Hello, everyone. My name is Anita Stalin, and I'm a master black belt in Lean Six Sigma, and my expertise in process engineering and cost reduction and simplifying the processes for people, not only for the employees, but also for customers. And I'm the CEO of the LSS Certification Academy and one of the directors with the International Lean Six Sigma Institute in Cambridge, England. And I'm also a chief transformation officer with a healthcare industry in Washington, D.C. Thank you.
Roland?
I would like Ash to go ahead first.
Please go ahead.
Please, you're a senior.
You insist? Okay. I'm Ash Roy. Let's see. We have a booth here. It's seniorlife.ai. We'll talk about it a little bit more later. My personal background, I spent most of my adult life in New York and Tokyo. I live in Seattle. I built 3 companies in the process. First one was a NASDAQ-based company. We sold it, and then I was in private equity for a while. The second company we built, I'm still the founder and chairman. That is now the number 2 smart home company in Japan. And this is the third company we're building, seniorlife.ai, with my co-founder who's sitting in the audience, Kaz Ogawa. It's a US and Japan-based company. We'll talk about it later, but that's about it. Yep.
Hello, everyone. I'm Roland France. My introduction was very well given, and I'm sure you heard about me before. So basically, I have my own firm, thefitco.in, where our motto being is making the difference. We want to make a difference in people's lives. So through healthcare, fitness, wellness, we try to cover up every aspect, let it be physical or mental. I myself am a coach, counselor, manager. I like to think of myself as a fitness wellness concierge that way. And I'm also a part investor and a part of a company where we manufacture healthy desserts, like, people who have a sweet tooth like me. So we manufacture ice creams, chocolates, cookies, but all organic on the healthy side, so that people like me who are into fitness but also have their sweet cravings can, indulge a bit guilt-free. So that's just a bit of what I do. I have a master's in geoinformatics. I kind of did like my PhD halfway through. And yeah, I got into this field because this field actually changed my life. Once upon a time, I myself was going through a lot of physical and mental distress. So getting into health, fitness, wellness, using science and a holistic approach did help me control my problems, my issues, get over it, change my personality, and that is what I want to share with everyone. Hence, I do what I do. Thank you.
Thank you all. So it's an exciting topic. How can we age smarter? And how is AI, biomarkers, mobility health playing a crucial role? Let's start with maybe Ash. And Ash, can you tell us about what is smart aging and what is the role of mobility health and biomarkers?
Okay, I will attempt to. In our industry, everything is getting upended by AI. So first of all, let me tell you my perspective of what it is not, what smart aging is not. It is not staying young forever. It's definitely not that. It is also not living long. What it is, in our definition, is extending the quality of life. So for example, I was just talking to him, I row on the ocean. And if I want to keep rowing on the ocean when I'm 60, 20 years later, and if somebody had told me that there's some problem I'm developing on my left shoulder, there's no stiff shoulder or anything. It's just something I'm developing. Somehow AI could tell me that for the vision, and I could fix it. I can row probably better when I'm 60. I would be super happy about it. So extending quality of life is, I think, is a definition of smart aging. Second question is about a biomarker. So think about biomarker and mobility health is kind of like physics versus chemistry of your body, right? So mobility is physics and chemistry is biomarkers. FDA in the US kind of has this chart that defines like 7 different types of biomarkers, but essentially 3 things. One is about the drugs, right? So how will you respond to this drug? What can the side effect be, right, before you take it? So the drug makers pharmaceutical companies are very involved in that. The second type of biomarker is identifying disease, basically diagnosis, right? Cancer, pre-diabetes, and so on. The third one, which is most interesting, is where we where we focus on, not as a business, but I personally am very interested in, is can I identify early on through genetic testing or blood markers that I'm likely to develop something 20 years later. So that is a very interesting area in the biomarker space. And the last one is mobility health, which is the physics part of it. And that's where we focus our business on, but I'm not going to talk about the business part. Essentially, think about mobility as 3 parts. The first is obvious, which is your gait and balance, you're walking, right? Somebody's watching how you're moving and so on. There are 2 others. The second one is how your facial muscles moving, right? This is called valence and arousal. By looking at your facial movements, AI is able to detect many more things right now. The third one is your eye movement, which is basically, again, 3 parts. You're blinking, your gaze, what you're focused on, and how fast it is moving. So those are really early predictors of behavioral issues to dementia and many more things. So I can go on and on, but I should stop.
No, thank you. Thank you for that, Ash. And with, at least forming a foundational understanding of the definitions, I think that's important because these are new words. These are very dynamic concepts. They keep on evolving on a daily basis. But maybe I can go to Roland next and ask you a question on, with these biomarkers and mobility health and AI, how do you actually conduct assessments and how does it help you predict or diagnose some of these things?
Okay, firstly, let me just clarify. I am not what we call it, a degreed medical professional. But yes, I do use biomarkers and mobility assessment so as to program specific plans so as to improve the health and fitness of a person. So I think maybe 10 years down the line, coaches, trainers, and many other professionals in the field, wellness professionals in the field, didn't really care much about these things. But today I feel it is very important. Say, like, for example, we take a metabolic biomarker. Okay, let's say, for example, HbA1c, okay, diabetes. Today, diabetes, as you know, is, I think, at a rise. Like, yeah, everywhere in India, yes. US, I'm sure it is. And I'm sorry, I don't know much about the rest of the world. But let's take diabetes as an example. Now, once I have that, because I have an understanding of biomarkers, I did study it, I did a course on it. So knowing that, I know how or what to give a person. What kind of exercises, what kind of nutrition plan, because there are again do's and don'ts when it comes to eating, and also if someone is a diabetic, that way. So as it goes with exercises. Similarly, mobility assessment. I will assess that person's functionality physically. Okay, for that we have certain basic tests, because a diabetic may not be that functionally, may not be able to move or perform that functionally as compared to a healthy person. Got it. So over there also, yes, after we assess the mobility of that person who has this condition or a disease, whatever you may want to call it. So that's how then in our field, in our wellness and fitness industry, what happens is we use these biomarkers, the measurements measured through maybe a urine sample or a blood test, whatever it may be, for XYZ diseases. And also we do mobility assessments, facial and what was the next? Eyes being one of it. Yes, eyes, skin also do give out symptoms, and also like the person's way of walking. A disease does affect the core muscles in various ways. As you may be knowing, your muscles have their own way of working. They have their own memory. Okay, they are also connected to emotions and also to whatever is going on within. Like if there is an issue, if there is a disease, let it be a viral or a bacterial, yes, your muscles do tend to fight or flight. Give that fight or flight response. I'm sorry. Yes. So yes, even a disease does affect the musculoskeletal system in a certain way, and that does affect a person's functioning. Let it be from posture to walking, to sitting, to sleeping, etc. So we do use these tests to correct the person. I may not be able to just take away the disease from the person totally, like 100%. But yes, I can at least help that person live better or carry himself or herself better. That person can function better. Like that's my contribution. As I said, I'm no doctor. I can't prescribe medications and such. But yes, I can study these biomarkers, and today I do encourage upcoming coaches, fitness professionals, wellness professionals who are into the field. Let them be, what we call it, who purely use a scientific approach, or who use a holistic approach, or maybe both. They should have a basic, at least idea of what biomarkers are and what these mobility assessments are. They are very important. They are just not for athletes, they are for everyone. There was a time when these assessments were only conducted for maybe sports professionals, not that much to the layman. Times have changed, yes, and yes, as I said, these things are going to help us not only to identify, not only to diagnose or prognose, but also it will help us to create a plan, to create a program, okay, that will help, that will help us move forward. Okay, like age smarter, you can say, it may help in longevity. Today science has, like, I think, yeah, today science and technology are at that point and they're still going forward. Ash's company is doing the same research, and I need to integrate his, what do you say, AI software?
Yes.
Yes, I'm sorry, I'm not a techie, into my next venture. So yeah, so we are limited. Coaches like me, people who are in my industry, we play with a set of biomarkers, let it be metabolic or hormonal. As said, there are 7 types, 7 categories.
Correct.
Correct.
That's how the
yeah.
FDA describes it.
Correct, yes. So for us, only 3 or 4 do actually matter that way. So yeah, I can maybe just say that much about biomarkers and mobility. Mobility assessment, it is an integral part today. Let it, even if, let's take like a common disease like diabetes, or it can also be maybe an injury. Injuries can also lead to infections that we may not know about. And if you all, I don't know how many of you all have met people, like lately I've been meeting people where these diseases like cancer and all, they're hiding. People don't seem to get their symptoms or know about it till the last minute. At least a couple of years back, you could see, something is happening. Yes, this is there, that is there. You could see the symptoms. But today I see many diseases where they are just like, I don't know, maybe they have evolved, they are hidden. Like as we are evolving, I'm sure the viruses and bacteria and diseases are also evolving. Lately, as I said, many cases have come in. So yes, these biomarkers, these blood tests, these urine tests, these hormonal tests that we do, okay, they do help us identify these things. And yes, we can use AI to compile, compile the data, study the data, and then maybe come up with a appropriate plan of action. I'm sure that's in the works. Yeah. So
That's excellent, and with that background on biomarkers, mobility health, let's shift gears. Let's put in that layer of AI on top. If I go back a decade, everyone's talking about data. Then came analytics. Then came machine learning. Then came AI. And now it's Gen AI. And now I'm hearing things like large language models. And it's really complicated, all of these things. Maybe I'll invite Dr. Anita to speak about how is AI, from a simplistic standpoint, helping us with our health, with aging.
Yeah, thank you. And I totally agree with what Ash and Roland have spoken about. I'm not technologically, I don't have the expertise like them, but I can talk about, human beings go through these problems where artificial intelligence can make our quality of life better. Now, in this, of course, and the disclaimer is I'm not a medical expert. I don't have a medical degree, but I have a PhD in lean and making the processes leaner and penetrating to identify the problems in healthcare and in different industries. Okay, so building on to what Roland and Ash said, we are all, running in that rat race. Not all, but maybe almost everybody, and we want to improve the standard of life. But like Ash said, we also want to be responsible to see to it that we don't compromise on the quality of life. So artificial intelligence is here not to replace human beings like doctors and nurses and the assistants, but it will only enhance them to do their job better. So let me talk about what I went through. Everybody knows about the pandemic, and I was also a victim. For about 35 days, I was under ventilation, and that was really bad. I don't want to talk about that, but that really helped me from a Lean Six Sigma Master Black Belt perspective. So what happened is, obviously, the detection was later, and then they directly took me to ICU because I was not able to breathe. And I had laparoscopy done. I had a surgery just like 2 days ago. The nurses were looking at it. They didn't even ask me what, and I couldn't say. I wanted to tell them, hey, you know, the stitches are not even removed. Can you see the Band-Aid? That's my laparoscopy done. You know, just be careful about it. But they were more concerned about letting me breathe, making me breathe. So they were doing their job correctly. I wanted to tell them, but I couldn't because of the ventilation, and I knew that if I remove it, the oxygen supply is going to stop. So if I had any artificial intelligence that was connected to my brain, and if the nurses and the doctors were looking at it, then they would have identified, hey, I think the patient wants to say something. I think there is something, some concern. You know, so maybe something that's going on in my mind could have been read by the doctors and the surgeons and the nurses, but that didn't happen. So what they did is they asked me to sleep on my stomach. They were just like pressing and pressing so that I could breathe. So they were trying to help me. So artificial intelligence is only going to enhance, do their job better, right? So that's one thing. So we need your products a lot, isn't it? So like, yeah, of course, my husband and son were also about to accompany, but he was going through some, again, health issues. We tried to detect he's a diabetic. Again, if we had the wearables, we would have known whether his diabetes was too high or too low, but then we did not use it. But now I know it's so useful. So we took him to the diabetologist, and he said, okay, your diabetes is definitely like a 200 to 300, we have to kind of curb it, and we'll give you medicine. And then all of a sudden, his head started hurting and his eyes started hurting. He went to an eye specialist. The doctor said, go to an eye specialist. And we did all the tests and stuff. It took like 3 days for them to identify and tell us, hey, nothing is wrong with your eyes. We were happy about it, but not really happy, because we didn't know why was his eye hurting and his head. And then after a week, we identified he was getting some blisters on his head and forehead, and they then identified it was herpes zoster. Oh my God, we just spent like a week, and he was having medicines for his diabetes, for his ailments in eyes, for his headache, and he was also due for his CT scan because his head was hurting. So artificial intelligence would have supported the doctors to identify immediately and treat him, so he would have been one of you here, and I would have been so proud. So definitely we need.
For sure. I mean, if I have a chance, I'll explain how it works, but yeah, go ahead.
Fantastic. Right, so then what happened is, like I was talking about while I was, getting treated, we had like wires which was monitoring everything, my pulse and heartbeat and everything. And in the night, obviously the nurses had to go home. There was only one nurse who was looking after everything. And then I just happened to turn. What happened is the monitor which was placed, that fell on my face. And that happened at approximately 1 p.m. Until 8 a.m. when the other nurse came in, I was just sleeping, lying like that with that pain, thinking that at least I'm breathing. I want to be alive till the nurse arrives in the morning, right? But if there was some kind of connection like this, where with artificial intelligence or app, or even camera for that matter, if the doctors or the surgeons would have seen, I think I would have escaped from that pain, right? And then I was definitely thinking about surviving and living, but I was also concerned about my facial muscles. Like Ash said, we want to age smarter, right? If I'm alive, I don't want like a deformed face, isn't it? So I was concerned, what if, when I'm alive, will I be able to carry my face and stuff like that? So not only women, but also men are so concerned about the way you look because it gives you that confidence. So my therapist helped me with facial yoga therapy and all of that. Okay, so let's all of us do that. For example, if you have a double chin, you're supposed to just look up and kiss 10 times. Let's all do that, okay? Come on, let's do that. Everybody. Yes. And let's hear some kissing sound here. Come on. Awesome. Up.
Up.
All right, that's great. Now the other one is for our eyes. So what we'll do is, like, let's say that this is your face, and you are supposed to tense the muscles, wait for like 5 seconds, and then release, okay? And then release. Come on, let's do that. Everybody's looking funny, that's all right, okay? Let's have Roland, Ash, and Amar also do that. Come on, let's do that. Okay, and then let's say we want like full volume on our cheek. So what we would do is we will fill some air here and then pass it on to your left and right. All right, let's do that.
That was easy.
Okay, awesome. So I think this is something very common and everybody knows that. But why am I talking about this? Because there are so many exercises and I need to know what does my face need. So in case if I have their product, I would, just take a selfie and it would tell me, hey, Anita, I think that your cheeks are okay, but you're getting your dark circles. So just have facial yoga for just eyes and not for cheeks, because nobody has the time to do that, isn't it? And I want to age smarter. I'm a mother. Very soon I'll be a grandmom, isn't it? Yeah, so that is something we can use our product, not only healthcare, but also consumers can use it. Now, like I said, I'm a mother. We have so many of you must be parents, or you would have nibblings and siblings that you look after. And you know that you want to know what your kids are doing, not because you want to be too finicky, but you want them to be safe and you want them to only consume the data that's good for them, for their knowledge and growth, isn't it? But I'm just thinking, what will happen when I become a grandmom? In that case, I'm going to be older, physically, mentally, and technology is going to reach like, it's going to hit the roof and I'm not going to understand anything. But if we have products like which would tell me, okay, what is my grandchild thinking? What is he doing? Is he with friends who's having drugs, or has he tasted it? For example, I can just sit at home and I can see it and then I can tackle. So this is how it can help us age smarter. Also, one more thing is, one of my friends' mom is unwell, and it was the last stage of a blood cancer. And little did she know that if we had smart gadgets, now dermatologists say that you have a gadget with an app which can just kind of, you just have to show it to the surface of your skin and it will let you know that you have blood cancer, isn't it? But we want more of that so that we age smarter. We don't want the longevity. Yes, we do, but we do, but definitely the quality of life should be good.
We want that quality
right.
of life.
Awesome.
Thanks for sharing that example, Dr. Anita. In that example, there was science, wellness, wearables, tech, it had it all.
And process.
What I got out of that, what you spoke about is AI and tech is not here to replace, but it's here to complement traditional medicine, traditional science, and I think we can just get better by embedding technology into the process. Maybe we'll shift gears a little bit. Globally, if we look at, I live here in Dubai, and I know for sure when I look at the GCC countries, one statistic that stands out is the aging population, and the 65 years and above. That's sort of the fastest growing segment here in the region, and I'm pretty sure in many parts of the world. Maybe I'll bring Ash on this topic, because this is a product that matters for that segment of the population. How is AI and the other concepts that we've spoken about are playing a role in what I call geriatric care, or care for the elderly?
So let me take the first question, AI, which can be bad or good, depends on which movie you have watched, right? So I think a lot of people have seen generative AI, right? And starting with OpenAI, and it just introduced Sora, which means sky in Japanese, which basically you give it a prompt, in some sort of text, or it could be an image. And then there's a response. And the response is generated based on a lot of learning, right? As Amar was talking about, it could be large language model, it could be video models, and so on. We're not talking about that in healthcare, okay? Healthcare is not generating text images or generating images from text or videos and so on. But it has dramatically changed how healthcare is working. Not generative AI models, but the fundamental of how AI models work. So there is 5 years ago, almost every AI engineer, every AI company were using something called CNN, not your cable news network. It's convolutional neural network, okay? Which basically means you go to you build a model and you say, you introduce some biases, okay? You introduce some biases and the model kind of works through it and gives you the result, right? So you don't need that much data to train it. Everybody threw it out 2 years ago. They went into something called transformer model. And what does transformer model does? It doesn't want to learn anything. Don't tell me anything. Let me observe. That means I'm observing a lot of data. So first is a model, transformer. Second, I need to process. It's just process hungry. So that means you need to have graphics processing unit or GPUs available. And the company that makes GPU, NVIDIA, has a bigger market cap than Google now. It's just an unknown chip company that is $2 trillion market cap now. So two things happen, which is the new models that are not biased, transformer models, and also GPU. Because of these two, the AI models are working so fast and discovering things that is a pending clinical diagnosis. So what your doctor thought about, what the clinical community thought about, some of these things are coming out to be incorrect or partially incorrect. It's like Einstein theories is getting rewritten, right? The quantum mechanics, right? So that is the new AI, that's happening. And I think somebody was asking me about, I'm just digressing a little bit here. So there's a lot of people who are focused on something called edge computing, meaning you have a device, you have a little AI or dedicated thing in there. All those things are going to be old really fast because the upgrade is happening so fast, but it's very process hungry, GPU hungry. So first point is AI is creating so many things. Sometimes we don't know our assumptions are going to be correct or not. Now let's talk about GCC, right? I think if I'm correct, I mean, obviously you know this way better than I do. I think about 5% of the people here are in around the 65 category, some number like that. It's probably going to triple in 2-3 years because the birth rate is declining really fast. If it triples, the healthcare cost is probably going to quintuple, right? Because that's where most of the cost is. Three big areas where the cost of healthcare can be avoided and quality of life could be extended. 3 big areas. One is when you get older, your mobility changes, so you're likely to fall, okay? Especially if you're old. Second is a lot of people have onset of dementia. There's something called MCI, which is mild cognitive impairment. So if you can delay the dementia, any Parkinson's, Alzheimer's, take your pick, Louis, whatever. So first, I'm going to keep you safe so that you're not falling down if you're getting really old. Second, extend your onset if you're at risk of dementia, because if you have a risk, it's probably going to have it at some point. The third one is I want to make sure you, if you have a surgery, right, or you do some sort of event that happened, right, and you came back from the hospital, if you're recovering, that is one of the biggest costs in the US called hospital readmission. Because you don't take care of it, you had a knee surgery, you're not measuring how your knee is recovering or not, the doctor is not measuring, and you eventually go back. That's a massive cost, okay? So those 3 are the big ones that AI, especially what we do, mobility health, can observe, can measure the risks before it happens, or after an event happens, it can actually provide evidence-based outcome to prevent it, right? And I think you will see the adoption very, very fast in the GCC market, especially in some of the more advanced economies, right? In Abu Dhabi and other places, in Dubai, who knows, right?
Yeah. No, that's really helpful. I'm actually going to have a follow-on question on that one because it's related. We keep on hearing these terms, chronological age, biological age, especially when I go for my annual health checkups. The doctor would tell me your heart is at a certain biological age, but your lungs are at another biological age. Can you tell us a little bit about what this means, Ash? Because as you grow older, this becomes even more important.
Yeah, this is a hotly debated topic. I'll tell you what my opinion is. Okay. So chronological age is basically you start at 0 and you grow, right? It's time. As you get older, if you're born 45 years ago, you're 45-year-old chronological age. Your biological age can be 35 or it could be 55, right? And it depends on many factors. Of course, what you put in your body, do you exercise, what kind of environment do you live in, right? Not just the physical environment, stress, everything else, right? Many, many things, right? And but of all of, if you, and sometimes you are prone to certain things. If you had known about it earlier, you could have taken care of it. That's where we focus on, because you can't focus on stress and all that stuff, right? It's hard to pinpoint it, right? So if your chronological age, your goal is this: you want to start out. Your neurons max out at about mid-30s, some late 20s, mid-30s. After that, trust me, you're going down, right? Brain-wise, brain neurons-wise. But hopefully, you're able to. So you're starting out chronological, biological age probably at 0, let's say in mid-30s. But hopefully, by the time you go to mid-60s, so chronologically you have advanced 30 years, hopefully you've advanced only 15 years. That's kind of the goal. Your heart, your lungs, and everything else, it all depends on many, many things. Many things. Why it can be biological age could be lower or higher. It depends on many things. But the ideal goal is, we think, about 15 years.
And I'm assuming some of the technologies that we are talking about, AI, biomarkers, mobility health, they all play a role
hugely
in kind of giving you that accurate picture of your biological age.
Yes. So in fact, in Japan, and thanks to my partner, so some of our mobility tests, right, mobility health check, they call it, are being part of the annual checkup. So it's a regular checkup process. If you identify you're in the yellow zone, right, take care of it now, so that if you're in the red zone, it's too late. So if you're in the yellow zone, take care of it so that you can stay healthier longer. Yeah, they are. And what has AI brought today is the vision-based AI. Vision-based AI is amazing now, especially after these transformer models and the GPUs. Many of you may or may not know the cars that you drive today have LiDARs, right? Tesla threw away all the LiDARs. There's no LiDAR in Tesla. It's only vision. It's only a camera. It's only the front camera and the back camera, because the amount of quality of information that comes in through a camera is 100x or 1000x better than what comes through LiDAR. And it's really fast now.
Which is laser. LiDAR is laser.
Yeah, correct. Which is, and it's substantially faster, right? Faster and better. So vision-based AI, the way it is progressing, can provide information in a really short time frame. I'm talking about seconds. So we developed a product that I can't talk about the name yet. So this is the second largest airbag maker in the world. Okay. So they came to us to build a product, which is going to be rolled out next year. If you fall down, just like a car accident, once you have an accident, it's too late, right? So that's why they have the airbags, because you have an accident, it protects you. But we can now detect pre-fall indicator within 100 milliseconds. And another 100 milliseconds, something goes to somewhere and something inflates. So within 300 milliseconds, something inflates. So before you fall down, the airbag is actually inflated, or some wearable thing is inflated. I can't go into detail. But that's how technology is improving, and it's going to make a huge impact, we hope.
Awesome, thank you. Well, this topic is pretty exciting. I mean, we can go on and on and on. That timer is blinking red in front of us, but I want to leave some time for the audience to ask questions. I mean, we have 3 individuals who are highly knowledgeable about this topic, so anyone in the audience has any questions, please feel free to ask right now.
Dr. Jemima here. So can you please explain this to Ayush? So how AI could impact on this telemedicine or teleconsultation, and what will be your sponsor, or what will be your support towards medicine? Can you please explain in detail for us how the images could be viewed through AI? It can predict the impressions.
Yeah, you're talking about telehealth, right?
Yes, absolutely.
It's already impacting big ways. I'll give you 2 examples, right? And I'm not even talking about a doctor able to remotely see the scans, right, and the results, right? Let's say you had a knee injury, right? Today, what's happening in the US is, so you come to my clinic, I look at you, and I say, you can go home, but can you do this test on your own? Like, check your knee, reflection. And it's not just the angle, it's how, if it's shaking or not. You can do it at your home, and that means it's cheaper, your out-of-pocket cost is less, and I can get the result, evidence-based results. The AI just picks it up, and it says, yeah, it's improving or it's getting worse. And then I'm not even doing anything, I'm getting the results, and I'm like, if it's getting better, great, but if it's getting worse, I take immediate intervention, right? So that's one area that's where AI is doing a lot of different things, not helping a lot. The other one is vision-based. This is a little controversial. I'm having a conversation with you, and let's assume you have a behavioral issue, right? Mental health is called behavioral issues in the US, right? So for whatever reason, trauma, stress, this, that. So when I'm watching you, I'm an expert, but the AI, it's basically, imagine like a Zoom almost, right? AI is picking up many things about your facial contour movements, eye movements, and so on. And it's telling me she has improved or not improving, or she's stable, or I get a lot of results, not just relying on my own expertise, because I may not be that expert, right? He may be the expert, but the machine is telling me, machine meaning the AI is going to tell us it is improving with evidence, because it's been trained to watch you. So those vision-based AI is like making a huge impact there. I don't know if that helps.
Thank you. Any other questions?
There's a height problem.
I'm struggling here, so I think I'm just going to...
Take somebody's mic, maybe. That's easier.
Yeah.
Tall people problems.
Yeah, it was getting embarrassing here. So I just have 2 questions to your account, basically. Firstly, you're talking about recognizing for health issues from a facial recognition. And what we call AI today is pretty much a regression model, right? And regression models are as good as the data. I wonder how good is the data today, because we keep on evolving. There are challenges at the DNA level where we don't know diseases. We have hunches, because that's again based on data, and there are many patients who don't respond to typical medication. Will it be useful in that respect? And secondly, what is your view on nootropics to actually...
Can you get the mic a little
Yeah,
closer?
can you hear? Okay, I
that's
was
better.
able to hear myself. So what's your view on nootropics? Because nootropics is another trend which is up and coming for reverse aging or age better. So these are the two questions. Is it clear, or were you able to hear it?
What was the first topic? What was the first question?
Because when you talk about diseases recognition or predicting disease from a facial muscle or facial looks, there are so many other parts in that, because all the AI models are based on regression. It's basically a regression model, right? AI is nothing new. It's from the 70s and 80s regression model, which just got much better computational power today. Given the historical data, we still don't account for such challenges where patients are changing on a DNA level and the mitochondria is changing. Mitochondria impact on the muscle changes your facial looks as well, which is not a prediction of a disease, but rather a pure muscular issue. How do you account for that in your regression models, or AI, as you want to call it?
Should I answer that?
Yes, please.
First of all, so thank you for pointing it out that it is essentially regression. That was the old models. So what it is for people who are not that familiar with how AI works, it's essentially statistics, right? It was. So I told you, I gave you so many statistics about so many people. So when I show you a blind sample, because you have learned so much, you're able to tell me, yeah, this is the way it's going to work. That was the previous way AI worked. Now what it's doing, it is figuring out new relationships that the previous models couldn't do. So that has changed the game quite a bit, right? So that's one. Second, the thing that we don't have, that we have one of the largest video data, and that's only 20,000 of older people. The data that you're talking about has mostly been point data. The blood pressure of Amar Patel 2 years ago, 2 months ago, 1 month ago, 10 days ago. That's not as helpful as Amar's 20-second video of Amar's face, or even 20-second video of Amar's walking 2 years ago, 2 months ago, 10 days ago. That information is just rich if I had that information. So we're collecting a lot of data. A lot of things are not done yet. It's going to progress and we'll find out. We will definitely make mistakes for sure. I don't know if I answered your question or not. We're not done yet. Probably never be done.
That's probably her indicating you guys are done, but yes, one more question.
I think give her the mic.
Tech.
So, interesting topic. Obviously, what's happening is on one side, we know, so I'm coming first of all from a pharma organization standpoint. From a pharma organization standpoint.
Sir, can you hold the mic a little closer? Thank you.
Can you hear me now?
Yeah.
So from a pharma organization standpoint, one of the things we are trying to do is to reduce the overall cycle for introduction of a new molecular entity. And there we are using vision technology, obviously overlaid with AI and closed generative models, to see the pattern change at the cellular level for impact of a molecule that gets tested. That's what we are trying to do. There was an interesting conversation this morning which spoke about telehealth, and it spoke about maybe the, I would say, more compliance, non-compliance with respect to monitoring a patient remotely or understanding a patient's real health remotely. Somewhere it's a question of how we need to adopt this technology, and how do we need to therefore maybe what you call institutionalize and make it stable. Now, the reason I'm kind of bringing it is because on one side you can trust introduction of a new molecular entity by vision imaging at a cellular level and its impact. On the other side, you have clinically graded devices like, for example, a blood pressure monitor, an iStats from Abbott, and a few other things that are there that can do tracking, like maybe, for example, your pulse, Because I think a pulse states a lot about your actual health, which a doctor has to feel now, but can also be done remotely. So is there no way that we can bridge this gap of trying to use existing technologies in conjunction with video analysis to make the telehealth more pervasive? Because I think if that happens, to a large extent, a lot of issues that we're facing in terms of doctor burnout or physician burnout, 70 cases a day to be seen, cognitive errors being introduced because of that, because you kind of seeing the same type of patient, you'll say this person is also diabetic. Let him come and go. And it will do wrong errors. So somewhere what I heard in the morning was saying that follow-up consultation should be done. But since we have such a good technology with, say, for example, wearables, tactile sense, and so on and so forth, why can't we do a combination of that and vision and see if we can make telehealth more effective, therefore reducing the last mile gap and make it more affordable? So that was a point of view, and you have any thoughts on that?
I can answer that from a US perspective. Yeah. So I can only talk about the US. So before COVID, so there are two things that are very big in the US now. One is called RPM, remote patient monitoring. The second one is called RTM, remote therapeutic monitoring. RPM was introduced, in the US it's all cost driven. It's one of the most expensive healthcare system. The healthcare system is completely, I don't want to go in there, but technology-wise, sometimes it's auto-analysis and so on. Automatically, the program is telling you if it's good or bad. During COVID, because you couldn't actually go to the clinic, it went from 800,000 to 59 million people on RPM now. Massive success, right? So it is happening in the US. It's completely, in the US, every single primary care is telehealth. There is you don't go and see a primary care anymore. We just telehealth. Sometimes it's video, or sometimes it's you just pass in the information and you get prescription and so on. RTM, which was introduced, or remote therapeutic monitoring, which was introduced last year, that focuses in 3 areas. It focuses on physiotherapy, right? Which is where we're very big. It also focuses on COPD, like your pulmonary diseases, like respiratory diseases, right? And the third one, it focuses on cognitive behavioral therapy, CBT, meaning you can actually provide the service without without meeting the person. So yes, it is expanding rapidly. There are two challenges I see. One is an institutional challenge, which is from the doctor's perspective, because the doctors make more money if you come to the clinic. So there's an adoption issue. The second issue is if you're dealing with, it's called patient adherence. Once they go home, they just don't do it, right? They forgot about it, right? So how do you make sure, how do you enforce that? But it's happening because there's no choice. At least in the US, it's very, very expensive. The healthcare costs are expensive, and I think it's going to start happening in Japan too. So I don't know if I answered your question.
You answered it from a perspective that yes, it is happening, but the institutionalization or scalability of something of that nature. Because what we are talking about is, so when you talk about US, you're talking about say 400 million people. But when you talk about the world, it is 8.2 billion people, right? And what we have to kind of look at is technologies have become now so affordable, and maybe with some kind of a definitive flip from a combination of maybe the 5 ecosystem pillars of healthcare. Don't you think there is a potential for us to maybe push it to a larger adoption?
It may be ideal. What you're looking for is ideal, but as you know, my friend, everything is driven by money.
Yeah.
So somebody who's paying for the healthcare cost need to mandate it. Yeah. Once they mandate it, the population would adopt.
So are we therefore saying that we are subservient to the people, to the capitalists who want to make more money, rather than maybe looking at holistic well-being that we've been talking about since
No, it's the other way around, in the sense the payers actually would save money from this. So they're doing that, they're pushing it out in the US. But how do you push it out globally? It's a very complex question, I think.
We still need to figure that out.
Thank you.
Well, first I want to thank you, big thank you to the three of you for those insights. I hope that was helpful for the audience. And thank you for your time and thank you for this opportunity.
Thank you.
A round of applause for our panelists, ladies and gentlemen. There's enough doctors in the room. Thank you once again, panelists. All right, so we will be jumping straight into our next panel. This topic is quite important, I believe. It's quite important, as all the panel discussions are. But this one is going to be focusing on the pharmaceutical serialization of ensuring drug traceability and safety. I'd like to invite to the stage Brian Manyahu, Tony Sorensen, and Ahmed Ez. Yes, a round of applause for our panel. And Tony, where did Tony go? Oh, all right, no problem, no problem. All right, how's everyone in the room doing? Everyone okay? Yes or yes? Did you notice how no wasn't an option? You didn't notice? All right, let's get some fresh air into those lungs. Raise one hand up. Take a nice deep breath. And out. Change hands. Breathe in. And out. 2 hands up. Shaking. And now we all feeling a lot better. I must say, I did enjoy the doctor's face exercises. Yes, I found myself doing them there. I know I looked funny, but I was, you know, you got to do those things. You got to keep the face nice and supple. We're still looking for Tony. Tony. There's a silly joke about the name Tony. What do you call a guy without shins? Tony? No? I'm kidding. I'm so sorry. It's one of those jokes that you learn as a child that just never leave you. You know, like what do you call a guy with a shovel in his head? Doug. All right, gentlemen, the stage is yours.
Sorry about that. I was in the toilet. I apologize. Yeah, we don't actually have a moderator, do we?
No.
So this is sort of a... We try to keep an open and free discussion about
100%.
drug safety overall, since that is one of the main issues of the pharmaceutical industry. We haven't met before.
Unfortunately, no. It's my bad. So let's first introduce ourselves to the audience and to ourselves as well. So I'll start with myself, if you don't mind.
Of course.
Okay, my name is Ahmed Az. I'm a regional franchise director, responsible for a therapy area, sales and marketing. The therapy area is gastroenterology and metabolic diseases in a company called Newbridge. And from its name, it's a bridging company. We are bridging innovative molecules and treatments from companies who are not based here in the Middle East and North Africa, from Europe, Japan, States, to the Middle East and North Africa. We are bringing their innovative treatments, registering them in the region, and accessing their innovations to the patients here who are in need. I'm responsible for the sales and marketing. I have 17 years of experience in the industry. I'm a pharmacist by education. I'm Egyptian national, living here and based in UAE. And pleasure meeting you all.
It's great meeting you. I know I met Brian before. Brian, you want to introduce yourself?
Thank you, Tony. So my name is Brian. As indicated earlier, I'm a chartered certified accountant, and I was a banker for 17 years. Transitioned to the pharmaceutical industry, post-COVID, just to try and make some positive impact in that area. Co-founded MediConnect Pharmaceuticals in Zimbabwe with my partner Dexter Blackstock. He's a British former footballer. So we are working to try and bring cost-effective methods of delivering drugs to the general population in Zimbabwe. We are also trying to grow into the Southern African region to bring that access to healthcare to the underprivileged minorities in those countries. So we are here to talk about traceability.
Yeah, absolutely. And if anybody missed that I was here before, my name is Tony. I went from medicine to life science, worked for Big Pharma for a few years, absolutely hated it. So I started my own company based on different principles, different value propositions, and different values. Yeah, I think the main topic here is, of course, to identify the problem with falsified medication and try to identify maybe also from a geographic scale where we're talking about overall without pointing any fingers, and also sort of a little bit of the reference interval. So just to get some statistics on this, which is very, very wide, like instead of pointing fingers. So there's the stats that I've seen, it was about a year ago, I believe that it was between 9-10% up to about 40%, depending on where we are in the world, where we see falsified medication and falsified APIs, which is like, it's unacceptable and it's very dangerous. And of course, that is all driven by greed and not patient safety. What do you guys think?
I agree totally. If you look at the numbers, the false medicines industry is accounting for close to $10 billion. Counterfeit medicines that are being peddled across the countries. It's a dangerous statistic. Why? Because you must understand that if you are taking medication and it's not the right medication, it's counterfeit medication, you are going to have complications later on down the line. Where I come from, this is a big problem. Why? Because you end up with abuse. People, you can't trace where the drug has come from. There is no accountability. No one is held responsible for this problem. And this leads to so many deaths, dysfunctional communities, children that won't be able to go to school because they are high on some of these drugs, and they are mixing up and making concoctions of these drugs just to get high. So if we do not solve that problem and are able to trace where drugs are coming from the manufacturer to the time they get to the consumer, we are going to have a serious problem on our hands in the future.
Absolutely. I'm going to pass it on. I was just thinking that there's also a huge political aspect of this, right? Where there is corruption, and that's one of the main issues that we're also dealing with in certain parts. What's your point on it?
Sure. Can I just step back a little bit, because I'm not sure that everyone here in the ballroom is aware of the serialization as much as we are aware.
True.
So just to shed more light for the audience on what serialization really is. So if we just held a bottle of water, you'll find the serial number here. And this serial number is like to be scanned. This shows the identity. In the pharma industry, it's more strict. It's more of a serial number with a batch number. So serialization is adding a serial number reflecting the object to a digital code with the manufacturing details and the batch details, manufacturing date and expiry date. The thing is that now being more regulated through the authorities by the US FDA and the European medicinal agencies, and more regulatory authorities now being implemented and enforced by local regulatory authorities country by country, is that medicine that should enter the country should be serialized, pack by pack. And this should be registered by the local authorities through the manufacturers, even if it's manufactured locally, before it enters the market, and countries here varies on the levels of serialization, but until it's dispensed, and this is the best level of serialization. So this tracing of the data of the product since its entry until the dispensing allows here the authority to track and trace the product flow from the manufacturing and prevents the counterfeit, as Brian said. So, and this
Thank you for saying that, by the way. Really important. Thank you.
Yeah, it's my pleasure. Thank you so much. So, and this blocked the counterfeit here because pharma industry is quite an easy industry to copy. Most of the tablets are starch. And it's a very profitable one if you couple the tablets with a starch and compressing machine and then blistering and packing and then ship, or even not ship, copy the artwork and then pack, and unfortunately many people are making a fortune out of these counterfeit products. That's why the authorities, and which is totally unsafe and may lead to side effects or lack of efficacy, which is the placebo that's being used for the clinical trials. But at the end of the day, it's cheating of the people who are in need. At the end of the day, these are patients who might be us. There are consequences, yes, but there are some other consequences that are related more into the quality. That what if the product itself, the original product itself, needs an immediate recall? So these systems of the track and trace might be very helpful to just recall the product as easy as it's seen the flow. That it could be recalled, yes, this product has flew through this process to these channels, so it could be recalled easily, which is also helpful for the safety at the end of the day for those patients who have been exposed to it or not exposed. So this is another dimension related to safety. It's not just the positive side, maybe other the negative sides.
Yes, definitely. Imagine your car that you have right now doesn't have an identity. If you park it there, I can come and take it. You have no way of following up on it to say, oh, that's my car. So it's the same thing with the drugs. We need to be able to say, this drug was manufactured by that factory, and it was distributed through that channel. How then do we, if there is a problem down the line, how then do we follow that channel to say, we need to recall this product, it's unsafe for consumption? I think in the past we've seen this happen in production of even foodstuffs. We had the baby formula scandal at some point. Those are the processes that we are saying we need to continuously enhance and continuously look at and refine and make sure that we are adhering to the proper channels and processes.
Absolutely. This is a great discussion, by the way. It's a really important discussion. Since we work in pharma, but of course this is of major concerns for patient health and patient safety. I was thinking there is also one element to. Now you were kind enough to share an example, and those are quite straightforward, and basically it could mean just hijacking of a shipment or replacing a shipment or whatever to, destroy a lot of value and prohibit health for people who are in need of the medicine for financial gain, obviously. But there's also a more sensitive topic regarding this, which is more of the systematic falsification. So there's an element of certain companies that has been, I wouldn't say flagged, but recognized, especially from the Food and Drug Administration in the States, which has shared concerns about systematic inputs of API in certain medication where they know that the actual amount of API that creates, let's call it milligrams, the milligrams of an API inside a specific tablet has the same bioavailability. For example, I'll run an easy to understand example. So for normal paracetamol medication that you take for headache or whatever it is, if you have a systematic implementation on one out of many batches, and inside that batch, you put only 325 milligram instead of 500 milligram, then the actual, in pharmaceutical terminology, the dose response curve is actually pretty much the same. So you get the same effect, but you get less API. And when you're talking about contracts with billions of euros, that is a lot of money. So this is also a problem. Do you have any experience on this?
Not exactly, but such kind of feedback, and especially the analytics behind the track and trace. I previously witnessed the launch of the track and trace system in Saudi Arabia. And this was copying the model that, and I think the same company that implemented the track and trace system in Turkey. And the company, in order to sell this to the authorities in Saudi Arabia, they reflected what's behind the track and trace that could help the authorities to invest, because it's a big investment. There is an infrastructure that is implemented not at the level of the entry, but at the level of every level of dispensing, from the entry level to the wholesale distribution to all the levels of distribution until the dispensing. The most attractive and the most appealing thing that is also helpful in pharmacoeconomics is that this could also help in developing a heat map of distribution of diseases across a wide geography like Saudi Arabia, or like any other country, of course. So you can monitor the dispensing behavior of any product across a country. So this area, you can find the more activity of a certain disease. So you can direct your resources of HCPs, nursing, machines to serve this disease and allocate more hospitals and centers to this area.
That's a very good point.
Yeah, and maybe certain infection. So you are aware that there might be a pandemic coming here for this infection. So you get aware of the disease before it happens. So this mapping and these analytics that are coming from the track and trace is the bright picture of the track and trace rather than just the negative ones.
True. And I think what you just said, sorry, I'll give you the word, Brian, but what we just said is absolutely super important. And that's one of the things, if you think about how you're going to predict these things, even if you use AI, I mean, it's about data. So if you put in the incorrect data, which is why it's so important, but if you don't have the accurate data, if you have falsified medication, you get a different outcome of that data. Go ahead, Brian.
Yes, totally agreed. This channel of track and tracing allows us to then be able to predict, like what you just said, pandemics or even abuse. You can be able to say, no, this medicine is being acquired only by a certain age group. You can be able to say, why is that happening? And you can then go dig deeper and look into those statistics. I think our efforts at MediConnect, we are in the process of creating like a blockchain track and trace platform to actually counter all these issues so that we can be able to trace the drug right from the manufacturer up to the end user. The moment you scan the barcode, you should be able to know that, okay, this came from there, the expiry date, and so on. All the details are there on the barcode. So it's efforts like that that will counter all this challenge that we are having in the drug industry.
I'm really glad that you actually jumped in on that, because we have been discussing, of course, within our fields that blockchain technology is a major step forward. Because, of course, we're not only talking about if somebody comes and hijacks a truck with medication. We're not talking about the most simple form of falsification. We're also talking about being able to track from the actual supplier of the API, which is the active ingredient in the pharmaceuticals, as well as that there may be a situation where in the logistical supply chain where to make just a a straightforward scenario, for example, a truck can be hijacked, or the actual person who drives the truck can be hijacked in between the GMP, the manufacturing site, and the central warehouse stock. And medicine can be stolen and replaced with falsified using, I mean, there's all kinds of ways of be deceiving. That's why blockchain technology is extremely important. I think one thing that we see all along in the world overall with all of the digitalization, of course, is, for example, we have Apple AirTags. We can put them pretty much anywhere to track anything, which is a very simple way of actually tracking different shipments. And based on that, I'm going to leave the word, but I just want to mention one thing, that traceability and drug safety is only as good as the quality technical agreements. So if you have a supplier of API, then you have very normal, you have a license and supply agreement. That means that one party who is responsible for the marketing authorization is in need of distribution channels. At the same time, they have outsourced production to a production site. They may even have outsourced secondary packaging to another site. So there are so many elements in this. So the quality technical agreement that you make, tracking included, so to speak, in the traceability, is to track the entire chain. And you have to be, the technical agreement has to be very specific on, where does your liability or your accountability stop and where does ours start? That is really important.
Correct. There is another element that might be overseen here, which is also adding a burden and a cost on the healthcare systems. Despite all bright sides that we are talking about, this is not cheap. And it's costing a lot that is being passed at the end of the day to the healthcare system. And the healthcare systems are requesting this to be added on the pharmaceutical companies at the end of the day, because pricing is fixed. You cannot add this to the price. So, and healthcare systems cannot afford this. So companies should build the infrastructures and should pay for the track and trace and should have the aggregation files and the aggregation systems and the EI systems that, healthcare systems can build also the track and trace for the sake of their patients. But sometimes in some countries, they are requested to contribute to this and pay for this. At the end of the day, as you mentioned, that's for the quality of their product. That's maybe an entry ticket for a healthcare system that is really big. So we should all collaborate to what's, at the end of the day, best for the patient. And it's yes for the quality. Like when we look at it from a different angle, like for the car industry, and when a certain brand of cars recall certain model of, let's say, 2018 model of certain car, that the braking system is not functioning, let's call all the owners to fix this. You get trust in this brand. So the same applies for the medicine. Let's recall this product because there was a gap in the track and trace system, that this product was not properly stored in the right storage condition. So this develops also trust with the healthcare system. So it's
Agreed. Brian.
And there are issues of liability as well, because maybe somebody fell sick because of the defect in the medicine. So it's a cocktail of things that we'll really need to be looking at and considering in as far as the track and tracing process is concerned.
That is so important that you mentioned that, and I'm then referring to the ADRs, the actual drug reaction reporting. And there's no global, we have FDA, the EMA, the MHRA all working together, but there's no global set fixed formula for the way adverse drug reactions should be reported, which is really, really stupid. Apologize for the language. It should be one specific model that everybody can implement, specifically then into AI, to actually extract the data, so we know everything about what you just mentioned, Brian. And one thing I wanted to mention also, I have no idea about the time. Oh, well, 5 minutes. This is really interesting. So one thing I'm thinking about also is that there's always the element of financials, obviously. hate having this discussion, but there's always the financial aspect of it. And this is also the reason why today serialization is only basically relevant. No, not relevant. That's the wrong word. It's only required for prescription drugs. So there's no global requirement for over-the-counter products, which accounts for a very big piece of the pharmaceuticals of the total market value. So I'm referring to the European Medicines Agency and the MHRA. So you don't have to serialize any OTCs. You can if you want, but you don't have to.
My experience here in the region, some countries are requesting serialization for all whatever called pharma products, even of OTC. So that's why it's becoming costly, because it's OTC at the end of the day. It's being sold at nothing, and the API is nothing, and the margins are nothing, and the price is being kept at the lowest reference country across the world. So why? But the good thing here is that the governments or the pricing authorities are quite flexible. That said, the serialization cost is 1% of the CIF price, so it's still
yeah. And that's actually, the region is very far ahead, because this does not account for the FDA. In the States, you don't have to serialize OTC. And in the UK, you don't have to do it. And the EU, you don't have to do it.
Enjoy
so
it.
That's really good for this region.
So there's need for some level of standardization, at least, so that all these sectors are covered, all these jurisdictions are covered, and we follow a certain pattern. I agree.
I think that was great. Should we jump into any questions? I know this topic is super boring when you're not in life science, so we enjoyed it. But if anybody has any questions, please. Can somebody give her a mic?
Tech team, mic, please.
So this one definitely works. So thanks a lot for bringing this topic. I lived this topic heart and soul when it was deployed in the Gulf, when it was a mandate to have all the pharmaceutical product serialized and now aggregated in some of the Gulf markets. And I'm telling you, it's a very important part of the compliance that we are living here. It's a strong regulation, and whatever even in UAE is having now is more advanced. It is reaching the level of a patient pack that has been released for a patient. If you have any pharmacovigilance issue and you register it, it's very traceable and aggregated. I also recall in Turkey when it was deployed, which is like the #1 market in the Middle East region that deployed the track and trace. We all learned from Turkey. And now with e-commerce coming hugely in Turkey, and the majority of the pharmacies there are not like here, like not a chain, but individually owned. There is a very big struggle in activating e-commerce and building the trust in the QR code. So we have to watch out with this compliance aspect. We do deploy it very well in the Middle East. E-commerce is coming at a very high pace, and we don't want to lose this trust in the QR code. What I really like now that it has extended into replacing the leaflet even. So what we are missing in Big Pharma is educating the user. So the user doesn't know his right 100%. If I think about my father and my mother, they don't know that they have this right of having this medicine traced. So yes, it is going in a very good pace in the Gulf area, let me call it well, in Turkey. In Pakistan, I know it's going into a very big progress, but still in Africa, it is not there. So it's our responsibility to spread this, because it will come back to what Tony was talking about, which is the adverse reaction, if this is efficient medicine or not, the feedback that has to come to the company, the compliance control that has to be put on pharmaceutical companies to make sure that they are providing very efficient medicine to the patients. Thank you for this.
Very good point.
Thank you. Thank you.
Yeah, I think it was more not so many questions in there, but I think it didn't need to be, because we completely agree with you. Anybody else have a question, or anybody wants to reply to that?
was a perfect closing for the nice discussion.
I agree.
Thank you.
I agree.
You did the work for us. Thank you for closing.
Okay.
All right, a round of applause for our panel. And if you gentlemen can take a step to the front of the stage so we can take a group photograph. I'm in a very love-hate relationship with AI. Just because I love the capabilities of it, but then there's also such big risks that people will not use that technology for good. Thank you so much, gentlemen. Thank you, thank you, thank you. All right, now our next panel. There's going to be a lot of people on the stage because we are tackling the discussion of trauma and mental health and how we are going to be breaking that cycle. So, if you've ever wondered why traumatic experiences seem to echo across generations, leaving an inedible mark, it's how do we break the cycle? How do we get through it? How do we get out of that complex relationship between trauma and mental health? So these are the questions that this incredible panel is going to be discussing. I'd like to invite to the stage Michael Angelo Giannato. I'd like to invite George Lee, Jason Corning alongside with his interpreters, Heather Stokes, and moderating the session would be Rachna Mimani. If I can have all those panelists come up to the stage, please. All right, we've got Jason on stage, George Lee, Michael Angelo, Heather, and Rachna? Rachna Mimami? Here, there she is. Look at her. All right. Thank you very much, panel. The stage is yours.
Good evening, everyone. So, few of us here, but we are talking something important, and that is mental health and trauma. So I would love the panel to introduce themselves first.
Hi, my name is Heather Ogburn-Stokes. I'm the founder and CEO of Serenity Light Recovery. We are an addiction treatment center in Texas, and it's a constant battle that we face to combat mental health, trauma, and even the effects that it has on the families and the communities at whole.
Hi everyone, my name is Mitch Hanato. I'm the Group CEO of the Romulus Health Group in the Philippines. We have the Life Science Center for Health and Wellness, which is a functional medicine clinic. It's a multi-specialty clinic. Within it is a facility called Mind Plus, which incorporates epigenetic approaches to improving mental health. Thank you.
Good afternoon. My name is George. I'm from Singapore. I am the CEO and founder of the My Synergy, a school that trains coaches, trainers, therapists, and we deal directly with ground issues, ranging from kids as young as like 15 years old to very experienced traumatic performer as old as 70 to 80 years old. So yeah, I hope to share my experience and my observation as a practitioner on the ground, how we deal with, well, sadly to say, some of them are like bringing on the traumatic experience on a daily basis. So thank you.
Hi everyone, my name is Jason. I'm with the company Mizaru. We focus on awareness and education and spreading the word is for community support with individuals with disabilities. A lot of people with disabilities have traumatic experiences because the companies and places where they're trying to get services don't understand those communities. And so we're raising awareness and understanding. We're helping them to see the disability perspective and hopefully reduce trauma because of that knowledge.
Thank you so much for your lovely introductions. And I am Rachna Mimani, co-founder of EasyTogether.com. I'm also a mental health professional working in relationship coaching, not just with your loved ones, but with your corporate relations as well. So moving ahead, trauma, when we hear the word, we hear many images and sounds around us. All right. So today in this room, when we go in and deep dive into this panel, I would want you to leave every other name that you have beside just your name. If you're a doctor, drop it. If you're a Mr., drop it. If you're a Mrs., drop it. Or if you're a Miss, just drop it. Be just the who you are in that real presence of experiencing the entire discussion here in terms of trauma. So when we talk about trauma, we are not just talking about a soldier seeing war happen in front of him and people die. We are not just talking about doctors seeing patients die. We are talking much more deep. We are talking about the childhood abuse. We are talking about life after the natural disasters, life after facing life-threatening incidences, the emotional impact, the never dying images that is left on us, and how do people around us and we ourselves deal with us. I'm sure when we are sitting here in the room and when I talk about it, every one of us might have gone through a trauma in our own ways. So my first question goes to the team, and that is to Heather, how would you define trauma and the different ways that it manifests?
Trauma can look like a lot of different things, right? It's a disturbing experience, and I believe it's life-altering. Once someone experiences trauma, they are different, right? They're never going to be the same, but you can teach them how to overcome and adapt and actually become stronger, right? I work with a lot of individuals that suffer from mental health and addiction, and it is their escape. It's not that there's a moral failing, right? But they are self-medicating, trying to block out memories, the fear, the anger, and it manifests in so many different ways. And the military, it used to be 22 veterans committing suicide a day. It's doubled now, 44. There's somebody overdosing every 7 minutes because of the trauma that they are trying to escape. And that I'm not okay with that. Something needs to be done. So.
We would like Mitch to elaborate a little more with some examples and the experiences that he's had and seen in his life.
Yeah, I think Heather captured that quite accurately to use the word escape as one of the telltale signs for trauma. But let's also remember that trauma, the response to trauma, I'd like to be able to present it more from a perspective of, the two ways that we respond as people, being that there are people who are more likely to escape or go flight, right, or fight or freeze, right? And these are signs of people who are not able to cope with trauma. But it's even with people who are resilient that there is trauma, right? And there are people that the way that they cope with trauma is to, even in their resilience, to rewind and play the incident and the kind of conversation in their heads, right? So it may not appear to be as bad as those who have a more stressful response, but there is still a telltale sign of trauma in such situations.
Right. Thank you so much, Mitch. I understand that trauma can manifest in different ways, all right? I am moving to Jason to explain how trauma, when we are talking about culture, when we are talking about inclusivity, how does trauma implicate on them and what is its impact on them?
Well, I think I share just as a person who has disabilities, growing up and experiencing bullying, frustrations, not having access, so much information around me missing. And so when I go into an environment and I say what I need, people often dismiss or ignore my concerns and say, you'll be fine, or just expect me to accept what's going on. And what that does is it continues to build on top of each other. And the responsibility is on me to handle all of these incidents and all these problems. And I don't know how to solve these problems. I don't know how it's bothering them. I don't know the size and scope of it all. And so to have to go through all this experience and be responsible for it, it's hard to then be able to express the pain that's inside. And it doesn't get out. And so that pain continues to fester.
So as we know that trauma comes in spectrums now, how do we move ahead and tackle such impacts? What are the strategies and intervention? Mr. Lee, would you like to answer that?
Strategies, wow. It's a science or an art. It's a deep question. Like, what's the right way to deal with trauma? What is trauma? It means different things to different people. Rachna have mentioned trauma doesn't happen to only military veterans who have been through losses, grievances, or missing something out. I was trained as a soldier for 24 years of my life, and in my previous career and profession, well, to be very honest, we are trained to kill, right? That's what soldiers go through. We are trained to kill. And I'm proud to say that I have never gotten on a mission success because I was never sent out on a mission to kill. I come from Singapore. It's a peaceful army. And people start asking, now, Singapore is a peaceful country. Why do you need an army? Quite ironic. Like, I spent 2.5 decades of my life training how to defend my country. And that's where I start to realize that my mission is actually not to go into a war. It's to prevent one. If you don't have an army to defend yourself, that's where you are more likely to go into a war situation, which is probably happening as what we can see in the political situation around the world. Now, the truth is this. As a soldier trained to kill for the right reason, none of us want to go into a war. The truth is this. We are training for something that we don't want to happen. But if it ever happens, there's a solution, there's a contingency plan, there is an action plan. And that's what we meant by resilience. None of us want to get into a traumatic experience. But let's touch our heart. We are all human beings, like what Rachna said. If you're a doctor, drop it. If you're a lawyer, if you're an accountant, drop it. There would be a situation where you will have experienced trauma, maybe in your childhood, maybe in someone that's close to you. And it's about how do you relate to that event. Now, as we are speaking right now, I am very sure someone that we don't know in this part of the world is experiencing losses. Maybe it's dying right now. It's going through a sexual abuse situation. And because you don't know, that's why you don't feel as bad as the person that's going through. So this strategy that I deal with my client, I use it with my client, is this strategy of association and dissociation. Trauma looks and feels real when you are fully associated with it. Just like in a movie. When you're watching a movie, you're totally engrossed. Marvel's, Superman, whatever it is. You feel like you're flying along with Spider-Man, with nothing holding you on except this thin little spider web that swings you from building to building. Because you're fully associated in the movies. Trauma is the same. Like what Mitch mentioned, it is a movie that the movie controller decides to play and replay non-stop in their mind. But the truth is this event that has happened before happening right now? The answer is no. It is not real. So trauma is nothing but purely memories. If you're able to dissociate from the memory, then I would say that emotionally, at least, we can deal with what's inside us so that what's outside us can then follow on more positively. Yeah, so that's the strategy. If you're able to dissociate, I feel that it's a good management technique, coping mechanism, you can call it.
Okay. So a powerful technique, associate or disassociate, and it is just about the memories that you hold about the incident that happened in your life. Moving on to Mitch. Mitch, you've been also working in the strategies and intervention space. So what would you recommend there?
Yeah, so in my practice, I'm a certified functional medicine health coach. The kinds of clients I see, apart from mental health clients, I see a lot of cancer patients. And one of the things I've realized with the cancer patients I see is that the trauma alone of getting the diagnosis seems to be a major hump that a lot of these patients are not able to move forward from, right? And it's not very typical that we consider patients with other ailments or other non-communicable disease conditions have trauma, because we take for granted the fact that being diagnosed is actually a traumatic event, and it gets swept under the rug, and they chronically suffer from such trauma. So one approach we do, perhaps a bit connected to what you had spoken about, Mr. Lee, is really in being able to process self-talk, right? And understand whose voice is playing in your head, what is it saying, what's the tone of that voice, and what's the message. And it's teaching clients to be able to speak to that voice so they can disassociate. So this is the tool that we employ inside of our practice in a multi-practitioner kind of perspective.
So watch your voice, what you are talking about it to yourself. So that's another powerful technique or a strategy that you can take in while dealing with traumas for you and your people around you. Moving on to Jason. Jason, you've been experiencing this, seeing it in your environment, seeing it with people with disabilities and inclusivity, experiencing it. How do they, and what are their strategies and intervention techniques?
Well, I think I can share a few tips, definitely some recommendations. But it's important to keep in mind that individuals, how you want to help us. One person is not going to be the same for each person. You have to do it individual by individual in our community because the disability range is so different. Whether there's energy that's involved, there's a lot of things to emphasize. You just make sure that the lines of communication are open and that they have a full amount of support, whether that's therapy or psychologists. There's so many I've met who have said, you have to change. And for us in the disability community, the question is, why is it that we have to continue to change when the pain is inside of us? And so each individual dealing with those circumstances won't have necessarily the effort or the energy to be able to, move past it in a self-initiated way. And so a lot of people just kind of process it as that's life, and it's unfortunate. And I know that about 40% of complaints in the medical system are about failure to provide access. And so then individuals are afraid to go to where they can get treatment because they're afraid of how hard they have to work just to be able to have access. The embarrassment of being there. I mean, there are so many barriers to them even just getting in the door. So I like to encourage individuals in our community that they have to find a safe place first where they can express what's going on and they can get it from in to out. And to begin to come up with that game plan. The stimulus is just ongoing. And then like they said, when that continues to replay, it can then just actually cause them to dissociate from what's going on around them as opposed to from the problem, because then everything feels like it's on their shoulders. And so it's not knowing how to approach different situations, oppression. There's so many individuals who don't realize that they are being oppressed for their disability, for their lack of vision, for their lack of hearing, for their lack of ability to move. And so you have these different structures and systems in place that we have to be able to move beyond. We have to get to a point where there's equity in the community. And when our community has access to resources, they get access to that information as well.
Yes, I think being available to people and being sensitive around people around us and helping them cope up with what they are going through is, I think, moving a step towards an empathetic world. And that's what Jason promises in his conversation. Moving to Heather. Heather, you see diverse amount of clients, with addiction, other problems, and rehabilitating them in this space. How does the cultural diversity creates an impact on the trauma and the treatment?
That's a good question. Well, in a treatment facility, in a treatment environment, it can be very intimidating, right? A lot of fear, a lot of confusion. They may have experienced significant punishment for even admitting that they had a problem or going to prison, right? So it's a lot of fear-based. At Serenity Light, we strive to create a safe place for them to be able to come and feel loved, not judged, and be surrounded by people that have experienced it themselves. I am a person in long-term recovery. Trauma in my childhood, trauma throughout my life led to addiction, and I never thought that it would ever happen to me. And it is something that I do not wish upon anyone. But it took other people that walked that path ahead of me to hold my hand and say, it's okay, you're not alone, and we're gonna get through this together. For once, I felt accepted. I wasn't chasing this desire of just feeling okay, right? Someone extended their hand that has been there and said, we will get through it together. So I think no matter where we are in life, whether it's in a facility, at the workplace, at civic centers, there needs to be individuals trained that have had lived experiences to be able to be relatable and build that rapport, saying, I will sit with you and it's gonna be okay, right? This is how I've overcome, and this is how many have overcome. And so when we look at it in a treatment facility at Serenity, there's so many different lives that come in. And what Jason was saying, that it is crucial that you provide individualized, customized treatment. Everyone is different. We recover together, but everyone is different. What worked for me may be different for you. You may not hear something or see something the way that we presented it, but let's find what works for you, what feeds your soul. Meet an individual where they're at and help them experience different modalities. Not one way is the only way, one program fits all. Allow them to remove the barriers for themselves. At least I put up a lot of barriers for myself, right? Feel safe to remove that and surrender and say, I just want help and get well. So.
Yeah, thank you. And I think that's a very empowering answer. I think as individuals, if we ourselves can become a resource to help somebody overcome their own trauma, or if we can just reach out with a hand forward and say, we can get through it together, because that's the power of community. That's the power of people around us, and that's what makes us more human and making us come out from all these AI and technology world and addressing real life problems in the real way and not letting it shrug away.
Could I add?
Mitch, I would like you to expand on that.
Yeah, actually, I wanted to add a little bit to what Heather had said, because I think it's very important. It's been emphasized enough by everybody on the floor that it's important for us to meet patients where they are, right? And one thing I like about the training I received, there's this mnemonic that we use that allows us to have this sort of system and process to be able to personalize how we meet patients where they're at. And it goes by go to it, GOTOIT. gather, right? It's for gathering the information and gathering oneself before we meet with our patients. And then O is to organize the information that we receive as we gather it. And then we tell that story to the patient. So that's how we create the kind of relationship to collaborate and cooperate with the patient. And after we tell that story, we work with the patient to organize the priorities. So which areas are you most comfortable in, and which areas are leaping out? And then from there, we initiate a program, and then we track. And then you cycle again to the gathering step. So this is the modality that we use so that we're able to bring in a physical therapist, a nutritionist, a doctor, a psychotherapist, a health coach into a program where we're all looking at the same data and we're all understanding the different facets of an individual. Because, I mean, if you ask me about a patient, I see it from a behavioral perspective. I'm a health coach. But when I hear a doctor speak about what's going on with the patient, or I hear about, so we have a physical studio where we use movement as training for the vestibular system to be able to release PTSD conditions or even addiction clients by just using movement, right? So midline therapy and all of these things. So that's the mnemonic we follow in being able to be respectful to the human in front of us in a therapeutic paradigm. Thank you.
Yeah, so there is no one-size-fit-all kind of a therapy. We need to customize and personalize each therapy and look at it at a holistic way, right? Moving to Mr. Lee. Mr. Lee, in your experience, how can we effectively educate communities and institutions about trauma? And what role does prevention play in broader mental health landscape?
A mouthful question. Let me just summarize into 2 words that Rachna have mentioned in the long question. Education and prevention. So as we deal with trauma, it's something that, now let's look at life as it is. Do we all agree that at some point in our life, be it our childhood, in our juvenile years, or even adulthood, or maybe even after we retire from work, and some things will happen, right? Because we are human beings. And if we acknowledge that at some point in our life, some trauma or some traumatic events could happen, it may happen. It's just a matter of how severe, how serious, how big or how small it is. Then, would we then agree that it would be good to have the skill set, to have the reactionary knowledge and action plan to deal with it when it comes along? So, that's where education comes in. Now, I'm an educator myself. We train trainers, we train coaches, we train therapists to prepare them for the worst part of their life. And then I've got students that come up to me and say, hey, George, I don't need this. My life is all good right now. I'm happy. I'm in the best place of my life. I'll come to you when I need it. I will answer that question using a typical example that I exactly use in my class. Let's talk about insurance. How many of us here in the room owns an insurance policy? Hands up. Are we sick at this point in time? Well, most of us will say, no, we are all good. Then, why do you buy insurance when you're not sick? I will come to my insurance agent and say that I'll buy the policy when I'm sick. Now, try getting your insurance policy approved when you're sick. You realize no one buys it and no one sells it to you. Insurance is something that we buy and buy and buy, hoping that we will never need it. Does that make sense? When we go on travel, we buy travel insurance. Do you ever wish to claim from insurance like, I lost my luggage, I lost my laptop, I would like to make some money from claiming my insurance? No. We buy health insurance. We buy hospitalization plan. When we have kids, we buy more plans for our children. But we never hope that our children ever need to claim from it. However, education and insurance, it works the same way. It is better to have it and not need it than to realize that you need it but you don't have it. So it is a preventive measure. This is where I see education comes in. Now, if every one of us is properly and educated, then we will develop that strategy, individualized strategy, to deal with the trauma that will come along at some point in our life. And that strategy is not taught to you. It is developed by you. How do we develop that individualized strategy, which what Jason and what Mitch and Heather have all mentioned? It has to be customized. It has to be individualized. It has to be personalized. How do you make sure that it's individualized, it's personalized, and it's customized? The only way that will work for you is that you are the designer of that strategy. So how do you then design a strategy that works for you? First of all, you have to know what is the problem you're facing. Acknowledgement, understanding it, and being aware that I'm facing this. I need help. Then after that, you sit down, go into reflective mode and say, how should I handle this? Oh, I've learned this during my preschool years. My mentor, my coach, someone who had been through that shared with me that this was how he did it. But what he went through is different from what I'm going through right now. However, there are absolutely options and alternatives and examples that I can pick up from those people that I know of and customize it in the way that I would think that it will work for me. It is really a whole process of trial and error. So that's what I see education as it is. It is a preventive measure. If used correctly, then we will never need to adopt any corrective measures.
I think that's very, very powerful. So better to have it rather and hoping not to need it. But it's better not to have it at all or not is a question at that point of time. But here is something that I would like to share. I think there was a time when I was seeing a client, and a client was continuously into anxiety attacks. And she'd gone to many people around her, and nobody knew how to handle her when she was going through an anxiety attack. And she would just have an attack anywhere in a public space. So as professional, what do I do to her? Was it just with her that she needed to build a coping mechanism and needed therapy, or her caregivers also needed a therapy around it? So what I wanted to say here is that we as individuals form a society together. And if we all can extend that little arm of empathy to the other and tell them that, I am there and it is going to be okay. And even if it is not okay, nothing matters. And if it is it, then we will just deal with it together, right? And I think that's something very, very important. Moving to Jason. Jason, the same question goes to you, that how do we need to make our communities more sensitive to people with disability and with impairment, progress, and deal with their normal life traumas also at certain point of times?
That's a good question. And I like the words empathy and sympathy and the difference between the two of them. A lot of individuals will say, oh, I'm so sorry for that. Or how do we support that? It's this pity mentality. And the disability community is over that. We're done. We've gotten enough of that through our lives. From parents, from friends, from teachers, and the list of people who are sympathetic. It's time for us to say, hey, I also have this issue. This issue is bothering me. This is what makes me uncomfortable. And what are the reasons behind it? And you're engaging in that empathy as opposed to, I'm sorry for you. That's the difference to me between sympathy and empathy. Putting it on the other person as opposed to engaging with, oh, we share this same idea. And then allowing them to say, how are you feeling? And to process the emotions with them. And then to say, how can I help you? And then to go through the process with them. And to say, oh, it's not right. It's not fair. To say, I can see how that's so frustrating and how that is not working for you. To make the individual feel heard, understood, that their pain has been seen, and not that they're complaining, which is sometimes what they can get blamed for, that they're just whining about things. And so allowing a person with that disability to also find the right way to express it. so if somebody called me a bad name, if just somebody comes to you and said, they called me a bad name because of my disability, so they go, oh, I'm sorry about that. As opposed to an individual with disabilities who doesn't have a chance to express when those things happen, they eventually lose it, right? They explode. And then the behavior becomes the focus. They say, that's not appropriate behavior in school. It's not appropriate because it draws too much attention. It's not appropriate because it's embarrassing or it's awkward for the social situation. So the criticism, again, goes back on the person with disabilities, not realizing that they even said or did anything wrong because they were just trying to express their frustration in that moment. And so they often get punished. They often get criticized. It doesn't matter where it happens. If you think about justice system or mental health system and the abuses and the terrible things that have happened to people with disabilities systemically there, and if you only behave well, you're good. But if you don't do the right thing, you get put into confinement at one point in our history. And so these are daily experiences, and people in the disability community have reached their limit. Or a lot of people who would get jailed because of an expression that happens without recognizing that they're a person with disabilities. A lot of deaf people have been shot by the police because they thought they were being ignored when they just couldn't hear the officer. So there are so many differences in those experiences, and we need to recognize when we're coming to that individual, are we coming with sympathy or are we coming with empathy?
Thank you so much, Jason. I think that is very empowering as well, because lot many times, when we are all stuck in our rat race, we forget about some people who can't even be, make it to the spot, and whether they are abled or they're not abled is a different question. But we lose the perspective of hearing them out also. So it's time that we open our ears and focus on people around us and hear them out, right? So I think we're coming to the end of the panel, and here is what we are looking at, is that your closing remarks on how we can make the world or places around us susceptible enough so that traumas could be healed and we act as an empathy balm to them. What can we do at our own best and educate people around us for the same?
So I would start with awareness, bringing awareness and education, allowing individuals to have a voice and to have that empathetic listening, right? And to really listen and sit and create safe space for them to openly discuss, remove the guilt and shame, right? Remove the judgment. They are punishing themselves, and I say that, but my own experience, right? I was punishing myself more than anybody could possibly do it. And I was terrified to reach out because of the judgment, right? But once I did, my life transformed. And so moving forward, I think having a voice, breaking down the stigma, breaking down the silos, and meeting someone where they're at and saying, you are worthy for a good life, and you are loved, and let's do this together because you're not alone.
Let's do this together, we're not alone. Mitch.
Very well said. I wrote down my thoughts to make sure that I can deliver it in a succinct way. There's this renowned psychiatrist, Viktor Frankl, who says that between stimulus and response there is a space, and in that space is our power to choose our response. In our response lies our growth and our freedom. And this insight of Frankl reminds us of the profound impact of mindfulness and intentionality in our interactions, both with patients and colleagues. And trauma is also found in the practitioners, right? And then that spells a world of difference in the kind of energy that we get to bring into the therapeutic relationship with our patients. And in this, I want to be able to highlight the fact that we are capable to shift our response, right? By taking the space to be able to pause, think for yourself instead of just reacting, and be able to hopefully make ourselves present to the situation that we find ourselves in.
Thank you. Thank you. Lee.
Very nice. Well, I just love to use these two words whenever I deal with someone who is going through a trauma, be it something that happened in the past or right now. It's called love and respect. But I'm going to dissect these two words down to a smaller bite size so that it makes it easy for the client to understand. Now, I'm not a doctor, and the one that I'm working with is not a patient. So this is a very clear-cut name or terminology that I make it clear. So since you're not a patient, there's nothing wrong with you. That's what most patients comes up to doctors, like, doc, I'm wrong. Tell me what's wrong with me. And it's quite ironic because after doctors put us through tests and the test result shows that everything's okay, now that's where the patient gets a bit fidgety. It's like, no, there's something wrong with me. It's just not right. But the test says everything is fine. Can you go back home and rest? No, doc, I think there's something wrong with the test results. It's like now the patient is trying to find out what's wrong with them. That's a good example of trauma. So whenever someone who comes to me and share with me their traumatic experience, first of all, I acknowledge and I will share with them this very sentence. Now, know that I respect you and I love you for you as a person, but I have no love and no respect for your problem. That's where we delineate, we dissociate the person with the perceived problem that he has. Because trauma is not real. It is in the memory. So now what happens when you have love and respect? You allow that thing, that person, that event to stay put. It has a reason for its presence. How do you then let those traumatic experience or memories leave you? You've got to be disrespectful to them. You've got to unlove them. Because without love and without respect, that thing or that memory does not have a place in your brain, in whichever part of it it's stored in. And that's the only way that you will get that new life that we are all looking for, to get out from the traumatic experience. Now, things that have happened can never be undone. It's about moving forward. And for those of us who are looking at moving forward, the first thing you got to do is to acknowledge. The second step is to let go. When you acknowledge and is able to let go, then you will be able to get out from the traumatic memory that keeps replaying in your head. So, love and respect. That's it.
Thank you, Jason.
Closing words. All right, I'd like to just again emphasize disability. Individuals with disabilities will have pain that you cannot see. And as you're developing your programs, as you're offering your services, as you're advertising, as you're growing your business, whatever you're doing, don't forget and leave out people with disabilities who then would maybe not be able to access what you're offering. And you might be able to say, oh, I don't have time to build that in right now. Or maybe you're not even aware of the persons with disabilities who would want to access that. A lot of big companies are really focused on profits to start with. And that oppresses people in the disability community because we have to keep waiting to get in. So while you're building your business, take time, slow down, invite members of the disability community in, hear their stories, learn how you can accommodate them, give them equal access. I hear a lot about diversity, equity, and inclusion. DEI is great. I think that's good. But we're talking on race, background, economic levels, which is good. That's all great. But individuals with disabilities are not included, and that's a diverse population as well. And it's just such a glaring gap for me. Our community is still not included in that DEI. So if you're going to do the talk, make sure you have the action behind it and the compassion to do things better.
That was empowering for all of you. So here is what I think should, compromise all and compose all the, tips and tricks and the strategies that we've got in this small poem that I have for you all. So, in shadows cast by traumas deep, silent struggles, wounds that seep, heavy heart with the weight they bear, seeking solace as answer so rare. Amidst the pain, a flicker of hope, where compassion and empathy elope. People untied and a collective plea, funding a heaven free in spirit. Coins of kindness, a currency so bright, invested in healing, dispelling night. From shattered pieces, mosaic forms, rebuilding lives is a gentle storm. Through understanding, a bridge we build, healing wounds that time has chilled. With empathy as a compass, a guiding light, hope blooms in the darkest night. So people, hurt people, hurt people. Let's not hurt anymore, just heal the world around us. With that, we conclude the panel. Any questions, we'd be happy to take it.
We do have one comment that would like to be added. Floor mic, please. Floor mic.
Hello? Yeah. Okay, hi everyone. Not a question actually, but your topic was very sensational. I wanted to share because trauma is individual, as you mentioned. So I wanted
Come closer to mic, we can't hear you.
Yeah, okay. Can you hear me better now? You have mentioned trauma is individual process or steps or journey that each one of us have a different way. So I wanted to share as a survivor of trauma something from my side about the steps that I have went through. I'm not the most interesting thing that we live, we come to life, trauma happen, life goes, but we stay still on where trauma happened. We can't move forward because we hold on a situation that happened on our lives. And since that point, in order to be able to perform, we have to go through much pain. We need to, at the first beginning, I figured out that we need to share, we need to cry, we need to find the beloved ones, talk with them, share with them, feel secured. And when we feel a little bit relieved, then after that comes the next step where we should be aware that it's not our fault. We are not the cause. We are not the problem. So after we gain this awareness, we jump into, after that we come into conclusion that life is not going to fix it for us, but we need to change it. So we became more responsible of what happened. We change what happened. We don't live as a victims, but we change that in order to gain. And after doing some more achievements, the last thing, which is the most hard, I believe, in order to be able to gain the freedom of the heel, is that you need to forgive what happened. So in order to leave something behind, leave your hand, forgive it, and move on for upcoming shiny life. That's my journey. I hope that this helping for anyone who's going through trauma. Thank you so much.
Thank you. Thank you. So forgive and forget, and then move on. Yeah. So I think we have been asked to move up from the stage. Any more questions?
Thank you so much. Let's give a round of applause to our panel. If I can just ask everyone to take a step to the front of the stage so we can take a group photograph. Fantastic. Thank you so much. Thank you very much. Definitely very unique perspectives on the topic of trauma. And I cannot believe that we've already come to our final panel discussion. It's been 3 days. I've learned so much, and we've had some really great conversations on the stage. So I want to say there's countless individuals that are silently battling with vitamin D deficiency, a condition that's very often overshadowed despite its link to weakened bones and compromised immune defenses. Overlooked by so many, and the breadth and hidden consequences of this issue beg for attention. To confront this, we will be convening a notable ensemble of experts for an insightful panel discussion. They aim to uncover the overlooked dimensions of this global health concern, offering solutions and prevention tactics to cast a spotlight on mitigating this quietly pervasive condition. I would like to welcome for our very final panel, Ahmed Ez. He's coming back to the stage. Dipanjan, also making his way back to the stage, and Yvonne Schimmel, second time on the stage today. Let's give the panelists a round of applause. And the stage is yours.
Yes, I'm waiting for the music. That was the wrong one. Yes, this is the one. I would like to get you all up. Please stand up. Can we continue with the music? Yes. And please, raise one hand. Or one hand. Left or right, it doesn't matter. And give yourself a pat on the shoulder. Because you made it. You are still here after 3 days. Yes, that's very good, and I'm very grateful that you are still all here to listen to our last panel. Now, don't sit down. Don't sit down. I saw you. Find someone else. Make a couple. So find someone else. Be the two of you. Yes, come on, continue. Find someone. You're on your own, so find someone who's also on your own. Yes? Okay. Yes, there you go. You find it. Yes, perfect. Okay. One of you is going to applaud. Yes? The other one is receiving it. We're going to stand in the receiving mode. Yeah? So put up the volume and applaud and receive it. Because you are still here and you deserved it. Okay, now change. Perfect. Okay. Now you can sit down and we will start with the panel. Thank you. So I hope everyone is a bit awake after 3 days of being here. And did everyone like it, enjoyed it? Yes, perfect. Okay. I will introduce myself quickly. This morning I was also in a panel and I introduced myself, but for the people who were not here, my name is Yvonne Schimmel and I'm from the Netherlands and living in London. And I'm a holistic practitioner, and that means that I work not only physical, but also mental. And that is actually what we have been hearing the whole conference here, how important mental health is. So it's a holistic approach of getting someone better again. And next to that, I use a medical device. And with that medical device, we can scan the whole body to get a complete insight in how healthy you are. And it's an extra tool for doctors to make it more easier to diagnose what's going on in your body, in your system. I'm a nutritionist, so that's what I said this morning. We are inventing and innovating technique so much with AI, but why don't we go back to where it actually starts, and that's nutrition. I'm an author of my new book, and that is Eat Well, Uncover True Health, and that's all about nutrition, the do's, the don'ts, the myths, and the lies. So everything what you need to know about nutrition, and it needs to be in every kitchen, I do believe, so that you can make the right decision based on facts. Next to that, I work with a Dutch company, DNA collaboration. So they do DNA research, and I think that's also a very good tool to find out, even if you have a vitamin D deficiency, but also all kinds of other diseases. And I work with the BCMA company, with Nikos, and to educate doctors, and that's what we spoke about this morning also. So please, Dipanjan, introduce yourself, what it is that you're doing.
Thank you, Anan. So my name is Dipanjan. I'm a pharmacist. I work in the clinical research drug safety industry. I've been part of the industry for more than 15 years now. I'm currently a vice president in 4C Pharma Solutions. I lead their global commercials and strategy. So basically, I've been into patient safety health for the entirety of my career. And 4C Pharma Solutions is a boutique data sciences company wherein we serve our clients to ensure that all their medications which are in the market, all the adverse events are reported properly on time, being compliant to all the regulatory authorities, be it FDA, MHRA, EMA. And then we also work into the pre-marketing part of it, where we ensure that the data is correctly reported for all the investigative drugs to get their approvals, and then, of course, help patients. So I'm looking forward to the discussion today. Thank you.
Okay, Ahmed, please introduce yourself.
Thank you. My name is Ahmed Az. I'm a regional senior director in the pharma industry, responsible for the sales and marketing of a franchise in a company called Newbridge Pharmaceuticals. I'm responsible for the therapy area, gastroenterology, and metabolic diseases. Part of the metabolic diseases that I'm responsible for is vitamin D deficiency. So I'm happy to be talking about it today with you. And I'm a pharmacist by education. I have an experience of 17 years experience in the pharma industry. I'm Egyptian, based here in UAE, and responsible for sales and marketing of pharmaceutical products. Newbridge is responsible for bringing innovations from across the globe to the Middle East and North Africa. One of the innovations that we're bringing is vitamin D. We are happy to be partnering with one of the global industry leaders in vitamin D in Italy, our partner Abidjan.
Perfect. So you see, I have the experts here. Well, vitamin D deficiency is huge, unfortunately. And in the Netherlands, where I'm from, it's 40%. In the US, it's 42%, and 50% in children on the age of 1 to 5, and even 70% with children 6 to 11 age. So that's very high. And even more in Pakistan, Bangladesh, India, Nepal, Sri Lanka, the vitamin D deficiency is also very high. Maybe, Dipanjan, you can explain why there is so much vitamin D deficiency worldwide.
See, there are multiple factors to it. One, of course, is vitamin D being a fat-soluble vitamin. The major source of it is sunlight exposure. Now, what happens is in today's world, the exposure to sunlight has drastically reduced with many kids and even adults. It's across. Being on the mobiles, being on the screens, being in enclosed areas, so the outdoor activities has reduced. And the other key factors which impacts vitamin D deficiency is the fact that if you have extra melanin in your body, it typically prevents the absorption of the classic UV rays, which gets converted into vitamin D. So, it is dual facet, right? Too much exposure to UV rays can cause skin cancer, and that's why a lot of us use sunscreen lotions. But then that very sunscreen lotion can also prevent the absorption of UV rays and result in vitamin D deficiency. Now, having said that, one of the other key factors is most of us, do not typically do those regular checkups of our vitamin D levels. If we did, we would have probably realized that many of us are either on the borderline of being deficient or are actually deficient. I myself was vitamin D deficient probably 10 years ago when I did a test and realized that I'm deficient, and I then moved into supplements, although I was pretty much into outdoor sports. So I think there's a multitude of factors, but I think one of the major factors is also that we do not check our vitamin D levels. And even if we check, sometimes there is an inhibition in a lot of us to take vitamin D supplements. Now, we sometimes think that we will be able to cover it with foods. It is great if we can cover it with food, the natural sources. But if we are not able to cover it, then it is imperative that we do that supplementation. Because, during our course of discussion, we will be touch basing on it, that vitamin D, is very, very important for a good physical as well as mental health for the lot of us, yeah.
Yeah, and I want to add to that when I was working with my body scan in different countries, and also in countries where it's very warm, there was still a deficiency of vitamin D. And I'm from the Netherlands, and when we have sun, we are like, oh, okay, finally we have sun. But if you have sun every day, you're like, okay, whatever. So you're not sunbathing. And there's also a culture that, they dress up from top to toe, so they're also not exposed to the sunshine, that they can get the vitamin D in. So for you, Ahmed, another question. What are the symptoms of a vitamin D deficiency?
So basically, vitamin D is touching multiple organs, so symptoms can be ignored or even misinterpreted. So feeling lazy, feeling lack of energy, loss of hair, loss of memory sometimes, lack of energy. So that's the confusing part, and that's what we never relate to vitamin D deficiency, dizziness. It's very problematic that vitamin D deficiency symptoms cannot be all correlated to vitamin D deficiency. No one can pinpoint, yes, that loss of hair is vitamin D deficiency. It might be first comes to, okay, what was the latest shampoo or conditioner that I use? So it's very confusing. And actually, loss of concentration, for example, could be vitamin D deficiency. Vitamin D is very elemental to many processes in our organs. So no one can think that this multiple organ, I cannot say failure, it's too serious to say failure, but multiple organ dysfunction can be all related to vitamin D deficiency. So yes, it's impacting every organ, and I'm sure that once we go to the discussion, we can say that it doesn't only impact every organ, it impacts every stage from the pre-gestation, or let's say from the gestational period, from the infants, from the first trimester, from the gestational period for the kids. I cannot say kids here, from the embryos until the geriatrics. Vitamin D deficiency can touch developmental stage. So vitamin D deficiency, let's say, for example, from the embryos, vitamin D deficiency for the pregnant ladies can cause preeclampsia, which might lead to multiple organ failure, really serious. Can lead to premature labor. Vitamin D deficiency for the mother can lead to anemia. Vitamin D deficiency in the third trimester can lead to hypertension or can lead to low birth weight. Vitamin D deficiency for the newborn can lead to rickets or bone fractures. Vitamin D deficiency as we grow old can lead to neurodegenerative disorders. Parkinson's disease can lead to several organ problems. Even across the adolescence, vitamin D deficiency can lead to acute respiratory tract infections. Vitamin D is helpful for the immune system. So I cannot summarize in a single answer, a simple answer for this, but it's very serious and we cannot relate it to vitamin D deficiency, and it needs but we can go through it as we go through the discussion.
Yeah, that's why it's so important what Deepanjan also said. We have to check. I think every year at least do a check so you know your vitamin D level. And coming back to that, what would be a good vitamin D level?
Yeah, no, this is a question which has probably interpreted differently in a lot of different parts of the world. Nowadays in India, from where I'm from, what I do hear doctors say is between 30 to 100 ng per ml is the level they're looking at. But then in other parts of the world, the interferences can be different. You know, I do know in some parts they say it's 30 to 120, some parts they say it's lesser, maybe 30 to 50, 30 to 60. Some years back, you know, actually a decade back, they used to say somewhere between 30 to 60 ng per ml was the sufficient level of vitamin D. So that markup is something which keeps on changing over a period of time, yeah.
Yeah, that's true. And I think if you have been to a doctor and you've done the test and the doctor said, oh, everything is okay, your level is good, please ask your doctor, what is my level? Because what the doctor thinks is good, we probably think it's way, way, way too low. So that's why it's so important. If you have any symptoms, what Ahmed just said, please find out. And you don't always have to go to a doctor. There are plenty of other tests you can find on the internet who are very accurate. So you can test your vitamin D level yourself. So coming back to a supplement, yeah. How much would you recommend, how much should people take as a vitamin D supplement, the IU or the microgram?
So that's apart from vitamin D deficiency. There is a recommended dietary, not daily, recommended dietary allowance for every healthy person to take from vitamin D, which when it's ignored, that leads to vitamin D deficiency at the end of the day. And back to the awareness point here. When we are not aware of vitamin D necessity in our daily life and we don't get conscious to our vitamin D intake, we end up with vitamin D deficiency. For children with the age of 0 to 12 months, they should have an average of 400 international units of vitamin D per day. And for above this age, it should be an average of 800 to 1,000 international units per day. That's as per different guidelines, among them the WHO guidelines, which is really serious because if it's not taken, and it's usually oversight from everyone, because we don't usually take mushroom every day, which is the highest veggie that contain vitamin D, or we don't usually are keen on having few handful of almonds every day, so or milk is a sufficient amount of milk. We are not so conscious to such amount of intake, but that's really essential. So if we are talking about supplement, yes, that's the supplement needed, but if we are experiencing a deficiency or insufficiency, a treatment should be needed.
Do you want to say anything about that?
No, I think a very fair point. So, especially from a deficiency perspective, you know, I have seen, at least in India, adults, healthy adults, being prescribed something like 60,000 IU, once every 3 weeks before your vitamin D levels get normalized. Of course, they're very, very deficient, so it depends, but I have also seen high amounts of vitamin D IUs given if they really find someone is like strongly deficient in vitamin D. And then, of course, you keep on checking, and once your levels are up in the normal range, then you take the sustainable units, or you move back to your food like mushrooms, cod liver oils, fatty fishes, and try to maintain the vitamin D. Yeah.
Sorry, I'm just adding to this also. Please do not get shocked at all if you have been prescribed vitamin D up to 300,000 international unit. This is a loading dose for people who are coming very severe or very deficient, severely deficient, because this is a loading dose. And I kept usually, and sorry for this very basic description, I kept usually looking at vitamin D as an empty glass that you should immediately fill once you are aware that it's empty. So fill it as soon as you are aware it's empty. Fill it with a high loading dose. There is no serious side effect of having a high dose vitamin D. Sometimes it's taken intramuscular injection. So the sooner the better that you fill it. No side effects of having it. And sometimes it's taken as a maintenance dose once every 6 months. So once you are aware that you are vitamin D deficient, start as soon as possible, and regardless the frequency of the dosing. Sometimes 300,000 injection every 6 weeks, sometimes 50,000 oral capsule or even oral shots every week until it gets corrected, but start as soon as possible, as soon as you are aware that you are deficient.
Yes, thank you for that. And when would it not be okay to take a vitamin D supplement?
See, if you have some kind of classic diseases wherein your kidney functions are not proper, that's when if you take vitamin D, what happens is your amount of calcium which is being metabolized decreases, and it can lead to kidney stones. So if you have your renal function is not proper, that's when you need to consult with your healthcare provider before taking vitamin D supplements. And then you have some classic diseases like maybe histoplasmosis or sarcoidosis, or maybe parathyroidism. That's when taking vitamin D is something you should do after talking to your healthcare provider. And then there are some certain medications which is contradicted with vitamin D, like diltiazem, verapamil, so maybe even atorvastatin. So what happens is when you take this, the excretion of the calcium from the body, the metabolism of calcium kind of decreases a little bit, which might lead to kidney stones. So those are a few of the areas where you need to discuss with your healthcare provider before going on a sustained vitamin D supplement use.
Yeah, as you say, it's very important to take upon a healthcare provider who knows exactly when to take, what to take, how much to take. Yes. Ahmed, could you please explain the difference between vitamin D2 and D3?
Yeah, vitamin D2 is the inactive form of vitamin D in general, which is coming from a plant-based ergocalciferol. Vitamin D3 is the active form, which is cholecalciferol, that doesn't need activation, that is really immediately active and binding to vitamin D receptors in the body. So vitamin D3 doesn't need activation, is the active form, and which is really easier to, let's say, to get activated in the body because it's immediately active. It's helpful to get vitamin D3, and it's less, if I would say, it's less toxic, and the threshold of toxicity is less in vitamin D3, the cholecalciferol one.
So it's better to take vitamin D3 over vitamin D2?
Yeah.
But what if you are a vegan or vegetarian?
I don't have a call here, it's not my call, but at the end of the day, this is a medicine. So the origin of the medicine itself, I really don't have a call here for people who are vegetarian or not. But at the end of the day, cholecalciferol, I don't know exactly what's the origin for the API for pharmaceutical companies that manufacture it, but it could be manufactured not from animal origin.
Is that it manufactures from the wool of the sheep?
Chemical.
Yeah.
I'm not sure exactly is it coming from animal or not, but if it's chemically produced, this is something else.
Yeah, okay, thank you. And we're talking about supplements, but of course it's much better to get the vitamin D out of food. So could you give some examples where we can find vitamin D in what kind of food?
So cod liver oil is something which we have all taken, once in a while. That's high in vitamin 3. You have mushrooms, you have fatty fishes, whether it's salmon, whether it's hilsa, whether it's tuna, which is high in vitamin D. And then you will have some fortified foods. Milk also has decent amount of vitamin D. So does beef liver also has a lot of vitamin D. So these are specifically the foods which we would need to take for vitamin D here.
Okay, thank you. And for you, Ahmed, why should people with dark skin take a vitamin D supplement?
Yeah, because actually the level of activation of vitamin D is not the same like people with lighter skins. So at the end of the day, they are not having the same level of vitamin D active in their skins. So and the same that what has been mentioned at the beginning of the presentation of the discussion, melatonin doesn't activate vitamin D. The high levels of melatonin doesn't activate vitamin D. So this is a risk factor that they need to be aware of, and to have a more keen supplementation of vitamin D, especially the active one, the cholecalciferol, or if vegan, the ergocalciferol one.
Yeah. For you, another question. The correlation between vitamin D with calcium, with vitamin K2, magnesium. Could you explain that?
Yeah, I think a lot of us, we see that if you are calcium deficient, we end up taking calcium supplements. But what we don't realize is vitamin D plays a major role in the absorption of calcium in the body. So what happens is, if your vitamin D levels are low, your calcium ions in the body goes down, and the parathyroid gland, which typically has the calcium receptors, what it does is it reads it, and it releases the parathyroid. So what it tries to do then is that the parathyroid hormone, it dissolves the bone matrix to release the calcium ions into the extracellular space. Because as per its reading, you are not able to absorb calcium. Now what it leads to is osteoporosis, which then leads to weakening of your bone structure. So if you see calcium deficiency, a majority of it, there has been studies where it says that 70 to 80% of calcium deficient people are actually deficient in vitamin D. So it's imperative again that when we are deficient in something, we are looking into the other parameters to understand and go to the actual root cause of why this deficiency is occurring. Because even if we are taking calcium supplements, it won't really help us. Because if there's a vitamin D deficiency, the calcium absorption would probably be 10 to 15% of whatever is available.
Yes, and it's so important that we realize that if we have a deficiency of calcium, like you said, it's not that we need to drink milk or take the calcium supplements, but we need vitamin D and we need vitamin K2, because vitamin K2 is making two proteins so that we can transport the calcium into the bones. And we need magnesium to make it able to absorb it. So that's why I think one of also the reasons is that we have such a huge deficiency of vitamin D, because we are lack of the micronutrients. That's what Dom was talking about last night. So we really need to take the supplements nowadays, unfortunately, because it's not that much in our food anymore. So, but not only take a vitamin D, but combine it with a vitamin K2, so it goes directly into your bones. And take it with the magnesium so that your body can absorb the vitamin D and do something with it. Another question is, I'm not sure if you read the question, so hopefully, otherwise I'll answer it. About DNA testing, what do you think about that? DNA testing for vitamin D. Should we consider doing that more often, so we can see if we have a predisposition for a vitamin D deficiency?
So actually, vitamin D deficiency, as far as I know, I didn't read the question, but I'm just reading generally, and maybe in our industry we are much more involved and exposed in the precision medicine generally. And there is, as far as I understand, I would like to learn also from you, from your readings, if you have gone through this. But as far as I know, that vitamin D deficiency, as long as it's not organic from lack of absorption, it's not inherited. So there is no inherited, let's say, trait or organic disorder that leads to vitamin D deficiency. But as we learn from the medicine, we get to know. So gene mapping and DNA sequencing is really helpful to do more tailored precision medicine and more tailored diagnostic tools to understand the diseases before they happen. But nothing so far is relevant and pinpointing to fight off vitamin D deficiency so far as I know. That's my understanding.
Yeah, okay, well, thank you. Yeah, well, I'm working with a DNA company in the Netherlands, so that's why I know it's possible to look into your genes and see if you have indeed a predisposition for the deficiency of vitamin D. It's not that you will have a deficiency of vitamin D, but it's for you that you will have it quicker than someone else to have a vitamin D deficiency. So it's another tool to find out, if you have a gene predisposition for vitamin D deficiency, you already can take a supplement, so you know that you won't get a deficiency. What's your intake about that?
Yeah, I have read a few articles of what you said, but then again, my knowledge on the DNA sequencing part of it for vitamin D is limited. I have read a couple of articles, but I just wanted to know that it is being, now that you are working closely with that DNA company, how is it being used in Netherlands? Like, are a lot of people using it?
Well, it's new in the Netherlands actually, and so we're just starting it up. But it gives so many results, and not only vitamin D, but vitamin E, vitamin C, vitamin A, the MTHFR gene, and that one is very important, because if you have a predisposition of that gene is not functioning very well, it means that the homocysteine in your body is accumulating. So that can cause so many diseases and pain in your body. And that means that you have to take the vitamin B12, you have to take the folate, so it's possible, and some other vitamin Bs, so it can get out of your system. So that's why I'm a huge fan of DNA testing, because we can find out what's going on in your system, what's your predisposition about it, so you can take action. Yeah. The last question we have 6 minutes. I don't know if you know anything about the emotional part of a vitamin D deficiency.
Yeah.
Why do we have it?
Yeah. Vitamin D plays a role in the CNS, and this role is multidimensional, especially with the dopamine and the acetylcholine. So vitamin D is mainly, and I know mainly the role that it plays physiologically, not psychologically. So it's a neuroprotective agent that protects the axons of the nerves, and it's a neurotrophic agent, which actually increase the dopamine levels. So psychologically, we can expect that it improves the mood and reduces the acetylcholine levels. So that's another part. It plays an important role also in stabilizing the neurotransmitters, which reflects on the Parkinson's disease improvement. And there has been reported several reports on the improvement of Parkinson's disease treatment outcomes with vitamin D versus without. And by the way, the same applies also to mothers taking vitamin D during the pregnancy and the neuroprotection that happens to their offsprings versus mothers who are not taking vitamin D. So that's the physiological role that I'm aware of regarding vitamin D.
Do you know the emotional part?
Yeah, so a few of the studies I have read about is that vitamin D deficiency does cause depression, anxiety, and with what Ahmed is saying, this probably connects the dots, because physiologically, if they are neuroprotective, then a deficiency will physiologically eventually lead to depression, anxiety, and all the CNS disorders which we nowadays see. So yeah, so I have read a few articles about it, but then with Ahmed explaining the neuroproductiveness, I think the dots are well connected.
Okay, then I'm gonna explain a bit about the emotions, because for my belief, every disease starts with an emotion and nutrition. If you have the feeling, and then I come back to the panel we have here before about trauma. If you have a trauma that's not solved, if you have the feeling that you are not good enough, if you have the feeling that people are after you, if you have the feeling that you're not able to be who you really are, also causes a deficiency of vitamin D. So it's not only on the physical side, but it's also an emotional part, what's very important, and I think no doctor looks at the emotional part of it, and that's very important. We have 3 minutes left. Are there any questions? Yes, Dom, I thought you would be there. Can we have the mic on the floor, please?
Is it on? Yes. So I heard at the beginning about sunscreen lotions and sun causing cancer. That's not true. Sun has very, very little effect in causing.
Can you repeat it again?
At the beginning, there was mention about sunscreen and sun causing the cancer.
Sorry, your mic is still not functioning.
Okay. So at the beginning, there was mention that sun is causing the cancer. That's actually not true. It has very, very small amount of effect in getting the cancer. What is actually causing the skin cancer is sunscreens, because 5 main ingredients of sunscreens exposed to the sunlight are causing the skin cancer. One of the examples, just Google retinol palmitate and what happens with that ingredient, which is main ingredient of all sunscreens when you apply it on the skin.
Yes, I totally agree with that. It's not indeed the sun that creates cancer, that we get cancer of, it's the sunscreen. And I won't say every sunscreen, because we do have very natural sunscreen. Coconut oil, for instance, is a very natural sunscreen oil, so that's what we can use. But I get your point, you're right about that one.
We also talked here about supplements, but nobody mentioned how do you know does supplement actually work for you? Is it healthy for you? Because if any supplement, when you take it, changes color or smell of your urine, it's actually toxic for your body and you shouldn't be taking it. Because this is your liver's reaction on cleaning the toxins from the body that you took as that supplement. So you need to be
anyone wants to refer to that?
I cannot say or claim that any pharmaceutical product is toxic for the body, because these products, before being approved, they passed all the classes or all the phases of phase 1 and 2 and 3 of the clinical trials before getting approved to go to the market, which are efficacy and safety and tolerability studies before getting approved. So these are proven to be effective and safe before going to be ingested by a human. So rest assured that these are safe. Yes, there are some side effects, but these benefits outweigh the risks. Yeah, there should be side effects, but for such supplements specifically, the benefits much outweigh the risks. So get the benefits and forget about the risks.
Also, if I may add, not all human body reacts to the same supplements in a similar way. There might, of course, be some individuals who reacts to some supplements in a different way. And when they do, I think the best course of action is to contact your healthcare provider. And if there are any adverse events for any supplements, do report those because organizations like us, we are the ones who then take those ahead and do the signaling and the risk management part of it.
But I do understand your question. There are a lot of supplements on the market that are rubbish, indeed. Yeah.
Yeah, and most of them are not regulated because most of the supplements in Europe don't need to be regulated. You just create a supplement. This helps with this, and that's it. Because they are not treated as medication, so there's no special treatment for them.
Yeah, please stay away from the supplements, yes. And I would recommend going through the medicines that are regulated by the authorities.
And one more thing, there was a question about vitamin source for vegan. Between 10 and 2 p.m., 20 to 30 minutes on the sun, sunbathing, no baths or showers 6 hours later because that will take the body's ability to absorb the vitamin D that's produced on the skin.
I'm sorry, you spoke so quickly and it's not really clear what you said.
So I said to get the vitamin D, the best thing is to do 20 to 30 minutes on direct sunlight, sunbathing between 10 a.m. and 2 p.m. when the sun is the strongest, and not taking a bath or shower afterwards, because that gives your body ability to absorb the vitamin D that's produced on the top of your skin.
Yes, you're right about that.
And one more thing about the mushrooms. When you buy the mushrooms in the store, place them outside on the sunlight, because that will increase the vitamin D content in them.
Thank you so much. The screen is red, that means that our time is up. So I want to thank you all. Oh, one more question.
Hi, thank you very much. I really enjoyed this panel discussion.
Please speak up because I can't hear you.
I really enjoyed this panel discussion. I think it was you touched on the very crucial things. I would like to add one thing I was waiting for that is a little bit slipped, either or I missed it. So of course
we can't hear you.
You cannot hear me?
No.
Okay, sorry. Thank you very much for a great discussion. I was waiting for, we were talking about like accentuating effects. We're talking about calcium and how that affects deficiency, right? As well as we were talking about secondary problems with osteoporosis and things like that. But I think one thing that was slipping here a little bit was that specifically for women in menopause, that you have a significant factor in vitamin D deficiency. There is also the menopause, and I'm talking then of course about the lack of estrogen. So that is also a major factor that wasn't mentioned. I just wanted to say that because that's, we're getting older and older. That includes women. So yeah, that is a major factor in osteoporosis together with calcium.
Thank you so much for that. I want to thank Maxine.
Oi?
Yes,
See?
you. Because you have done an amazing job the last 3 days, and we were really happy and proud to have you here.
Thank you for having me. It's been an absolute pleasure and an honor.
Yes, and I want to thank, yes, a big applause. And also please a big applause for the cameraman, the video man, the music, for everyone. And to be honest, the staff around here in the hotel, everyone was so kind and sweet. So I really enjoyed staying here. It was really fun. And I want to thank you all as an audience to stick till the end. Thank you so much.
Thank you very much, panelists. I'm going to ask you one final time to take a step to the front of the stage and let's get a group photograph. A final round of applause. All right, so I have to apologize to everyone in this room because we've kind of been a little bit off schedule and we've missed a few important business card exchange sessions. So what I am going to ask you to do now is a little bit of an experiment. These are going to get thrown away after the conference, right? What I want you to do is I want you to take your one. There's pencils all over the room. Okay, now I know there's a lot of doctors in the room, but please try write nicely. I know, it's an inside joke, all right? So what I need you to do on your little paper coaster, I want you to write your name. I want you to write your name on here nice and eligibly so that not only me, but anyone in this room can read. I want you to write your name on that, and I want you to fold it 2 times. I want you to fold it 2 times so that you're left with like a piece of a pie. Once you've done that, I'm going to ask my lovely colleague, Yashu, to go around and collect everything. Collect all of the paper coasters, put them inside this little silver bucket. Please don't do anything special with it. Just fold it 2 times, and it must have your name on the inside. That's it. That's all you have to do. I'll come collect some on this side so we can speed things up. Thank you. On this side. Thank you. Thank you. Please close the doors because if we have any extra people, this is not going to work. Yes, it's not going to work if there's extra people. That's it. And we're going to fold it one more time. That's okay. I'm here to help you. All right. Hold on, I see. All right, so is everyone got their name in here? If you didn't put it in the bucket yourself, I took it from your hands. Fold it 2 times for me. Thank you. All right, now I'm going to pick on someone. Who am I going to pick on? I'm going to pick on this lovely lady. I want you to find yours. I'll give you a minute. Yes? Look for yours. What, should we give her a time limit? Maybe just a minute or 2? Yeah? Don't worry, take your time. This is the whole point of the experiment. No, you didn't. Look again. All right. So the point of the experiment will be shined upon you in a few moments. All right? All right, stop. On her own, it was really difficult. You saw her facial expression like, really? Do I have to do this? It was a task that seemed impossible. Yes or yes? All right, now I'm going to ask you to put them all the way you found them. I'll help you. So, there's 1,000 little paper chits in there. Everyone's got their own name on it. And I asked this lovely lady to find her one. I should have mixed it up. But the point of it was that she couldn't do it alone very quickly. So here comes the experiment. Take one. Everybody take one. And look inside. Take one. Might take a second. Because there's only one. Right? Take anyone, doesn't matter. Here you go. Like I said, if there's more people in the room, this won't work. So I hope no one else has walked into the room. Otherwise, someone's going to be a bit lonely. Yes, actually, let's have some bodyguards at the door. Let's have some bodyguards. You picked yourself? Do that again. Wow. Okay, give it to me. Take one. I didn't, no. You have? You have? Dom, you need? There we go. All right, we're almost there. We're almost there. For reals? What's up with that? Take that one. I guess I needed a bigger bucket. This is what the hotel gave me. If you didn't realize, it's an ice bucket. Like for one person. Oh, goodness. Seems like we've got a problem table. Yeah, I got a problem table over there. All right. Oh, then we got two. Uh-huh. What's the problem? My goodness. All right, who didn't get a chit? Yes, because I have a bunch. Right, there's 4 here. So like we experienced earlier with our lovely lady, I forgot to ask her name. Did you put your name in here? All right, everyone has it, right? And it took a really long time to find your own. So now that you all have not your own, I want you to get up and find the person whose chit that is. So everyone get up. If you don't know each other, this is the perfect example to meet that person. I'm not in there. I'm not in there. So you have to find the person whose paper it is. Do you need some help there? Oh. But you won't have each other's. This is the point, is to mingle and match. Do you know that person? You don't know? So introduce yourself. Find out what they do. You have some trouble finding someone? Yes? Who is who? I know. It's great. That's the point. Some of you were lucky and you instantly knew the person whose name you had. Others not so lucky. You have to figure it out. So once you have found your person, I want you to snap a selfie. Who are we looking for? Who are we looking for? Vivek. Where is Vivek? There he is. Yes, easy. Who are we looking for, Marilu? Rihan. Rihan, raise your hand. There's Rihan. Who are we looking for? Very good. Very fun. Very good. Very good. Introduce yourselves. If you don't know each other already, I want you to open your mobile phones. I want you to follow each other on LinkedIn. Thank you. Yes, definitely. You can find me on LinkedIn. Xine Fernandez with an S. All right, first one. Yeah. Thank you so much. How's that for instant networking, right? So once again, I want you to take out your mobile phones. Make sure you follow each other on LinkedIn. I don't know if you've ever heard of the 7 degrees of separation. The 7 degrees of separation means that you know every single person on this earth within 7 parameters. People know people. Friends know friends. I know a guy that knows a guy that knows a guy that knows a guy. Even the most famous person in the world that you can think of, you know someone who knows them. And LinkedIn is a great way of showing you how close you are. If you're a second contact, third contact, fourth contact. So let's try and bridge that gap and make the world a little bit closer together. What I also want you to do is take a few selfies or ask the people around to take photos of you. We've got some lovely banners across the room. We got some lovely banners across the room. Feel free to use them, move them around, get some good lighting. Take a picture by the banners, and I want you to use the hashtag health2conf. Health, the number 2, CONF. There you go. I put it there for you. You want me to take a photo for you? Oh, sure. Thank you. All right, there are more banners around the room. Feel free to move them around. Yes, lovely, lovely, lovely. I'm just going to take 2 more minutes of your time. I promise, just 2 more minutes. Because as we wrap up on day 3, we have to look ahead to our next conference. It's happening in the US and once again here in Dubai. If you are looking for a special panel spot, or maybe you want to have a little booth outside in the lobby, you can go check out our Conference 2.0 booth at the registration desk. You can go speak to Jatin. He will be able to help you and let you know what's available, because the slots are filling up quite quickly. And this event's success is largely due to the exceptional contributions of our delegates, exhibitors, hospitality, and media partners. Your remarkable support has made this event incredibly successful and a huge achievement. A massive thank you to our bronze sponsor, LifeSpin GmbH. And the time has come for us to say goodbye. So with this, we conclude the Health 2.0 conference in Dubai for 2024. We do look forward to reconnecting with you online through socials, whether it's Instagram, Facebook, LinkedIn, anything like that. You can follow me, Maxine, not Max Out, Max In, Fernandez with an S. Yes, simple, Maxine Fernandez. You can follow me. I'm connected with all of the organizers, so if you are looking for that, you can contact me. I'll get you in contact with the right people. So I wish you a fantastic weekend that's coming up. Tomorrow is Friday. Happy Friday. And I hope to see you again next year. Take care and be happy.